Good morning. Want to call to order the November the 14th, 2017 meeting of the Sacramento County Board of Supervisors, and we want to welcome you all here. I know we've got some presentations, and we started off with a fire drill, and hopefully that'll be one of the highlights for getting the meeting started anyway, but we've got some other highlights, obviously, in recognizing a number of you for your contributions, and we have a number of reports as well, and a fairly full agenda this morning. So with that, again, welcome, and I'll turn to our clerk to make the announcements, and then we'll do the Pledge of Allegiance. Okay.
Supervisor Cerna?
Here.
Kennedy?
Here.
Peters? Frost?
Here.
Natoli?
Here.
And you have a quorum. This meeting of the Sacramento County Board of Supervisors is cablecast live on Metro Cable 14, the local government affairs channel on the Comcast, Consolidated Communications, and AT&T U-verse cable systems. The meeting is closed caption and is webcast at www.sacmetrocable.tv. Today's meeting will be repeated Friday, November 17th at 6 p.m. on Channel 14. A DVD copy is available for checkout from any local library branch. Members of the audience wishing to address the board may fill out a speaker slip and hand it to staff. When the chair calls your name, please come to the podium. Also, please silence your electronic devices at this time.
Good. Well, thank you. I don't have any forms. I know we got a little late entry in here, so if you do wish to speak an item, I know some of these are timed items and you're here for those specific items, but if there's any item, particularly on the consent calendar, that you wish to speak to, please get a form to either Stephanie and Renee up in the back, and or to Flo, and we'll call upon you here in a few moments. So with that, Ms. Newton, if you'd lead us in the Pledge of Allegiance, please.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Turn to the clerk first. I know a couple of items that you wanted to call out, so.
Okay, for your consent matters, items 1 through 29, you also have an off-agenda item. On the off-agenda, it's the resolution supporting the submittal of Proposition 1 grant applications administered by the Sacramento San Joaquin Delta Conservancy, by the Sacramento Valley Conservancy, and Ducks Unlimited. I do need a motion first to hear the matter.
Okay. Chair would move.
Second.
Moved and seconded. Please vote. Necessity to hear.
Unanimous vote.
Okay. And I would just note, I want to thank our staff for preparing this. There's a deadline of actually submittals by November 30th, and since this is the last meeting for November, we were going to run out of time, so I know there was a scramble over the last couple of days, so thanks to Michael Peterson, Michael Penrose, Don Thomas, and anybody else who was involved in this for helping with this. So I would move the off-agenda item.
Okay.
Move. Okay, please vote.
Unanimous vote.
Thank you.
And for your consent matters, items 1 through 29, you are adopting an ordinance for item 18, an ordinance amending Chapter 16.80, 81, 83, 84, and 87 of the Sacramento County Code relating to payment of development fees through the statewide Community Infrastructure Program. You waived reading on this and continued today for adoption.
Okay.
And that's all that I have for your consent matters.
All right, turn to my colleagues to see if there's any items you want to pull off the consent calendar or comment on. Supervisor Peters?
Yes, I'd like the record to reflect I'm recusing myself from items 18 and 19 due to potential conflict of interest.
Okay. Supervisor Frost? Okay. Ms. Kennedy?
Comment on item 16.
Okay. Comment on item 16.
Item 16, authorization to execute an amendment to the revenue agreements for law enforcement rotational tow services to reduce the referral fee from $50 to $25.
Great, thank you. Mr. Chair, members of the board, I just wanted to make a brief comment here. It's not substantive to the actual action in front of us, but it does remind me, and I suspect it would remind others on this board, about some of the challenges we're currently facing in each of our respective districts when it comes to towing contracts and towing activity for RVs and boats that are derelict, and the subject of code enforcement activity. As I discussed, and perhaps you all as well did discuss with our CEO, this is something that we are continuing to express concern about, especially hearing from some of the tow companies that feel that it's extraordinarily expensive for a variety of reasons to to tow these, especially the RVs, from residential neighborhoods that have been abandoned or otherwise derelict. And I think it's incumbent upon us to perhaps get a report back or understand from the appropriate executive personnel what we're doing to help expedite the agreements that need to be in place with various towing companies to make sure that we're responding timely to our constituents' needs to have these types of RVs and boats removed from residential neighborhoods.
Mike Penrose, our Deputy County Executive, is going to speak on that. That is an item that I think all districts have mentioned that to us. It's a pretty important item for us. And Mike?
Good morning, members of the board. In the context of the towing services contracts that we have in code enforcement, which is why you're making a distinction between this item and the other item. We currently do have a contract in place that does deal with abandoned RVs in the public right-of-way. It's a very expensive process, and it's one that we're continuing to look at ways that we can improve the response times that we can apply to getting those out of the right-of-way, because there are certain constraints, as you know, in terms of noticing and all those things. The one area that we don't have a good solution in yet, and we're beginning to see what we can do from a contract perspective, is dealing with the boats. In the public right-of-way, it's a real challenge. Right now, there's not a good, clear assignment of who has the responsibility for dealing with that, as well as getting those picked up and then cleaned and stripped and handled in a way that you can dispose of the boat. So it is an area that we're looking at how we can improve that, but we currently don't have a great solution for that from a towing perspective.
So Mike, let me make sure I understand. We don't have, it's not codified enough in our code enforcement regs about boats?
No, it's not an issue. It's not an issue of the right to remove the boats from the public right-of-way. Okay. It's the mechanism. If you get a boat that's on a trailer, we can hook up to that and get that towed out.
But we're finding boats that are not
exactly, and that's one of the challenges. So that's why I'm saying we are trying to, within the county, identify the best method that we can deal with the right to pick it up and dispose of it, as well as the way to collect it, right? To actually get it, and then there's some disposal issues associated with hazardous waste and other elements that are tied to boats. So it is something that we're working on, but we don't have a great solution for it right at this point.
As we get closer to having a solution, this is an item that's been difficult for us to get a solution to, but we will communicate with each board office and come back to the board if we need additional monetary authority at this point. That's part of the issue we're running into. Who's going to have the contract to help tow these things away?
Well, I was going to suggest that maybe after the beginning of the new year, or perhaps as a subject matter of our retreat that's coming up, might be something we want to delve into comprehensively, not just the towing item. I mean, I think it's fair to say all 5 of us are seeing more code enforcement violation activity, and I would just like to have a better understanding, speaking for myself, about what it is that we're doing to adjust our enforcement efforts. What is it? What is some of the messaging that we should be responsible for delivering to our constituents about what we are doing differently, and perhaps the application of new resources, and not to give them a false expectation about doing a lot more soon, but I want to make sure I'm accurate with my constituents when they express their concerns about why the RV hasn't moved for a month. I want to have a good answer for them.
Understood.
Okay.
Yes.
Supervisor Peters?
Mike, I know you haven't been in charge of this for very long, but this is a subject that I've been talking about for 2 or 3 years now, particularly related to RVs and the disposal because of the waste that's left in the RVs primarily. And I think on those, it's really all about the money. It used to be that the guy that was towing it could get recycling fees at the other end, and now that is not, it's just not working for them. They're not getting the kind of money they need. So we may need to come up with a monetary solution from the county, because it has been going on for some time. Now you've got homeless people sleeping in RVs, but in addition, people get tired of their RVs, they get old, they get broken down, and they just leave them, and it's full of icky stuff. And I think we need to come to a resolution on this sooner rather than later.
Understood.
Thanks.
I'd just like to weigh in, too, that it seems to me that we've got the ability maybe to address this more in-house than not. Obviously, the Kiefer landfill, you have to properly dispose of materials, but we have a facility out there where we take in a whole lot of different types of products and handle them appropriately and make sure they're disposed of properly. And it seems to me that maybe we need to convene quickly, but maybe briefly, a task force and get solid waste involved, code enforcement, obviously sheriff and CHP. We dispose of boats. We can take them out of the rivers and waterways. We don't do it in great numbers, but there's the ability to do that. And I just think with RVs, because I can tell you what happens in rural areas, if they sit there very long, then guess what? They get burned, and they certainly get stripped, or they become the object of attraction for more dumping, and so I think, again, our folks are certainly working hard to be responsive, but it's an issue of blight in our community, and it's inappropriate behavior, and if we can, follow up with folks and certainly hold them accountable, that's one thing, but a lot of cases, that's more difficult to do than just disposing of it properly. So, again, I don't know what sort of resources it takes, but I believe that we have the ability to, if nothing else, remove them quickly. Not that we want to be storing anything out at Kiefer or anyplace else, but I think we have the ability to get them out of our roadways to get, not become an attraction for other types of activities. And so I'm going to suggest that maybe even sooner than the board retreat, that you come back in January with at least who you're going to convene, and Mike, maybe you head this up, or you get the sheriff involved, and like I say, some of the other agencies, but I don't know if it's a resource issue, or if it's a combination of things, but leaving them for days and weeks and months in some cases, because we don't have any mechanism that, and we're challenged by that. Time's come for us to kind of figure that out, and I think we have the wherewithal to do that, so I just would offer that. So I don't know, Mike, if you have any comments?
The only thing I'd like to share is I don't want you to be misled to believe that we're not dealing with RVs. We're towing somewhere between 5 and 10 a month currently under the current contract, but there are a number of related issues, some of which you've articulated in terms of disposing of these, as well as notification rights and a number of things that go with being able to remove them from the right-of-way. But I understand completely what your request is, and we'll be able to respond.
And Supervisor Frost?
So it's not just the cost associated with towing. It's not like we can just give more money and they can tow more vehicles.
That's one of the elements that will help, but it's not only that. Yeah, it's resource. You've identified a number of the issues that are related to dealing with both RVs and vessels in the public right-of-way.
And sometimes it's on private property, but it looks like it's on public property, and we can't, we don't deal with it if it's on private property. It's the owner of that property that has to do something about it, and they may or may not be motivated to do that.
What is the cost differential that the towing companies are saying we are paying to get rid of the RVs? What are they paying to get rid of the RVs?
I don't have that number with me today. For us towing them, it's significant. It's on the order of thousands of dollars to have them towed and removed from the right-of-way. I don't know about the back end as it relates to the towing company.
Well,
I can get that information.
And it's also a toxic removal, disposal cost as well, right?
So as we refer this to staff?
Yeah. Yep. Just get a report back, and maybe do it early in January with at least, some of that data, the information, kind of where you think you're headed with this, and let's do it quickly. So, okay. You want to suggest any particular date for report back?
Not at this point. We will communicate that back to you.
Okay. For first month of 2018, though.
There you go. There's the date.
Okay. All right. Okay. All right. Thanks, Mike. Thanks, Nav. I did have just a comment on item 6, and then I also had a question on item 10, so maybe call it.
Item 6, notice of intended public auction of tax defaulted property and resolution authorizing the sale at public auction of tax defaulted property.
Yeah, I just wanted to express a thanks, appreciation to several county staff members. With respect to one property that's listed here, I won't go into the detail, but difficult circumstances, not unlike a number of these where folks have fallen behind in their taxes and for a variety of reasons, but where the house is occupied by a party who had been caretaker, and the property is going up for tax sale. But I spoke even last afternoon and evening with both county staff and with the tenant, and I think they're well aware that the property is going to be offered for sale, and they may have to find other housing. We'll try to provide some assistance, but I want to thank county staff for their research. And we had conversations with Keith Floyd and with Ben Lamera and with Christina Wynn from the assessor's office, but I want to thank folks for their sound advice and counsel and help in this regard. So, yeah. That's all I had.
Item 10, approve the award of contracts for specified voting systems and authorize the county purchasing agent to complete negotiations and execute the contracts with each vendor for specified voting system solutions.
Yes, just very briefly, and I know I've talked with the county executive, I know Jill Levine's here. In my briefing yesterday, I had a question about whether, because it wasn't clear, and I guess it's still not certain as to whether we were actually leasing or purchasing, and I think that's still a matter of negotiations, but I guess I'm now curious as to if the registrars then authorized to make a decision, is it the county executive, does it come back to the board, or where are we with that? Because it's not really clear in the staff report about that. He made the selection and choices, recommendations for the various aspects of what will be the construct for the going forward, but it doesn't say about the hardware and software.
We are in the process of negotiating the contracts now, looking for the best, of course, and we're working with our Craig Rader from purchasing, and you have given him authority to negotiate these contracts. So that's where we're at this point.
So, Jill, that kind of raises the question then, are you looking to a combination of lease and purchase, depending, because you've got a number of different vendors here that are going to perform different tasks. Some of that comes with hardware, some comes with software, some comes with outreach tasks. And so I guess I'm curious, and with that mix and match, does that all line up with the life expectancy of maybe a piece of hardware that we would purchase, but or to lease the software, or vice versa? I guess, again, without getting too deep into details, we're making a major investment of well over $3 million, maybe more than that, maybe approaching $4 million, depending upon how we approach these. So,
and I can tell you, we've worked really close with Rami from DTEC with his technical knowledge of best to lease, best to buy, and his experience there. So that has been very helpful. So that's where we are in the negotiation. So it could be a combination of both, but we want to make sure that when we get done, we have the best for the county for the long run. So at the end of our lease or end of our purchase, that we still have the best for the county.
So when will we know that? I mean, obviously, the clock's always ticking in elections, because there's always cycles. But I guess where are we as it relates to those decision points? And again, is it you that makes the decision? Is it the county executive, or does it have to come back to this board? Or today you get the authority to do that, and then you get the best price, the best set of circumstances, and
Supervisor Natoli, I think the resolution delegates it to the purchasing agent to finish the negotiations. That's where the authority we're seeking, with input from folks like Jill and our Chief Information Officer.
Okay.
Yep.
And that's going to be done, what, has to be done in the next few days, next few weeks?
We actually have a meeting this afternoon to continue working on one of the contracts, yes.
Okay.
So.
Okay. While you're there, Jill, very quickly on a related matter, and it's touched on briefly here with some of the activities, but I know that we had some discussion as we decided to go forward with the vote center approach, and and you've been doing a number of community forums and outreach to a whole host of community groups and other parties. But part of the question that I think was kind of left to be answered later was whether there was sufficient funding and resource support for not only for you, but any folks you would need to employ to do that. And as we now get close to that, kicking off the election cycle for the June primary and the general, obviously next November, I guess, and whether you can answer that today or not, but I would say before the end of the calendar year, which we have 2 more meetings after this, we might have some broader discussion about the outreach and how it's going. But secondly, is there sufficient resources, whatever that entails, for you and others that are doing that, to make sure that, in addition to the hardware and software and having the best deal and having, the best approach for the voters of this county, are we going to be able to get the messages out that we need to relative to something that's going to be very new to a lot of folks? So.
That's a tricky question.
Okay.
I can tell you that since June, we have made 64 presentations from our office to about, different local community groups, big groups, Rotary clubs, language clubs, that type of thing. So we have made a huge effort already. We've got several more planned for the future coming up, city council meetings in many of our cities here in the county. We are looking at our budget again. I've been talking with Britt. We've been looking at our past budget, our new budget, and there's things in our past budget that we will not be needing with the new system. And there are things that the chosen vendor will be assisting us with. Our biggest cost will be the postcards, as required in this bill, is that we have to mail out 2 direct point of contacts, direct contacts to all voters in the county. So that is what we're looking at right now, and like I say, we're working with Britt and our communication officer in order to kind of put everything in line and put definite prices on all of this.
Mr. President, Tony, I'm also going to be working with Jill and our clerk to have a report back to you on the status on all the outreach that's been done, and what kind of feedback are we getting.
Okay,
I'm looking at a December time frame.
Sure.
But I want to work with Jill to make sure she's done all her outreach, so it's either December or January. We'll be back to you on that.
Okay, well, I think it'd be important, and again, I didn't want to, I knew you were working on it, I didn't want to, jump ahead too much, but I think, again, as time gets short, and obviously the task of putting in place new voting systems and doing all the things that are required by law, but I think the outreach is the underlayment for a lot of that activity, and certainly which will be ongoing right up until probably Election Day in June, because I'd say it's going to be new to a whole lot of folks. It may not be foreign to them, but it will be new, and obviously how people can cast their ballots and how they're made aware of what those opportunities are is going to be very key to certainly turnout, but also people exercising their right to vote. So. Okay, so we'll be looking at maybe December before,
December, January,
Okay. All right, very good. Thanks, Jill. Thanks for being here. Okay, that's all the questions I had. All right, I had no one sign up on the consent calendar, so is anybody from the audience wish to address any item on the consent calendar? If not, if there's no other questions, then I'll entertain a motion on the consent calendar. Okay. Chair would second. Noting recusals on 18, 19, you got that? Okay. Supervisor Peters? Okay. Please vote.
Unanimous vote.
All righty. Very good. Thanks. Okay, then we'll go to, we have a number of presentations, I believe.
We do.
Taking from the framed resolutions that are there at the dais.
Can you tell? Okay, so for items 30 and 31, I'll be calling them together. It's the presentation of resolution recognizing the Sacramento Kings Foundation, Good Tidings Foundation, and Kaiser Permanente. Also, it's the presentation of resolution recognizing Kaiser Permanente, Kaboom, and Southgate Recreation and Park District.
Okay, very good. And I believe Supervisor Stern is going to do the honors here, so Bill, I'll let you take it from here.
Well, good morning, Mr. Chair and colleagues, and those in the audience this morning joining us in chambers. I don't know if you know, but once in a while I get a chance to go out and play some golf. And occasionally, I'm not that good. You don't want your elected officials to be that good at golf, quite frankly. But when I do go out, occasionally, a long drive will keep you coming back to play more of the game and hopefully hone your skills. This morning, we have, in my estimation, a long shot, a long drive. This is a great morning. We get to celebrate the culmination of a number of community partners that came together recently to do some great work in the South Oak Park, Fruit Ridge Pocket neighborhood, and the district that I have the good fortune of representing. This is the unincorporated area roughly between 14th Avenue, Fruit Ridge Road, MLK Boulevard, and Stockton Boulevard. Again, in the South Oak Park, Fruit Ridge Pocket part of the county. And I'm going to try and manage this as best I can with the assistance of my capable staff. We have a number of resolutions to acknowledge quite a bit of volunteered time, effort, materials to the construction of a new playground at the Jack Davis Park, which is really the only parklet that is managed by Southgate Recreation and Park Districts that serves this community, as well as the construction of a Purple Kings full court basketball court for the community. So what I'd like to do is just say a few words about both projects and who was involved, and then I believe we're going to see a brief video. And while that video rolls, I'm going to ask everyone in back of me that had something to do with both projects to come join me at the podium. So first of all, let me talk about the Kaboom Playground. I think many of us on the board and local elective office know in this community the great work that the Kaboom organization does. This is here's some imagery here on the left and right of chambers of the actual construction. But Kaboom is an organization that goes out and has these volunteer days, recruits sometimes hundreds of volunteers. And in this case, I think we actually had about 200 or 300 volunteers. You pick a Saturday, hopefully the weather cooperates, and it's a modern day barn raising of sorts. We have people out, setting concrete, putting up the new playground equipment, setting the bark chips down on the surface of the playground. It's kind of a beehive energy out there at times. Having been out there for this, I was recruited right away to pour some concrete myself, and it really is an amazing effort to witness and be part of. This was, I think, the third playground construction project that I had the good fortune of participating in the district I represent, but certainly the first one that's serving the South Oak Park Ridge Pocket neighborhood. And so Kaboom and Kaiser Permanente were the principal contributing corporate sponsors for that part of that great day when we had a ribbon cutting to celebrate at the end of, again, a very busy day, the construction of the playground. And then next to that playground, you can see there we had the Jack Davis Park Court that was completed, and this was something that has been in the works for the last couple of years. I don't know if Scott Moak is here or not from the King's Foundation, but Scott is also a First Five Planning Commissioner, as you all know. He and I have been talking for several months about this project. At the park, previously we had a half-court basketball court, so the intent was to not only have a new surface, but to expand the surface and provide a full court basketball recreational opportunity for the community there. And as you can see by the slides, it turned out great. So at this point, what I'd like to do is, again, roll the video and then have everyone associated with both projects come up and join me, including all the contractors I see in back of me, and I'll recognize them by name after the video.
Okay, great.
The event today is Kaboom. We're rebuilding the playground structure. Kaiser's a big partner. Supervisor Phil Cerna has been awesome in this area, not only with this project, but many others. So a lot of entities have come together to really just do and give back to this community that richly deserves it.
I gotta tell you, this is so rewarding to see an army of volunteers out here for a day's worth of work, participating in a modern barn raising, essentially, to get this playground built. So I first and foremost want to thank all the volunteers to spend your Saturday doing what's in the best interest of this great neighborhood.
It means community pride, first and foremost. It means the community and our elected leaders and organizations working together to build something beautiful that everyone can benefit from.
All right, terrific, thank you. So again, number of individuals, organizations were responsible for what you just saw there in the short video snippet. I do want to call them out, and please forgive me if I miss someone, just tap me on the shoulder or club me over the head or something. But we have Josh Harrison with Harrison Concrete Cutting. Ward Winchell, Eric Jones, and Stephanie Vollmer with Southgate Recreational Park District. What are you guys doing up there? Get down here. Is Dr. Lisa Liu here? Yeah. Oh, very good. I saw you earlier. Okay. Michelle Adele, Director of Public Affairs with Kaiser Permanente. We have our own Chief Lee Seal, Chief of Probation. A few words about our probation department. They've really adopted this park, not just with regard to the construction of the playground and the basketball court, but over the last few years, having expressed a real driving intent to improve the quality of life out in that part of our county, Lee Seal and his probation officers, those that serve at our youth detention facility, have volunteered a great many hours out cleaning the park, helping us with broader neighborhood cleanups, and so I do want to certainly recognize all the great work by your department chief. Is Faye Wilson Kennedy with Black United Fund of Sacramento Valley here? I was told she might be here. Okay. You saw Michael Blair, the head of our South Oak Park Community Association in the video. I don't think he's here this morning, but I do want to publicly recognize him. We have Michael Smith with Tykert. And Tykert came through big time with provision of the materials. And let me tell you, some of you know that before I was in elective office, I had a small project management consulting business, and as I let everyone here know, in the few weeks leading up to the construction deadline, because we had to beat the weather, it really felt like the good old days, trying to manage schedules and budgets and personnel, and certainly I didn't do it alone. I had a lot of help, but it was actually good to kind of get back into the swing of project management for a bit there. Larry Gualco with Lennar. We have Nick Abdis with the Thomas Law Group. Nick was really kind of the lieutenant on this, helped find a great number of contractors, those that were supplying materials and doing the work, so hats off to Nick for his contribution. Perhaps the largest physical lift here was laying the court itself, the asphalt for the court, and I want to thank, where's Jason? Jason Pasquetti, with J.D. Pasquetti Engineering. He literally had the largest piece of equipment I know that park's ever seen placed on its property there. It's probably the same piece of equipment that's used for building roads. He had a laser grader out there as well, and was able to take the materials supplied by Tykert and do the court in a few days. And I was out there every day. In fact, I took our chair, Don Natoli, out I think a couple times to see the progress, and it was pretty amazing to see what's involved with building a basketball court. There's a lot more to it than you'd believe. Adam Barrows with GR Trucking. Of course, we couldn't get started unless we demoed the old court and some of the associated walkway and retaining wall, and that had to be trucked away. And so GR Trucking certainly deserves a lot of credit for their help. Peter Rozakis, a good friend, is here, who's one of the owners of the firm. And so did I miss anyone? Nick, you're my lieutenant. No?
I think you got them all.
LNS Concrete, they did the actual demo, right? LNS Concrete.
They laid the concrete.
Okay, they laid the concrete. There was a number of associated walkways and retaining walls after the court was completed that had to be constructed according to code and the architectural drawings that Southgate Recreational Park District committed to providing. So hats off to LNS as well. So with that, I want to say thank you. As I told everyone at the beginning of the project, we were going to do this once it was all completed. We had a great ribbon cutting. The most satisfying thing of all is, because I'm out in that neighborhood quite a bit, is actually seeing the community members using it and using more of it. I mean, they're out having basketball games. They're enjoying the new playground. We actually are adding some property, as some of you may know, to the park by way of an adjacent parcel that was tax defaulted, and we're continuing to work with partners at Southgate Recreation and Park District to actually add property and more green space to that area. So again, hats off to this terrific team for all they did.
Mike Penrose.
And the chair just reminded me, our Director of Public Works, Mike Penrose, came through big time with some last-minute construction of some sidewalk and drainage that was very important to make sure that we didn't have any kind of trip hazards getting to and from the court. So thank you to Mike as well. So with that, everyone, as you can see, has a resolution acknowledging this great project and their contribution. But I'd like to invite anyone that would like to speak to come forward. I know Ward, as head of Southgate Recreation and Park District, wanted to share a few words.
And Phil, as Ward's coming up, I just want to say thank you to you for your leadership as well. I did have a chance to view a couple of different phases of the deconstruction and the construction. It was pretty amazing. And to use your golf analogy, I don't think it was a long drive. I think it was a hole-in-one. You aced it on this one. So good job, all of you. So.
Yeah, I just wanted to thank all the participants on this project from the Southgate Recreation and Park District Board of Directors and the staff. There's a lot of big issues going on in the county, a lot of long-term projects, a lot of really difficult challenges socially and budgetarily. But really, everyone worked together on this, all the people behind me and lots of county staff. We got the project done basically in like 2 months from the design kickoff to completion. So it's just amazing to be a participant. I'm really proud to be a part of this community that can do something this important. It's just a small acre park, but it'll make a big difference in this community. So thank you.
Thanks, Ward.
Good morning, Michelle O'Dell with Kaiser Permanente. In the 4th year of our partnership with the Sacramento Kings, we were able to do a basketball court in high-need areas. So we've done 3. This is our 4th one. So we had identified this as an area we wanted to do. And at the same time, we forged a national partnership with Kaboom, and we were also able to bring the Kaboom playground here. And this Jack Davis Park was the perfect location. It's been a labor of love, so I want to thank everyone here. I also want to thank Supervisor Cerna for championing this. It's a terrific opportunity for the neighborhood. We are so proud to be able to do these. We want to continue to do them. We're still looking for other sites around the community to build these courts. They make a huge difference for the families and the members who live in those neighborhoods. Thank you very much.
Thanks, Michelle. Thanks for guiding.
Okay, I'll just briefly say that, I reflect back on maybe 3 or 4 years ago. I took a truck with Supervisor Phil Cerna, truck drive, as many of you have throughout his district, and he showed me the areas that he's passionate about and his concerns, and we saw some things that were going on that were great, and also some parts of the community that really needed help, and they needed investment and they needed care. And this was one of those parks, and the neighboring area along Fruit Ridge, where there was the capacity to partner with the community and do some things really innovative as part of what we called then the Reducing African American Child Death Initiative, and we're going to talk a little bit about that later today. And what we see today, because of his leadership and what he's inspired us to do to partner with the community, it's had a really transformative effect, and I thank you for that. Our officers have really enjoyed being a part of that community, and the kinds of things that are happening there. There's still a lot more work to be done, but we're thrilled to be partnering with all these great leaders behind us and community providers. So thank you, Phil Cerna, for your leadership.
Thanks, Lee. any construction guys need to speak up. You guys did all the work, so.
Yeah, I was going to say one of the construction guys can come up here. I just wanted to say thanks again to Phil for his leadership on this. When I got the phone call that there was this need, I knew exactly who to turn to, and it was Peter and Adam from GR Trucking and Jason Pasquetti and Larry Gualco and the guys at L&S and Josh Harrison. I mean, they didn't even hesitate when they got the call. So it was an incredible coming together of a private-public partnership, and the real beneficiary is the community down there. So again, I think I speak for all these guys. It was really our pleasure to participate in this, and having that grand opening and all those smiling faces, and from what I understand from Ward, families that are gathering, and that this is really becoming the center of neighborhood life out in this community. Again, it's really something special. So just glad to be a small part of that. So
thanks for your
thank
effort,
you.
Nick. Thanks, Nick.
All right, so now, as is customary, we're going to, I think since we've got such a large group, move into the center area and take a photo here.
Larry and Jason in back, that's right, yeah. And Lee. Good. Thank you, Phil. Good job. Once again, thanks to all of you, and certainly to the broader community for responding, and thank you, Phil, for your presentation. Made Jack Davis proud, I'm sure. Okay. With that, then, a little behind the agenda, but we're going to continue this next item, so let's give folks a moment to exit. Okay. Go ahead. Hello?
Okay, item 32 is the cents per ton funding allocation program. I need a motion to drop this item.
We're going to drop it?
We're going to drop it, work with the CPAC, and then bring it back to you.
All right.
Move. So
Okay.
Second.
All right, move and second to drop item 32, and it'll return to us after it goes to the CPAC. Please vote.
Unanimous vote.
Good. Thanks to Leanne and Surrender for responding so quickly this morning, so, no, thanks.
Thank you, Leanne.
Okay. Our next.
Okay, our next item, item 33, is the Sacramento County Child Death Review Team and Fetal Infant Mortality Review Team 2015 Annual Report.
Okay. Our presenters who are veterans at doing this, so good morning and welcome, and appreciate your work on this, and turn it over to you, Sheila.
Good morning. We're delighted to be here. I'm Sheila Boxley, the President and CEO of the Child Abuse Prevention Center, and for the last 26 years, we've been the home of the Child Death Review Team. And I think, yes, we do have a slide up. Okay. We are very honored to be here to present this report, and I want to start out by mentioning that the format is a little different in one very important way, and that is this is the first time that we've combined into one report the Child Death Review Team and the Fetal Infant Mortality Review Team. And we think that that's a very positive change because it's really going to give a broader picture and more information in one location that's really interrelated. So we think that's going to be very helpful. I will remind you that the mission remains the same. The reason for the team is that we're looking at ways to prevent children from dying. And even though the penal code section that authorizes child death review teams really focuses on child abuse fatalities, we are very fortunate that for the last 26 years, this team has looked at every death of every child 0 through 17 in this county, regardless of the cause or the manner of death. So it's a very comprehensive document, and we especially want to thank the Children's Coalition for the continued funding through the Children's Trust Fund, because a report like this is not something you can just kind of do with volunteers and make happen. It's a very sophisticated process. I also want to thank the 24 different organizations and the individuals who represent them who are part of the team. Because the way this works is that it requires that we have all the relevant disciplines represented on the team and sharing their information. So thanks very much to them as well. And you will also see, those of you who are veterans and have seen many of these reports, that this one has more pictures and less words and is a bit more colorful, and so we hope that it'll be a little easier and more user-friendly for people. Very importantly, though, we have also organized it a bit differently so that you will see there are 3 areas or types of deaths for which we have more intense thematic reviews, and that includes infant sleep-related deaths, child maltreatment, and fetal infant mortality. So hopefully that will also be helpful to you and others in terms of using the data. It is my pleasure to introduce to you Dr. Michelle Evans. She is the Vice Chair of the Child Death Review Team. She is a pediatrician with Kaiser, and she also serves as the Medical Director of the Northern California Child Abuse Services and Prevention Program. And I should tell you, in addition to being a great partner on CDRT, she has also been a great partner with us in the Safe Sleep Baby program and also in the Planning for Child Abuse Prevention Month. And so with that, I will turn it over to Dr. Evans.
Good morning, Dr. Evans. Thank you for being here with us this morning.
Good morning. Thank you. It has been my pleasure to serve on the Sacramento County Child Death Review Team, and I'm going to share the findings. So, okay. So there were 126 children who died in Sacramento County in 2015. 124 of them were Sacramento County child residents, and of the 2 out-of-county children who died, these were injury-related deaths. In 2015, the child death rate decreased from 37.4 per 100,000 children. The out-of-county children are not included in this death rate. This is a decrease from the 2013-2014 death rate of 36.4 children per 100,000. If we look at 2014 alone, the death rate was 37 per 100,000 children. This chart shows the number of 2015 child deaths among Sacramento County residents only. So in 2015, the death rate decreased by 2.3 from 2014. And out of the 124 Sacramento County resident child deaths, 20% had an injury-related manner, 71% died of natural causes, and 5% were undetermined. So this shows the kernel density distribution of the place of residence of all Sacramento County resident children who died in 2015. The darker regions indicate a higher concentration of child deaths, and you can see toward the center, the largest concentration of deaths was in the Valley High area. And the Valley High concentration may be related to a high child population density. This looks at the number of child deaths by manner and race for 2015. So of the 124 Sacramento County resident child deaths, 28% were white versus 35% of the population. 24% were African American versus 10% of the African American child population. 21% were Hispanic versus 31% of the child population. 15% multiracial versus 9% of the child population, and 12% were Asian Pacific Islander versus 15% of the child population. So in 2015, there were a total of 9 child homicides. 3 of these were determined to be child abuse and neglect homicides. This is compared with 5 in 2014. 6 of them were third-party homicides, and of these third-party homicides, 2/3 of the perpetrators were involved in gang activity, and half of the deaths were associated with gangs. Now this looks at the number of child deaths from the 11-year period from 2016 to 2015, and these are 3-year rolling averages so that we can smooth out the yearly fluctuations. The overall deaths decreased from an average of 174 per year in the 2004 to 2006 period to 130 per year in the 2013 to 2015 period. The number of infant deaths decreased the most from an average of 105 to 79 during the same period. And the number of deaths decreased in all ages except for the 10 to 14-year-olds. 61% of the resident child deaths were infants under the age of 1 year old. So this is another way to look at the child death trends. This is a rolling 3-year average child death rate from 2006 to 2015 for Sacramento County. The child death rate has decreased over this time period. We have a statistically significant decrease in injury-related deaths between 2006 to 2010, and in the 2011 to 2015 period from 10.1 to 8.2 deaths per 100,000 children. This is statistically significant at 97% confidence level. The death rate also decreased for natural deaths during the 2004 to 2015 period. So this looks at deaths classified by manner. So the deaths are classified as natural, injury-related, or undetermined. The undetermined category is comprised of cases that the coroner has determined insufficient evidence to identify the exact cause of death. An example of an undetermined death is an infant sleep-related death with not enough evidence to determine the cause or the manner and risk factors that preclude the determination of a SIDS death. So this shows a breakdown of Sacramento County child resident deaths by category for each year from between 2006 and 2015. The deaths due to perinatal conditions decreased from 3.03 to 1.86 per live birth between 2006 and 2015. This drives the overall infant mortality rate in Sacramento County from 5.12 to 4.06 per 1,000 live births over the same period. So next we're going to do a thematic review. So CDRT identified risk factors for all child deaths, deaths related to child abuse and neglect, infant sleep-related deaths, and fetal infant mortality. So this looks at a 12-year review of child abuse and neglect homicides. There were 69 total. We again have a disproportionate number of African American children. 81% of the children were 5 years and younger. 70% of the perpetrators are parents. So there were a total of 84 perpetrators of 69 child abuse and neglect homicides from 2004 to 2015. Male perpetrators are the most common in beating and abusive head trauma. And nearly all child homicide victims had a known risk factor. CPS was the most common risk factor at 80%. CPS involvement is unknown for 10 of the child abuse and neglect homicides. So this looks at the number of child maltreatment deaths and the percent of child abuse and neglect homicide deaths. So we have an umbrella classification of child maltreatment. These are deaths that involve some element of abuse or neglect. An example is a perinatal death that involves substance abuse or a drowning death that involves neglect. Child abuse and neglect homicide is a primary category of child maltreatment deaths. In 2015, 10 children were involved in child maltreatment deaths. And these deaths from 2006 to 2015 among Sacramento County residents decreased from 4.85 deaths per 100,000 children in 2016 to 2.77 deaths per 100,000 children in 2015. So this looks at the rate of child abuse and neglect homicides among Sacramento County residents between 2006 and 2015. It's a 3-year rolling average that has fluctuated during this period. There's a high of 2.0 per 100,000 children in 2008 and a low of 1.0 per 100,000 children in 2011. The 3-year period between 2013 and 2015, there were 1.4 child abuse and neglect homicides per 100,000 children. So this looks at the African American disproportionality for 2015. The African American child death rate was 81.7 per 100,000 children. This is compared to the overall Sacramento County child death rate of 34.7 per 100,000 children. These rates are similar to the 2013-2014 period. We did, however, see a 29% decrease in African American sleep-related deaths in the 2013 to 2015 period. So in 2013, 50% of infant sleep-related deaths were African American infants. In 2014, 36% were African American infants. And in 2015, 21% of infant sleep-related deaths were African American infants. So this looks at 5-year trends of African American child deaths by cause. These are the percentages of African American children deaths compared to the African American child population in Sacramento County of 10%. In 2011 to 2015, all child deaths among African Americans were from causes similar to prior years. So African American child deaths were greatest in child abuse and neglect homicides, infant sleep-related deaths, perinatal conditions, and third-party homicides. So this is a closer look at infant sleep-related deaths. So for the 2015 data, 100% of the infants were found in sleeping conditions that were known by the American Academy of Pediatrics to be unsafe. And 36% of these infants reside in neighborhoods that were not targeted by the Safe Sleep Baby campaign. We found a statistically significant correlation between a history of CPS referral and infant sleep-related death at a 99% confidence level. So an infant with a history of CPS referrals is 2.3 times more likely to suffer an infant sleep-related death than an infant who has not had a CPS referral. So I just want to clarify, this is referral, so CPS may or may not have had contact with the family, depending on if the situation met their criteria or not. We also saw a statistically significant correlation between a history of CPS referrals and infant sleep-related deaths in neighborhoods with very high economic risk at a 98% confidence level. There was no statistical significance between CPS history and infant sleep-related deaths when we control for race. So this is a closer look at the unsafe sleep conditions. 100% of the 2015 infant sleep-related deaths were infants in unsafe sleep conditions. 93% of the infants were not in a crib. And of those, 45% were known to have a crib in the home and were not using it at the time of death. This data is from known information only in the 124 to 215 child deaths. 83% had at least one risk factor. 45% had 3 or more risk factors. 60% of the families received some form of government aid. 50% had a history with Sacramento County CPS. 20% of the parents had a substantiated CPS referral as a child. 30% had a known history of illegal drug or alcohol use in the child's family. And 43% of the child deaths had a criminal history in the family. So this is another look at the risk factors. 55% of all 126 child deaths had a past or present family involvement with a CPS agency. And half of the deaths had families that were involved with CPS within 6 months of their death. So these are 2006 to 2015 3-year rolling averages of the percentage of deaths with specific risk factors over this period. And what we can see most dramatically is that poverty has risen over this period from 37% to 63% of decedents.
Excuse me, Dr. Evans, so 63% of all those where the deaths occurred, you did this rolling average, so the poverty level rose dramatically. Which subset, this is all families, or this is of the
This
ones?
is all of the child deaths.
All child deaths?
Yes.
Okay.
So now I'm going to turn the presentation back over to Sheila to review the recommendations.
Can I ask one question?
Sure, yes.
And I don't know if you have it at your fingertips or not, but since you have this graph up still, the AOD, alcohol, other drug percentage there at 39% in 15. Do you know what it was at the other end of that bar in 06? So do you know what the percentage was in 06?
We can find out.
Okay. All right. Thank you.
George, can you get a question? Okay. Could I just ask one other question? We have this chart up, though. So, with the exception of domestic violence, was a fairly flat line. We're seeing a rise in all of these risk factors. Is there any other determinants behind all of that? You see a rise in violence. You see a rise in the drug and alcohol involvement. Obviously, CPS is more involved, but you're still having a number of deaths. And in poverty, and again, I don't know what the definition behind that is, but obviously it's folks who are on some level of government assistance or on subsistence. So any other thoughts about that one can extrapolate? We're seeing, over the course of a fairly short amount of time, all the risk factors, with the exception of one, as you listed them here anyway, well, I guess maybe two, the medical piece is not a dramatic rise, but I guess I'm just...
Yeah, these are things that we're going to that Sheila's going to discuss more in detail in the recommendations.
Okay, all right, thanks. Thanks, Dr. Evans.
Thank you. I'm very glad that you had a chance to reflect on and look at this chart, because it really is the basis for some of the recommendations and thoughts that the team has had with regard to so what do we do with this? Because again, remember, our mission is to use the data to find ways to not only save children's lives, but also save those from injury. Because a lot of the kids, in fact, don't die, and we're very grateful for that, but they may have been injured or suffered severe trauma or other kinds of things that impact the rest of their lives. So there are 6 recommendations that the team is offering today. And the first one is that the Child Death Review team wants to bring together a subcommittee that is augmented by individuals in addition to those who are on the Child Death Review team to look at the last 12 years of child abuse and neglect fatalities. And part of the reason that we want to do that is related to that chart and what has been happening and changing. But importantly, it is a best practice now to do that kind of work. And the Federal Commission to Eliminate Child Abuse and Neglect Fatalities, in their report to the President and Congress, basically called out this practice and said that this would really be something that jurisdictions should undertake. And for example, Baltimore has already done it. And we have tried with the Child Death Review team to really keep up and always be on top of those best practices and ways of doing better and finding more ways to save kids' lives. I want to be really...
Supervisor Stern had a question. I didn't mean...
I'm sorry.
I had a question there, Sheila. And I hope I'm not going to get ahead of you here, but hopefully if it's the intent and we ultimately follow through with setting up a very focused committee structure to focus on can homicides, how is that going to intersect with, which is probably going to be one of the most challenging parts of the Black Child Legacy campaign effort, to focus on the disproportionality in the African-American childhood population when it comes to can homicides? I reflect back on the 41% that I saw earlier. So how are you going to work in conjunction? Maybe you've already given some thought to the architecture of working groups.
Yes, and you'll find in the more in-depth recommendation that's in the report itself that we've listed, at least at a minimum, the organizations or disciplines that would be invited to participate. And so that includes the current members of the Child Death Review Team, policy leaders, county agency directors from Department of Health and Human Services, Public Health, Behavioral Health, District Attorney, Probation, Law Enforcement, Coroner, City of Sacramento, and other cities, hospital systems, child abuse and neglect physicians, nonprofit agency stakeholders, domestic violence, home visitation programs, First Five, the Steering Committee on Reduction of African American Child Deaths, Black Child Legacy, and the Child Protective Systems Oversight Committee. So that's kind of a beginning of who would be involved. We're really seeing it as a subcommittee. This is not a brand new commission or something like that. It is to be very time limited and to come back with specific findings and recommendations. So absolutely it will address all of those risk factors. It will address disproportionality. Hopefully the committee will have that chance to go in depth. And part of the reason for wanting to do this now, other than the fact that the penal code tells us to do this sort of thing, is that with 12 years of data, we have 69 cases. And so that gives us enough scope, enough cases to really look at in terms of historical changes as well as what we could be doing. And I want to point out that I think that you know that children in their first year are the most vulnerable of child abuse fatalities. And what the research is telling us now is that for every infant child abuse death, there are more than 10 children who were seriously injured, life-threatening injuries. So we're not really talking about just looking for ways to prevent those deaths. We're really looking at not 69, but 690 kids, that volume of what we could really do to make a difference.
Injured that are reported or are not reported?
All we know about is what has been reported, not reported to CPS, reported maybe by a hospital because somebody comes in. And I think it is important to note that of those 69, only about 50% of those cases were current open CPS cases. So we're really looking at what can we all do and where can we find those intersections in those places to make a difference. So that is our first recommendation, and we really do believe there will be a significant value to that, and we would like to be back to you in 15 to 20 months with that and really start to take action. And we're not necessarily looking for, oh, gee, how can we find a whole bunch of money? We're looking at what can we do when we know more about these cases. The second recommendation is to expand shaken baby prevention education to include the dangers of abusive head trauma and beating, and to expand the engagement of male caregivers. We know that that is something important that we need to do. There were 48 child abuse and neglect homicides that were from 2004 to 2015 that involved beating and abusive head trauma, and so it certainly is a significant part of that population. 74% of the perpetrators were men. There is currently, we have a great partnership with CPS and the hospital systems to be providing education at this point about shaking babies. We want to expand that and really work with the Birth and Beyond sites, community incubator leads, First Five, CPS, Head Start, and schools to see if we can penetrate a little more, particularly reaching the male caregivers. The third recommendation is to develop a county-wide protocol for public and private agencies to refer families to support services when they identify in the family recognized risk factors for child death. And that, going back to the chart that you were asking about, is very, very important. What we see is that these families, when you look at that chart, what we're looking at, let me just say, is known risk factors. So that means they came to the attention of some one of those 24 agency members of the Child Death Review Team. So whether they got public assistance and that's how they were identified, or whether their risk factor was a prior CPS case or a domestic violence call that was reported, these are probably underreports. because not everybody comes to the attention of all of these agencies. But what we do know is that somewhere along the way, these families in large numbers, large percentages, are being touched, are being served by some public or private agency. And if we can begin to look at how we work better collectively so that when someone comes in and they need A, we don't only look at A, we look at what else is happening with that individual or that family, and perhaps make effective, warm handoff referrals so that people can get the services that they need, and ultimately try to reduce those risk factors, which obviously are very much a part of child deaths. And again, that is not just child abuse and neglect fatalities. We're really talking about looking at all types of deaths, because that's what the chart was showing you that Dr. Evans addressed previously. Okay. It's not moving. Okay. The next recommendation is to collect more data on third-party homicides so that we can effectively target intervention efforts, especially for deaths involving firearms and gang activities, as those are a very large part of that risk. And we do have a subcommittee of the Child Death Review team. It is the Youth Death Review Subcommittee, and they go deeper into these cases. And what we're looking at is that we don't have all the information that we really need, and need to go deeper into this area, because it is an area that is not necessarily declining in the same ways. And so that committee has really charged itself, if you will, with let's get deeper, let's bring in more partners and look more closely at those deaths to see if we can start to come up with some effective strategies. Oops.
Sheila, can I?
Sure.
On the first bullet there about deaths involving firearms and gang activity, one of the things that you're probably aware of is that the county and the city of Sacramento have recently invested in the ShotSpotter technology. Mm-hmm. So I suspect that's going to give us all kinds of new data sets about different things. Yes. But if some thought hasn't already been given to maybe how best to access that new tool, and not just relative to firearm deaths, but firearm activity, even employing some maybe GIS technology to understand the geographic nature of firearm activity shots that are spotted, and see how that might help inform more or less at the neighborhood level where we can begin to really focus geographically on the problem of third-party homicide, firearm-related third-party homicide.
Thank you. Yes, I know the team is aware of that, and that will certainly be a part of the analysis. And it will be, we hope, a helpful benefit in addition. The fifth of our recommendations are to expand training and education efforts to parents and caregivers of infants with Child Protective Services referrals to reduce the prevalence of infant sleep-related deaths. The good news is that the numbers, are better in some categories now for sleep-related deaths. We have an existing very good partnership with CPS in terms of that education, and you may know that at this point through all the partnerships that we do have cribs available, and First Five has been a very important partner in that. And when we give away cribs, because it's so important, and Dr. Evans highlighted that often people have a crib, they're just not using it, and the child still dies of a sleep-related death. So at this point, what we're doing is when we give away a crib, we also have I guess a little hook, if you will, because we deliver it and someone spends an hour with the family talking about why it's important and all the other kinds of protective factors for reducing infant sleep-related deaths. We feel like that we need to reach out more. I mean, as an example, what you saw in the information that Dr. Evans provided, we're doing a pretty good job in the areas there we're under contract to work with. But now what we're seeing is that there's increases in sleep-related deaths, or that a bigger percentage of them are in other neighborhoods. So it is a moving target. And certainly, I know we've talked about it before, but with sleep-related education, it's really something that has to be done continuously because there are new moms and dads all the time, and the fact that you told somebody else last year doesn't necessarily help. So it is an ongoing effort. And the final recommendation is to continue the effort to reduce the death rate of African American children. Obviously, there are other folks who are going to be here today who are going to talk about that and what the progress is and what the needs are, but the data continues to be clear and compelling that this has to be an ongoing priority at all levels. I will say that the good news that we can report to you in that regard right now is the reduction, the decrease that has occurred in African American infant sleep-related deaths. And, this is pretty preliminary because the effort has not been underway for a long time, so we're going to continue to monitor that, but there is a ray of sunshine there, if you will. So now I'm going to ask Dr. Kassiri to come up and present to you the part of the report that deals with fetal infant mortality. And then we'll all be here, so at the end of her presentation, if there are any other questions about the full report, we're happy to answer them.
Thank you, Sheila. Good morning, Dr. Kassiri. Good morning.
Good morning, Mr. Chair and members of the board. As Sheila mentioned, this is a new addition to the CDRT report because the fetal infant mortality review was being done internally in public health, and we were very glad that we were able to develop a partnership with CAPC to add this review to the CDRT report because we think that there's a lot of good information that could be shared, and having the two together would definitely be a good thing in providing information that we need to be able to move forward. The importance of the fetal infant mortality rates is that these rates are a bellwether indicator of the community's health, as many of the factors that affect the health of the entire population also affect these rates. So one of the things to note is that by California law, all fetal deaths have to that have advanced to or beyond the 20th week of gestation must be registered and receive a fetal death certificate. So the way that we selected the cases for this review included all deaths of infants born prior to the 23rd week of gestation, all fetal deaths that had received a death certificate, and in addition, we also looked at all fetal deaths to babies that were African American. Parents had African American parents, plus 25% of the remaining cases. So we had a total of 99 cases that met the criteria, and we were able to review 52 of them. The rationale for reviewing all of the African American cases, as you have seen with the CDRT data, and you see also with the FEMA data, is there is a disparity and that we needed to look at that to see what the factors were that we could address. So this is some of the information, and as you can see, close to about a third of the FEMA deaths reviewed were associated with pregnancy-related infections. This includes sexually transmitted diseases as well as others. And so as we look at prevention, this is an area that we need to look at, especially in terms of making sure that mothers start getting prenatal care early enough so that these infections are identified and treated. You'll also notice that umbilical cord accidents and premature rupture of membranes was also major issues that resulted in FEMA deaths. And these are things that also resulted in preterm births. Fetal exposure to alcohol and other drugs highlights the need for increased substance use support for women of childbearing age. including medication-assisted treatment, and also reducing the barriers to entering early prenatal care for substance-dependent mothers. As we have found, oftentimes mothers who are using substances will be hesitant to start prenatal care because of the fear that their children might be taken away or that they might be reported to CPS. So being able to work with them and make sure that they understand the importance of the prenatal care and being able to get treatment early enough is important. Another important thing is the health of the mother. As you can see at the bottom of the slide, 59% of the mothers were overweight or obese with a BMI of 25 or greater. The other thing that's not shown on here is diabetes and hypertension. These were also chronic diseases that were related to adverse child birth outcomes. We also noticed that prior fetal loss and prior preterm delivery were also important factors that did indicate problems for ongoing pregnancies. So it's important that when we do have parents who experience these losses, that there is ongoing care or interconception care, so that when they do get pregnant again, that they do not have the same adverse outcome. Looking at race, as we mentioned, there are disparities. For African Americans, constituted 21% of the deaths, although they constitute only 10% of births. For Caucasians, 26% of deaths, whereas they constitute 39% of the births. For Hispanics, it's 13% of deaths compared to 27% of births. An interesting thing to note also is for the multiracial, where the disparity is even higher, even though the numbers are low, but you have 26% of the deaths compared to only 6% of the births. So these are things for us to note and to look for factors that result in these disparities. For family risk factors, I do want to point out that when we were looking at these, it's not so much that they are risk factors for adverse birth outcomes, but they were more as a proxy for other factors, social determinants of health. For example, when you look at families receiving government aid, 52%, that indicates that these are people who are either in poverty or had other resource needs that were not being met, and therefore led to them having to seek additional government aid. I'm going to skip over this one because it's information that I've already given. Over 1/3 of the cases had at least one major life stressor. This is an issue that has been looked at over and over again, especially with maternal and child health programs, the importance of stress, not only for the pregnant mom, but also even for women of childbearing age, because now we know that stress affects not only the health of the mother, but also does end up affecting the health of the baby as well. Some of the major life stresses include things like lack of support, family support, frequent moves, homelessness, job loss or unemployment, major illness, and substandard housing. And these are all factors that lead to stress. One of the other things we found is, compared to all new mothers in Sacramento County, mothers that experienced fetal infant mortality death were more likely to be under the age of 21 or over the age of 35. So we do know that these two age groups are at higher risk of having adverse birth outcomes.
Dr. Kasseri, you moved that slide, but the next bullet there where you said more likely to be employed.
Yeah.
So how does that factor into the risk? Because they're working right up until delivery, or what?
It's not a risk. I think it's one of those things that was noted, but when you do look at the statistical significance, there is no statistical significance. That's the same thing with the being born abroad.
Born abroad, yeah. I just was curious because it struck me as being a bit curious.
Yeah, it's not statistically significant.
Okay, thanks. Okay, thank you.
So looking at the distribution of the deaths, you'll find that this is actually very similar to what we saw for the CDRT. And when you look at the insert, the distribution is very similar to where you find higher child populations. So it does help us in knowing where to focus our resources, and especially with the next presentations that you're going to have, looking at the neighborhoods with the highest concentration of the deaths, which include Arden Arcade, Valley High, and North Highlands. So this does indicate that I think we are focusing our resources in the right places.
Can I interrupt for a second? Sure. I have kind of a dumb question, but when the death, the geographic location of the death
yes.
Is recorded, how is it recorded? Is it recorded at the registered address of the family, the parent, or if the child dies at a hospital, where is it recorded?
This is the address of
in all cases.
In all cases.
Okay,
yes.
thanks.
So moving to the recommendations, some of the recommendations, and as I mentioned, this is a new addition to the CDRT, so as time goes on, we're going to definitely have more recommendations, especially when we get to our next report. But some of the recommendations that came up was identifying real and perceived barriers to early entry into prenatal care and being able to address those barriers, especially for women with substance use disorders and for those experiencing domestic violence. Again, stories we have heard over and over again is that in many of these cases, especially for the younger mothers, there's a fear of accessing prenatal care because there's the impression that they will be reported or that their child will be taken away. And so being able to provide the education so that they know that when they do present themselves that they will get the help that they need is really important. Also, preventing and diagnosing and treating infections, especially sexually transmitted diseases, and also chronic health issues. And especially with chronic health issues, it's important to not only address them during the time of the pregnancy, but also to look at preconception and interconception care. So looking at all women of childbearing age and encouraging them to be healthy, I think is really important. Also addressing the behavioral, social, and economic disparities of mothers that manifest in low birth weight and preterm babies. I believe that's the last slide. So.
Okay, Dr. Kasseri, thank you. And now it's time for any board member questions or comments. Our three speakers, or any final comments, Sheila? Or are you just seeking out questions? Okay. Okay. All right. Any other comments from my board members? If not,
Okay,
thank you to Dr. Evans, Dr. Kasseri, to Sheila, to all the folks on the review team. Obviously, there's some recommendations. I think before we leave this, though, so we have the 6 recommendations. Next step, we're going to response to those recommendations about implementing some of those things. Some of those will require a commitment of either resources and or some commitment to
Yeah, with all these reports with the recommendations, we're going to look at what kind of commitments needed, time, and with budgetary adjustments as we go forward.
Okay, so when would we take those all as a group then, Nav? You'd come back with, again, they have 6 recommendations, some additional recommendations, obviously, for Dr. Kasseri. How would we know at what point in time either we implement, either go through budget, or you're going to bring a package back to us that will provide some staff response and some...
With the budgetary stuff, of course, will come through the budget. There will be a package that will identify them. If it's not in the budgetary, it will be a different report that we'll give to you on implementation.
Okay. Supervisor Stern?
Thank you. I actually did have a question for Sheila.
Okay.
Yes. So first of all, thanks to you and to the entire team for all the great work that goes into the report. I can tell that it's become more refined in just the short amount of time that I've been on this board since the first report that I saw back in 2011. My question is this: what is being done, if anything, to educate our state legislative representatives about this? I know there's a great amount of interest shared by Assemblymember McCarty and Senator Pan on the subject of just understanding the nature of child deaths in the county. There's been some discussion in the last couple of sessions, especially by Assemblymember McCarty, about possibly carrying legislation that would look at requiring all counties, all 58 counties in the state of California, to do something similar to what we do here in Sacramento County to best understand the nature of those deaths. So is there a plan to give a similar presentation to each of them or to our contingent of legislative representatives for the region? And if not, is there some way we might be able to facilitate that?
Well, we would love any help we can get in terms of that kind of outreach. In terms of our local representatives, they are all aware of this report, and we certainly send them that information, and we have provided technical assistance to Assemblymember McCarty's office with regard to the legislation he proposed. Unfortunately, state funding that used to exist that would allow for some collaborative work regionally among child death review teams was eliminated during the recession and has not come back. And so while we have the most robust report, some counties either are very small and really it wouldn't warrant a full report like this. If there's, in fact, if there's one death, that's going to be really clear that everything said is about that party. But there really isn't necessarily the same commitment. We are blessed that all of the county departments who have relevant information are fully participating in this. That doesn't always happen. And I think, but we do distribute the report. I hesitate to say this, but I'll say it. I think sometimes other members of the legislature who are from other geographic areas maybe don't see the relevance, but as it turns out, this is the most comprehensive report we have in the state, and so it does have relevance beyond just Sacramento County. So yes, we'd appreciate any and all kind of support because we'd like to see more of this data statewide. I should also say that there is in statute a state child death council, and in the statute that authorizes that, we as an organization, our corporation that's the Prevent Child Abuse California is actually listed and is a member, and we were participating members, but also during the recession, that money went away, and just as we couldn't do this without staff, I mean, it requires technical expertise and so on. As soon as the funding went away for those positions, it's still in statute, but it's non-functioning.
In terms of the report itself, is it possible for each of our offices, if we were interested in getting an overprint or 20, 30 copies that we might be able to take with us and maybe have available to members of the public at the various community centers that are in our districts?
We'd be happy to do that.
Great, thank you.
Mm-hmm.
Yeah. Thanks once again, Sheila, and to Drs. Evans and Kasiri, and to all of our team members, and again for some very sobering information, but also shows, I think, some of the work that's being done, and very importantly, some of the lives that are being saved. Obviously, much more work to do. So, okay, with that, we have a receive and file, and I understand there'll be some follow-up by county staff relative to some of the recommendations that are here, and some of those will come before the Board of Supervisors. So I had no one signed to speak on 33. I've got a whole bunch on 34. So is there anybody on this item wish to address the board? All right. If not, then just as we call that, we'll note that on item 34, I have almost 40 speakers signed up in addition to this presentation. So when we get to the public comment portion of the program, I'm just at 2 minutes. So if you have comments, be thinking about trying to do those within a 2-minute time frame. So with that, then Flo, go ahead and call the item, please.
Okay. Item 34 is the fiscal year 2016-17 annual report on the reduction of African American child deaths.
Okay. And who's our presenter? Dr. Heller. You know you're in the house. I think you've been coming about.
Sorry. I usually jump up more quickly.
All right.
Good morning. Since there's 40 speakers, I'm going to go quickly and get to them. I think you are all very familiar with the timeline and the history of this terrific project. And we've had some discussion already this morning of the baseline data. I think what's interesting about the data in this summary is that essentially we see about half of the African American children died for reasons that I would say are related to public health, and half due to, and maybe 14% or so due to violence. I don't know that the public and the media always portray that accurately. The half of the deaths are health-related, public health, preventable deaths, and a smaller percentage due to violence. Worth pointing out. I think we already reviewed the CDRT findings, so I won't spend any time on that. I'll get right into the program. We're very proud of this work. We know that in 2015-16, the fiscal year, was when we first entered into the contract with the Sierra Health Foundation Center for Health Program Management. It's been an excellent partnership. You're going to hear some description of work that's going on under that contract, so I won't take the time to do it myself. Probably the most significant, most visible impact to date is the creation and development of the community incubator leads in the target neighborhoods. And I just want to call out in particular the members of our staff at DHHS who are part of the multidisciplinary team outstationed in each of the focus neighborhoods. That work is I just want to characterize it for you rather than just report that it's happened. It's kind of spectacular. It's kind of transformative. I think as managers, we watched it happen and wondered if people would feel put upon, or there would be some skepticism, or people feel like they're being forced to be outstationed. Not at all. It's culturally transformative within our department, both in public health and with CPS. People are very invested in this work. Partnership is not just a word we use lightly, but it is changing the way people do their work. The credibility and trust that's being developed as a result of these outstation personnel has impressed me, and I just wanted to characterize that and make sure you knew it.
Fair to say that some of your staff have been hungry for work like this or a project like this?
Yes, I think so, and it's hungry for it and optimistic about the impact, and feeling like they're instead of feeling like people are suspicious of their role in the neighborhoods and families they're trying to help. There's more credibility and acceptance and belief that they're trying to help. There's more what I would say is there's more reaching out for an understanding, in particular, of how Child Protective Services works, instead of an avoidance based on mythology. I think that's going to have a tremendous impact on achieving the objective of actually reducing children getting hurt and dying. I'll also call attention to the establishment of the African American Perinatal Health Program. This is a public health program focused on the pregnancy, childbirth, infancy period. I always like to say that because perinatal is such a difficult word. Not only are we dealing with issues of nutrition and drug use during pregnancy, but issues you might not realize are part of the program, such as intimate partner violence, infant development, and so forth. I hit the wrong button there. Let's try again. A little more on that program is mentioned here. You see some outcomes being achieved among the participants, with very low numbers of premature births and low birth weight, great numbers on sleep-related deaths and breastfeeding among the participants in the program. Obviously, the role of the community incubator leads and the partnership with the community agencies to make sure that these results are achieved, not just among participants who get our home visiting services and participate in this program, but more largely throughout the community. Multidisciplinary teams is a CPS effort. And I talked a little bit about the effect of these. This has to do with various professionals and paraprofessionals and community trusted workers. When there has been a CPS referral, dealing with the family and making sure that the action plan for that family is appropriate. We've already talked about the outstation sites. I want to mention there's an abbreviation here that's sort of important that you understand. CPS staffed all 7 outstation sites with what we call informal supervision social workers. These are social workers who are focused on families at risk with the intent of keeping those families intact, making sure the families get the referrals and support services they need so that children do not need to go into foster care. And we've talked a little bit about what some of those might be, but this is where you would find successful programs like the Early Intervention Family Drug Court, where we get addiction-related services to families and keep families together. So we've talked about this whole effort as a way of reducing injuries to children and reducing child deaths in the African-American community. But I just want to add my commentary that part of the objective and part of the reason that the trust is being built is because another objective is to keep families intact in the African-American community. Yep, I keep hitting that button. There we go. This year we have begun the Cultural Broker Program. This is a program aimed at making sure that there are trusted people in the community who can advocate for families when they do get involved with CPS. We did a competitive procurement and awarded contracts to 3 organizations, A Better Life Children's Services, Sacramento Children's Home, and the Sierra Health Foundation. The certification training for cultural brokers is going on right now this month, and we begin services probably in January so that there are trusted advocates, trained advocates to help families through the CPS process. I'm going to turn these remarks over to my colleague Lee Seal to talk about the probation department's involvement in this project.
Okay, thank you, Sherry.
Good morning again, Lee.
Good morning, Lee Seal, Chief Probation Officer. It's a pleasure to be here talking about this important effort. I'll follow the cue of my counterpart and keep my comments brief as well, move quickly through the PowerPoint. In fact, maybe ignore our PowerPoint altogether, because really what is important aren't the stats, it's not the numbers, it's the people behind me, the little baby back there who I'm glad is here to remind me and all of us why we're doing this important work.
A very happy baby.
Yes. You know, this work is personal for all of us. It's, you know, all of us. I have kids in the community. My manager has kids in the community. The team members up here, all of us are in this together, and we all want to make this work. The board invested in our department. We have 5 probation officers that were newly created as part of this. This is extremely important for us so that we have the resources to engage in the community. But what's important isn't just that we add 5 probation officers. If I talk to my friends in the community and say we're going to put more badges and guns in your neighborhood, the reaction is going to be mixed. The reaction is going to be, well, okay, you know, we appreciate the enforcement activity and we understand that that's a component of what's important, but what's more important and what this initiative is about and what we're about and what we've really expanded is providing the services and support and programs and interventions so that we don't need to rely on that approach in the first place. And that's really what we've been doing. So when we talk about 5 probation officers, it's not just 5 probation officers doing the same kind of work that we were doing 10 years ago. It's 5 probation officers who are connecting community members, families, young people who need services with those evidence-based treatment programs that we have. Things like multi-systemic interventions, family functional therapy, wraparound services, juvenile justice diversion and treatment programs. All of these are community-based programs, and they're all programs in which we can provide support for young people and families. We can meet the families where they're at. We can come to them literally inside their homes and provide those things to them. I'll note that many of these contracts are in fact part of contracts that this board has created as part of other initiatives, such as the Title IV waiver initiative, which continues to be very important in making these services available to young people. But really, as I've emphasized, it's a difference in approach. What does that look like in real terms? Well, it's not just 5 officers. 2 of those officers we have deployed to schools. 2 of them have been assigned to community incubator sites. But beyond that, the probation department has matched that with a big dedication of our own internal redirection of resources so that we can staff out all the community incubator sites. Today we have officers at all the major school districts: San Juan, Sac City Unified, Elk Grove, Twin Rivers, I'm forgetting one. Help me? Natomas, thank you. We've got officers in all of those schools. We've got officers at all the 7 incubator sites, and what's important now, the difference is the relationship, and that we're able to connect families and young people to those services. I would like to take a minute to recognize the team who's here today in the back. If I could ask you to stand up from the probation department. We have Cliff Foster, we have Larry King, Jose Mendoza, Diaz Mendoza, we have Mark Coleman, Andy Jang, and our supervisor, Ray Lozada. She's very shy, but our chief deputy, Shonda Cruz, is really doesn't want the limelight. And I think if you talk to our colleagues in the incubator sites, they'll tell you that those officers are essential. They're doing good work. We have a photo. I made a trip out and had a chance to visit with a couple of the incubator sites. We see Mr. Lamar Thorpe and Ms. Rihanna Davis, who are here in the audience with us today from the Oak Park site. Thank you. And it could have been a photograph from any of the 7 sites, but we're just in the interest of time, we'll pick one. This is what it's about. This whole initiative is about relationships. When you go to the sites, and I've been doing this business for a long time, I know what to look for. I've been in initiatives before where you go and supposedly there's teamwork, but I say, where does my officer sit? Oh, it's that cubicle, and I go over there and it's an empty cubicle, and you can tell the computer's never been turned on and no one's ever sat there. When I visit the sites, I see just the opposite. I see a lot of teamwork, a lot of relationship. They're talking about working together. They're talking about, and it's not just probation, it's with all the county partners, with DHA, DHHS. There's a real teamwork, and I can tell you this teamwork is new. It's a part of this initiative. It hasn't always been there. Our presence in the community has been a certain kind of presence prior to this work, and as part of this initiative, it's a new kind of presence. I'll share a story from Officer King in the background. Many of these officers are also assigned to some of the school sites, and there's a bigger team of officers who are part of the school sites as well, and they'll sweep through the schools and check in. Officer King has a box at American Legion High School where he can get notes from school staff, and before he comes to the MDT team, he'll stop by and get information. And For example, one of the pieces of information he got last time was that a young woman, a young mom, was in need. She was expecting, she had a baby on the way, and she wasn't aware of all the services and support that exist out there through the various contracts, through our partners in DHHS and elsewhere throughout the county. But it's that relationship that now exists is able to connect that young mom to those services directly. And note, the most important part of that is what I didn't say. Nobody got arrested. No babies were taken away. You didn't have to come into the justice system. So they're looking at that PO in a new way. They're looking at that social worker in a new way, that think, okay, maybe this person's here to help. Maybe this person's here to actually provide some of the services and support and not just be there when it's time to make the arrest. So that's been the really transformative thing as a department. We're excited to be a part of this project, and it's great to know that at all 7 sites we see this kind of teamwork up and running. Thank you very much.
Okay. Thanks, Chief.
Any questions from the board before?
Any questions?
Thank you.
Good. Thanks, Steve. Thanks for all your engagement and certainly leadership at your level as well. Okay, Dr. Heller, these CLOs have presented. I have a list of speakers. I don't know if the steering committee, do you want to take these in the order that I was handed? And I didn't know what the next, I have Pastor Banks, but I don't know, Chet, were you just taking the order?
No, we're going to present first.
Okay. All right, very good. We have that. So I'll call forward, and those are going to do, I didn't know who that was. So those are going to do the actual presentation of this steering committee report, the Black Child Legacy Campaign, and then we're
going to present the report. I think we're going to start with a short video. And
okay.
Let me just say.
And then I believe the Metro Cable folks would run it.
Sure. Okay. Go ahead, Jen.
Well, let me just start by thanking you for having us here again. We were here about a year ago to do our first annual report. And I am Chet Hewitt, President and CEO of the Area Health Foundation and co-chair of the Steering Committee to Reduce African American Child Death. And I'm joined by my co-chair, Dr. Natalie Woods Andrews, who will be presenting with me this morning as well. So before we get going, we'd like to roll the video. I think it's a good example of a lot of the partnership that Dr. Heller and Chief Seal have been speaking about.
Okay.
When you're so far away from everything that's part of your normal life, and there's nothing you could do about those things. New spaces bring new thoughts. Sometimes you be somewhere, you have a thought that you never had you been somewhere else.
Some never been outside of the city of Sacramento. Some youth have never experienced the open, woods and been in the mountains and experienced some of the activities here, like canoeing and high roping and low roping and some of the bonding activities that we're doing. They've never experienced that.
They came from several different communities in Sacramento, but up here they became strong together as one.
I thought like that, from us being all from different neighborhoods and stuff like that, it would start problems because there's different hoods and gangs and stuff like that. So it really touched me that we all were able to get along.
So here at Black Child Legacy, we work off relationships. Every single area from the north all the way to the south have specific individual relationships with these youth.
We had this activity where it was more like a step forward if you've experienced it, and realizing that a lot of my sisters have been through a lot of the same experiences that I have.
You think you're in something alone, and then you see 15 other girls going through the same thing.
I took back a lot of sisterhood from the camp, lifelong friends.
We got the elders here. We got us as the in-betweens, the elders, us and then the youth. Then it's not about just myself and the other mentors doing all the talking, but also it's interactive with them to give them the opportunity to talk back to us, to be involved with the activities. The activities are interactive. It's not just let's sit back and talk and listen and okay, go out and play.
You never know what someone's actually going through, and the camp actually showed me that in that room, I felt kind of like a safe haven. So hearing everybody, they trust you, so it's oh, I trust them too.
I feel like city life, people are much more about doing their own thing versus camp. It's these are the people you're with and they're your family.
bringing them here at the camp allowed us to be very open with them and allowed them to be open too without being judged. So Black Child Legacy Campaign, it has its own destiny. And we do have a goal that's been set for what we want to accomplish in the amount of years that we've been allocated to do it. And I'm confident that we're definitely going to make some progress.
You know, we chose to show that video because, as I think the folks who spoke before me addressed, that this is really about relationships. This is about connecting with people and connecting with communities in very different ways. In 2013, we presented to you our strategic plan. We actually talked about the needing to build an architecture to deliver services in a new way. In 2014, we delivered our implementation plan, which I think expanded on that particular idea. We talked about community incubator leads and how they could actually lead this particular work and provide a forum for county departments to really build trust and connection with community. You know, we talked about engaging our young people on that particular work and having them work across their traditional community boundaries. They could get to know kids from Oak Park and South Sac and Lemon Hill and Fruitville and Valley High. And you've seen that, I think, depicted in this particular video where our kids would come together in the park in a camp-like setting to build that trust and respect. And so many of the things that we had hoped for in that plan are actually in action, in operation. And I do want to call out, I think, the tremendous work that our county departments and partnership that they've offered and afforded to us at the steering committee to actually make the kind of progress that I think that we can collectively be proud of. So I want to thank Chief Seal and Sherry Heller and Ann Edwards and Nav Gill and others who have helped lead this effort. I also want to call out two people independently, and that is Kim Williams, who is, I believe, in this audience. Kim, can you stand up? We also have Kim back here. Kim, could you stand up for your work with CPS? And Gladys Delaney, who I also want to point out. And I say this because the multidisciplinary teams that we talked about really is, I think, a demonstration of services being delivered very differently than they were before this effort got started. Can I have my first slide, please? The Black Child Legacy Campaign, which is the rebranding of the Steering Committee for Reducing African American Child Death, really is to give that a more hopeful message. And so the imagery and the title under which we do business, you know, really is about bringing hope and potential and possibility back to communities as well. It has four major parts. We have the community incubator leads and the multidisciplinary teams who are at the center of community. And could the members of the teams please stand up? These are the real champions of the work. We have members from some of the CILs who are in the audience today. Could you please stand up? And I would challenge anyone to pick out who the county representatives or employees were, because you couldn't tell if you looked back there. They were just members of the CIL teams. That's the kind of deep relationship that I think the chief was speaking to as well. Some really fabulous work taking place. Of course, we have the steering committee who helps lead that work and is a coalition of some really dedicated individuals who bring thought, leadership, as well as community activism to the table. We have our Community Leadership Roundtable, which is our powerful grassroots support network. 20 of these individuals are now crisis responders. They are trained and certified crisis responders. I'll share a quick story later on about some of the work that they are actually doing, but they give us this authentic connection to community, and they need to be applauded for their particular work as well. And then, of course, we have our Technical Assistance Resource Team, and that is our ability to build capacity by offering training and capacity building support to those 7 community organizations who are leading the work in those particular communities. Next slide. You know, our approach is a targeted but universal approach in the 7 communities that you see listed here. And people say, what's targeted but universal? That is, we are very focused on reducing the disproportionate African American child mortality rate. That is the charge of the committee. But we also believe that good policy is good for all children, and we are working in ways that we believe will benefit all children. Last year, the story that I used to kind of describe this was the work that was led by Dr. Ethan Cutts and Diane Galati, 2 members of the committee who actually put in place the safe sleeping assessment protocol that is now in all 4 major hospital systems. That protocol, which does the training around how to sleep your baby safely, was born of our effort focused on African American children, but that is now for any child born in our particular region. Doesn't make a difference about your socioeconomic status, your race, or ethnicity. Every family is taught how to safely sleep their child. I think it's been reported that having a crib or a safe sleep environment is not sufficient, but it is the knowledge and training that's gained for those parents through that particular process we think is having an impact on reducing some of those rates, and of course we hope that continues. Of course, we are focused on the 4 leading causes of death, and unfortunately they remain the same as they had been historically: perinatal conditions, infant sleep-related deaths, child abuse and neglect, and third-party homicides. The latter 2 will be an increasing focus of our work going forward, as I think there's a lot of good work being done around those first 2 causes of death. Next slide, please. So, currently, yes.
Excuse me, can I interrupt before you move on? Because I think it's an important point to mention about statistically the rates not being or being where they were before. But I want to make sure I understand. I mean, we've been drinking through a fire hose this morning in terms of data, good data, necessary data that we need to digest to understand not just the disproportionality associated death rate in the African American childhood population, but for all children in the county. Is this really a case that death rates are going down, but they're not going down as fast for different ethnicities? Is that one way to characterize what's going on here?
That's accurate. We've had a kind of ongoing trend for a decline in overall child mortality rates. What we're not seeing happening as quickly is the reduction in the disproportionality between racial and ethnic groups. And I think that the reason why the final recommendation from the death review team was to continue this particular work is because I think they remain focused on the fact that we've got to do more and move faster than that decline of overall rates if you want to reduce the rates of disproportionality.
I just wanted to point that out because I think if you just leave it at, the data or the rates are unchanged, that gives you a different impression than if you understand the context, which is all death rates are beginning to drop.
That's right. And I think that the highlight, as was reported, was that you are seeing declines in rate of disproportionality for African American children in certain categories of death as well.
Like sleep-related.
That was what I think Sheila was flagging when she was talking about, there being some array of hope, I think, in all the work that's really being done.
Thank you.
Currently our campaign is working on, and I said this earlier, the co-location of services, in partnership with our community incubator leads and public agencies, providing a wider and growing array of wraparound services. We're not only doing CPS and probation, you can actually do eligibility services for food stamps and other supports to address issues of poverty within those sites as well. This notion of creating community decision-making and keeping community engaged in this process, which I think is one of the most important and transformative aspects of this particular work. This is not something that's being done to communities. This is work that's being done with communities, and for us, that's a sea change, not just one about language, but about the potential to be even more successful than we have been in the past. Clearly, infrastructure for community capacity building is being ramped up. We're very excited about that. And we are creating a kind of social justice youth development opportunities for young people that will increasingly look at economic opportunity. So I work with SETA and jobs and employment being a focus of that particular work, but even things about our own education and knowledge about what might work. I think Supervisor Cerner, you were able to spend some time with our participatory action research young people. Those were the folks who were at camp, a dynamic group of young people who are the future social scientists in our particular community who are doing some impressive work and gathering knowledge that's shaping the way that we actually do the work going forward as well. Next slide. You know, a big part of our work is really around raising visibility, influence, and support for community investment. And to do this particular work, you know, we're investing directly in many of the CILs. We're educating both ourselves, the CILs, and community about what needs to change in order to reduce mortality rates. We're building solidarity with faith leaders and social service providers, both public and private, including some private partners who are now participating, like HealthNet, which is supporting some of our cultural broker work. And we continue to build and support organizations to strengthen the infrastructure within communities as a whole. And some of that's being done through re-granting, where you have some of our CILs who are now making grants to small organizations or small groups who are doing really great work in their community. Folks who would never be able to get through one of our contract processes and respond to RFP, but folks who we know have real walkabout, kind of authentic relationships with communities, and we think that's pretty amazing as well. I'll end before I turn it over to my colleague with a short story about what this work looks like and how important it is. Early this year, we had 2 young people who were shot, and 1 who lost their life. At 2 o'clock in the morning, while this is being dealt with and a young person was struggling with their life to stay alive, we had between 150 and 200 young people at the hospital in the emergency department at UC Davis. This was now about 2 o'clock in the morning that this was going on. And I can tell you that having 150 to 200 young people with very little adult support at that facility at that time, of course it's a hospital, it's not designed to manage this, really is, you know, provides a potential for not good things to happen when they were to leave that particular space. Not because they'd go out and just simply commit some crimes, we're not saying that. These are young people, they have emotions, they've been traumatized, they are concerned about what's going on around them. But in that moment, we had a number of our crisis responders who got up out of their beds, who left their homes, who showed up in that hospital, who provided support to those young people so they could process what was really happening around them. There were things that we did that may seem a little bit unusual. We had expenditures for food, because we had to feed some of those children in order to get them, you know, to a place where they were really prepared to hear what we had to offer them. Right? We had to make sure that folks got home safely, right? Because that was an important thing to do, and not have potentially other harm be done to the community or to individuals because folks were in a state of grief and trauma. So, you know, what I really want to thank you for before we talk formally about our report is to take the risk to do something that was really, really different. To not be bound by the constraints that we usually impose about programming, about how we typically do things, whether food is an appropriate reimbursement. You know, if we're going to really make a difference in this particular work, I think we're going to have to continue to do things that we might not ordinarily do, in ways that we might not ordinarily do them. And I think if we can commit and maintain our commitment to that idea, then what you'll see in the coming years is additional progress on this particular issue around disproportionate African American child death. I'll stop at my summary there and turn it over for a formal report on the report that you have in your hand, which will be given to you by my coach.
Okay, thank you, Chet, for your presentation, for sharing.
Well, thank you again. It is our pleasure to just come before you to share a little bit more information about the annual report that you do have before you. This is our opportunity to provide you with an update in terms of the progress of the work that we have been chartered to implement on behalf of the Steering Committee on Reduction of African American Child Deaths. I hope that as you look in the faces in these rooms, and as you look at the faces on the slides, you will see the lives of real people who demonstrate to you the importance of the type of infrastructure, the type of support that has been needed in our community, something that hasn't existed. What I'm going to share with you is a little bit of information in terms of some of the implementation strategies, the milestones that we have been able to achieve, also taking a look at the accomplishments that have occurred thus far, as well as the next steps as we move forward. One of the things that I think is important to share with you, again, just a reminder of why we're doing this work. Any life lost, of course, to us is a crisis, but our specific charge is to reduce the African American child death, disproportionate number and rate of death by 10 to 20%. And so that is our charge to do by 2020. This has been a movement that has been focused on a specific purpose. We have identified key strategies, and also it is our goal to make a collective impact in our community. The work that we are doing in this particular plan is based on 5 key components, strategies that are interdependent. They all work in tandem with each other. And as you can see on this slide, and I won't read each one of them because I'm going to unpack them in a moment, this is our opportunity to really transform our community by working together in all 5 of these particular areas. The first that I'd like to unpack for you is focused on promoting advocacy and also policy transformation. This is our opportunity to take a look at some of the accomplishments that have occurred in this particular area. First, I'd like to share with you, as my colleague has mentioned, that we do have 6 community leadership roundtable that have been set up in each of the communities, really building the capacity of those who are volunteering their time to really learn from each other and also to support each other and serve as representatives of the community in leadership roles. They come together on a bi-monthly basis to make sure that they are staying connected within their particular communities. At the same time, as my colleague has mentioned, we have been able to put in place 20 community leadership roundtable members. I know the slide says 17, but we recently brought on 3 additional individuals to be a part of this work. And they are now certified crisis responders in the community. They are the go-to individuals, the cultural brokers, if you will, in all of the communities that have been set in place. This has also been our opportunity to make sure that we're building their skills, their knowledge, and enabling them, using their abilities to make that collective impact in their own communities. The third piece that I'd like to share with you is focused on our faith leaders. And the key in this particular areas is that we've had a few opportunities to bring our faith community together, representing our local churches and our areas of worship to come together in a collective way that they have not in the past, focused specifically on the Black Child Legacy Campaign. We have been able to hold an annual prayer breakfast to bring these individuals together, as well as the Glory Conference, which has been a great way to bring a number of individuals across Sacramento County to really take a look at how can we look at our faith leaders to take a leadership role. One of the things that we know has occurred in different communities is specific to looking at the infrastructure that we have in place with our community incubator leads, taking the lead and responding, but really engaging our faith leaders, working hand in hand, side by side, to make a difference. There are so many resources that are available in areas of worship that are not necessarily tapped into. So our faith leaders are now stepping up as leaders in the community. They are the ones who are leading the peace walks each week. They are the ones that are coming to the Black Child Legacy Campaign to say, what can we do to support our communities? The next area is focused on equitable investment and systematic impact. And in this particular area, we have three accomplishments that we would like to highlight. And one, it is focused on just launching a countywide evaluation design where we are engaging all of our community partners to really focus in on how do we make sure that the work that we're doing is specific and it is going to render results. We were able to host a results-based accountability forum for over 100 participants. It included all those who are a part of the Black Child Legacy Campaign, as well as city and county representatives coming to learn a little bit more about how we will move forward together so that we're all on the same page. At the same time, we've been able to secure some funding for cultural brokers throughout our communities, specifically looking at the North Highlands and the Foothill Farms area, as well as Del Paso Heights in the North Sacramento area. We've been able to do this in partnership with the county, but at the same time, being able to leverage some fundings from HealthNet to make sure that we are providing some support in our targeted neighborhoods. At the same time, in this particular strategy, we are charged with assisting and helping to develop the Interagency Children's Policy Council, and that is one piece that we initiated some work in this particular area, but we've not been able to move forward at this point, and we'll talk a little bit about that. We're looking for just very strong outcomes to make sure that we have a collective group coming to the table. I know that as Sheila was up here talking about a recommendation that they are moving forward, we also believe that it is important to bring a number of community partners together, representing a diverse group of stakeholders, really to address this particular cause. This next area is focused on a coordinated system of support. And we know that any strategy that we put in place, it is important that we move forward together in a coordinated way, in a seamless way. And I'd like to just give a shout out to this particular team, as well as the other community incubator lead teams that have been charged to do this work and service those hubs in our community. But in this slide, you will definitely see the collaborations of our community incubator leads. In the center, Ray and his colleague, as well as Janelle from CPS, and you have Dominique, and you have individuals from social services, to make sure that, again, they're working as a team. As Chief Sill said, you cannot tell the difference between who's working there as a county employee or a city employee, or who's a community volunteer. They are all in this work together. And in each of the community incubator leads, you will see that SETA is at the table, probation is at the table, DHA, DHS, they're at the table. It has become a one-stop shop for individuals who need services in the community. One of the challenges that we're facing is that the word is out that there is a location that you can go, a trusted location where you can go and tap into services. And so those who are not necessarily in those targeted neighborhoods, they are coming to seek that assistance because they know that they can go and get some support. So our community incubator leads have been trained to make sure that they are providing support to those who are walking through the doors, but also make sure that they're connecting them if they are seeing individuals who are from another zip code area, to make sure they do that warm handoff to make sure that they are fully served. This has been a great opportunity, again, to create that buzz in our community, that there is an infrastructure that is in place to support this work. And so our community incubator leads have also been able to do some of the many granting opportunities where, as my colleague mentioned, there are those who would not be eligible or who would not take the initiative to write their own mini grant, but they are able to come up with some very innovative ways to support their community. You can see that the 7 focus neighborhoods have been identified for us to focus our work, the work of the community incubator leads, the community leadership roundtable, and the steering committee really is doing that targeted, however universal focus in these particular areas. The next aspect is focused on data-driven accountability and collective impact, and this is our opportunity to really identify those short and long-term goals, really taking a look at the participatory action research and some of the other aspects that we feel are really important to, number one, understand the the quality of the program, the services, and the infrastructure that is put in place, and to make sure that we are moving forward in an effective way. So I'd like to share with you that we have had an opportunity to conduct site visits based on the recommendations of the evaluation work group team to come up with 9 indicators of quality that show the impact of the work that has been put in place so far. And on this particular slide, you can see that it is a scorecard of what our community incubator leads in our community work looked like back in December as a comparison in terms of what it looks like in July. And you can see there is a substantial difference in terms of just beginning this work and putting this infrastructure in place and now really settling in and building that capacity within our communities, focused on skill development, capacity building, just making sure that anyone who's providing that service is very knowledgeable about our particular focus of work. With our work, we have been able to provide technical assistance and support. And with this work, we've also been able to launch what we shared with you as the rebranding of the steering committee's work into the Black Child Legacy Campaign. And so we focused a lot of time this year in building up the website, providing weekly blasts to those who are interested and want to know a little bit more about the work that we're conducting. And we really have developed that countywide approach to immersing our community in terms of the services that are available. We've been able to engage our community with direct outreach, and we really have positioned the Black Child Legacy Campaign really as the focal point in our community for media and for different outlets. And so I'd like to share with you just a list of some of the traditional and non-traditional media outlets that we have been able to engage on behalf of the campaign throughout the year. The Black Child Legacy Campaign has been featured prominently on many of these venues, and so I do want to thank them for the support and also for the coverage, because it is important to build that capacity. A lot of the work that we do, of course, is through this direct outreach, but it also is through word of mouth. So the more that we inform our community, the better we can really build this campaign and move it forward. So I'd like to turn this back over to my co-chair to share with you just a summary of our work.
And I'll do this quickly because I know we have a lot of folks who are waiting to speak with you as well. This is just a one-page summary of where we are. CIL and roundtable training technical assistance, it is up and running. You have seen the impact of that, I think, in MDTs. Interagency Children's Policy Council kind of stalled. We're trying to figure out what the alternative strategy is. I think this idea about better coordination across all the moving parts, something we talked about, and if I remember correctly, Chair Natoli, is something that you really advocated for when we presented our first plan as well. And we need to re-engage with the county to figure out how to get that up and running again. I think it's even more important now that we have infrastructure in place and operating so that we can continue to work at a common purpose as opposed to getting sideload or at working across purpose. And of course that wouldn't be intentional, but there is a lot happening as we speak. Technical Assistance Resource Center, what we call our TARC, it is up and running. The MVTs, as I said, up and running. The quality assessments was that chart kind of pre and post. You've seen where groups rated early based on those qualitative assessments across those 9 measures. You see where they are now. That's an ongoing activity as we expect to see increased capacity over time as well. We are in the process of collecting data, research teams, young people engaged. I think our PAR research strategy is going to produce, I think, a lot of great information for us to build off of. And then, of course, continue to work collaboratively with CPS, probation, and other county departments who have been extraordinary partners in this work to date. We're really looking forward to the launch of the Cultural Brokers Program, and we're hopeful that'll have some impact on some of that CPS data that you've seen earlier, where clearly there is more ground to cover. Next slide. Next steps, talked about them, begin the peer-to-peer phase of quality assessments. So now we're going to move from training people to have folks being trainers for each other. All right? So this will be a much more sustainable approach using a peer support model. You may be good at communications in your community. You may have a great budgetary system. Can you really help, across communities to actually continue to build capacity? The crisis response, we've had a spate of a loss of life over the summer. Those certified trainers, I'm telling you, as someone who's been out on a few occasions, it's some really needed work. It's a hard place to actually be. And so our efforts to continue to support them, to respond to those crises, but also to take care of yourself. There's but so many funerals of young people you can go to without it having an impact on the communities and families first and foremost, but also on the folks who are responding to that. These new untraditional communication strategies, something that we'll continue to pursue, as well as national conversations. We had a group that presented at Proctor, which is the Children's Defense Fund's national a gathering that's held in Tennessee at the Alex Healy Farm to talk about our work, and we'll continue to talk about it beyond the boundaries, jurisdictional boundaries in which we're operating. Of course, the Social Justice Youth Development Program, again, with a focus on economic opportunity and employment for young people. We think that's driving or contributing in pretty significant ways to death and injury, particularly amongst older children. Of course, the cultural broker efforts as they get launched and up and running, not only to get them started, but also to strengthen them once we hit the ground and we are in operation. And then, of course, always continue to document the success we're having, the knowledge we're gaining, and reporting back to you so that we can continually improve the quality of services that we are delivering. Next slide. We thank the chief. He had a slide of one group. These are all 7 teams. I know we say Arden twice. That's a mistake, but these are the teams who are operating in all 7 of the communities. Next slide. And of course, I want to say thank you to the volunteers who make up the steering committee, who over the past 2 years I think have done tremendous work, who have stayed committed, who continue to show up for the meetings and offer their insights and talents so that the work that we are engaged in has the best chance of being even more successful than it has been to date. So with that, we conclude our presentation and take whatever questions you have.
Thank you to our co-chairs, and we have maybe have a couple questions from supervisors. Supervisor Kennedy.
Actually, not a question.
Okay.
I just, before we get to all of the speakers, I wanted to, really commend the work that the co-chairs, the whole committee, and all of the people in the audience are doing. It's not lost on me that 3 of the focus neighborhoods are in District 2, and we do a lot of very important work up here for the community, and nothing is more important than the work you're all doing. It's frustrating that this good work takes long to really see the benefits, but what I see here, what I heard today, I don't think there's any community in the country that's doing anything like this that I know of. So I commend you, and let's keep it up, and whatever we can do to help, we're here.
And we commend you for your support too, all of you. Yeah.
Thank you.
Thank you.
Great. Any other? Yes, Mr. Cerna.
No, I was just going to say I wanted to also express my gratitude for all the tremendous work. I stay in touch fairly frequently with various component parts of the effort on a weekly basis, quite frankly. But since Supervisor Kennedy brought it up, he mentioned this work and how unique it is and robust it is compared to what's going on in other parts of the country. Maybe, Chet, that was your cue to maybe express what has been shared with other parts of the country in terms of this effort?
Mm-hmm. Yes, I've testified for the Federal Commission on the Reduction of Child Abuse and Neglect deaths. It's good to see that we're using one of the recommendations that came out of that national work is also contained in the county death review team's recommendations going forward. We continue to be and provide consultation to other counties, both within California and beyond, who are interested in our work. And I will tell you, one of the questions I get asked more than anything else is, how did you get the political support to do this? We unfortunately are not the only county who is grappling with disproportionate childhood deaths of African American children. But we are one of maybe 2 or 3 counties in this country who have found the political will to engage the full community to try to resolve that challenge. And in that, I know we've gotten a lot of commendations, but we'd like to offer one back to each and every one of you sitting behind that dais, because it would not have happened but for your support.
Well, big collective thank you to everyone in the room for all your efforts and for all the work that goes on in all the realms that make this, very important. And I think it'll be a life-saving project, obviously, and a life-changing project in many, many ways, both individually but collectively for this community. So, again, thank you so much for your leadership and good work and for the presentation. We're going to hear from a number of folks here. I just want to do a little agenda management real quickly before I call on the speakers. Understand it, we're going to move to the afternoon portion. Afternoon's going to bump down a bit here, I think, recognizing we're already afternoon. And we're going to take the County Children's Coalition Work Plan report after the break. We're going to finish testimony here on this.
Yeah, what we would suggest is that move the item to 2:30.
Okay.
Have a lunch break. We still have a couple closed sessions we want to talk to you about, but this afternoon come back about 2:30 time to hear item number 35.
And then everything else will bump down below that, so the 2 and 2:15 items?
Yeah, they will bump down accordingly.
Okay, so we'll...
Just sequentially, we'll start at 2:30 with closed session, then we'll come back and do the Children's Coalition and all the other items after that.
So we're going to finish this item, so stay with us, and then we'll break, we'll have a closed session, and come back at 2:30 back in to start with the 11 o'clock item. So again, apologies to those folks on the second one. County Children's Coalition, but we will hear that before too long this afternoon. So, okay, with that, then I'm going to go to our speakers. I'm going to take these in the order they were handed to me. You've had clear instructions on that, so I think Pastor Banks is first, and then Steve Garrett and Danielle Lawrence will be our first 3 speakers.
No Pastor Banks.
No Pastor Banks? Okay. All right, then Steve Garrett. And Steve will be followed by Danielle Lawrence, followed by Colleen Kelly. Steve, good afternoon.
Good afternoon, Mr. Chair and honorable members of the board. I'm Steve Garrett, acting public defender, as well as I'm honored to be a member of the steering committee. And I know you're very busy. I'll try to be quick. I just want to say it's really a great honor and a responsibility to work with the great people I've seen here. The grassroots effort that they have put together is honestly startling and amazing to me. I've personally witnessed great work going on at Liberty Towers and at South Sacramento Christian Center. Just amazing things they do, and that's taking away not at all from the other great work, but I've personally seen that. And I wanted to say it's just such an exciting opportunity. What I've seen for you, the resources that you've directed here are just producing great value, in my view, for the community. We've seen so much energy. There is an amazing talent and energy in the group of people that are assembled here, and it's astonishing to see them all work so well together. And I'll close because I know you have a million people to hear from. So I'm very hopeful that change and positive change is going to happen in this community, and I thank the Board of Supervisors for that. And that in this kind of work, it's rare we all get to feel like we're on the side of angels. So thank you so much for what you're doing.
Good. Thanks, Steve. Appreciate it. Okay, next Danielle, then followed by Colleen, and followed by Brandy, Missouri.
Hi, Danielle Lawrence from Mutual Assistance Network, and I am representing the Art and Arcade Community Incubator Lead. I am just so proud and thankful for the efforts that we're doing in Art and Arcade. I will be introducing people that I'm working with, because one of the things we know, and all incubators will agree, that we can't do this work alone. And so I will be introducing some of our youth speakers who will kind of go out of order. So I want to ask Colleen to go, and then our youth, because they got to get back to school. So I thank you, and I just thank you for your efforts and your contributions.
Good. Thank you so much. Okay, so Danielle introduced Colleen, right? Yeah, Colleen, good.
All right, so my name is Colleen. Most of my coworkers and clients call me Coco. I am a member of the Community Incubator Lead, as well as a member of the Community Leadership Roundtable for the Art and Arcade area. Within both of these roles, I am a cultural broker for families. I am fairly new, but I have a small caseload nonetheless. Not only have I utilized a lot of these services that the Black Child Legacy Campaign offers, but I have been able to connect each of the families I work with to them as well. I was able to advocate for a client who was facing 30 days in county jail by speaking with the DA on her case and figuring out some alternative sentencing methods so that she would be able to maintain custody of her children and make sure that they were still attending school, doctor's appointments, and maintain their housing. I have another client who is in desperate need of housing for her and her 2 small children. We were able to sit down and work out a plan as to how we can make that happen and how we can maintain that. When I got this case, she had no child care and therefore was unable to work. Since working with her, we were able to establish child care and get her set up for parenting classes as well. I've only been working with this client for 2 weeks, and we are currently working on a source of income so that she can obtain and maintain housing. And these are just a few of the examples of the impact that the Black Child Legacy Campaign has within our community. And with your continued support, we can continue with these efforts of lowering the disparities within the African American community. Thank you.
Good. Thanks, Lauren. Okay, you just tell me who you are when you come forward, since you know what order you're coming in. I had Brandy and Sharia, but okay.
Hello, I'm here with my peers, my brothers and sisters from the Black Child Legacy Campaign. I wanted to open this up by sharing a piece that I wrote that had to do with our community. And after sharing this, that we will also share.
Okay, well, tell us who you are, though. Tell us who you are.
I'm Sean Dustin.
Okay.
The senior at Encina High School. Thank you for the opportunity of being here. I really appreciate it.
Thank you.
And you kind of gave me a get out of school free card, so thank you for that. No, but
was that prepared?
So the piece that I wrote is about a real life situation that I went through myself from the perspective of me and the Caucasian officer that I encountered in the Natomas neighborhood I lived in. Dear officer, do you enjoy offing us? Do you see me as a threat? Fret when you grasp the Beretta, pressing your knee on my neck. I know I fit the description. I know I am a suspect. I know my rights, my mouth is sealed. Congealed by the conversational minefield you have set ablaze to which I should yield. I feel the steel on my wrist, tightening around my skin, grasping and tearing it open. All of this unfolded and there is not a word I have spoken, but I'm the threat. Release me so I can continue to rap. Maybe you assumed I do that because I'm black. The odds stacked against my matte pigment. Pigs equals imprisoned, face printed on a t-shirt. When I am coffin-ridden, you're smitten with black children with bright visions, so I'm placed in the backseat, caged like some live meat, interrogated till you find something to call guilty. All of my life, I have been scared of you cops. Now I'm living my worst fear. I proclaimed I wouldn't falter, but I never thought I would be here. My whole body is shaking faintly, staring anxious, scared and angry. My body's where you'd be aiming. Hope my mom don't see me riddled in bullets along the pavement. I stare at you so you stare back. You glance at your police tablet. You say you mistook me for a similar suspect. Get out the car. Now, dear suspect, do you enjoy offing us? Do you see me as a threat? You see my cop car and instantly you disrespect? I'm just patrolling, rolling, hoping that somehow I'll protect. But I can't help it if you look like someone who was wanted. You seem nervous. Looks like I got the right person. You have your hands in your hoodie pocket you just might be holding. Stop, freeze, get on your knees, hands in the air. I approach you, then proceed to roll up your sleeves. I move your arm but feel resistance. I jerk it to where it needs to be. Afraid if I'm not wary, I won't go home to see my family. Because kids can tote lead bullets. Bullets can hit my gullet. I can't stop you in any other way if you choose to pull it. You hate to see cops flashing their lights when bad things happen. You're smitten with white cops because media won't stop painting us as these villains that subdue and then pop, pop, pop. I get you off of your knees. I place you in the back seat for my safety. Then I begin my inquiry, which you won't answer because you'd rather refuse to speak. It may be an amendment, but that seems fishy to me. All of my life, I have been afraid of the unknown. Growing up in a home separated from the black households, was placed inside of a school where no black kids go. Media showed you as a common criminal. My parents normally discriminated. It wasn't subliminal. So when I was let loose into society, I didn't branch out. And now I'm looking in the rear view. You stare at me, so I stare back. I glance at my police tablet. Instantly feeling regret, I turn around. I'm sorry I mistook you for a similar suspect. Get out the car.
Just tell us who you are. So and thank you for sharing that. So yeah.
Hello, I'm Kat Holloway. I go to Encina Preparatory High School. And okay, I guess I'll just start. I'm here to talk about why Black Child Legacy is so important to me and important to my community. I started this last year. I've been here for a year, and my sister just recently had a child. She's a new mother. She's really young, 22 years old, and to be honest, no one's really prepared to have a child. But going through what I have with Black Child Legacy, I was able to have a serious conversation with her where I could talk to her about certain things that I felt she needed to know that she didn't know, and that I could talk to her as first intern of Black Child Legacy, and secondly as a brother. And with that information that she learned, she was able to take care of her child and know that she has resources coming from a low-income housing where she didn't fully know how to take care of her child growing up without her mother and without her father like I did. And she took this information to inform other people that were thinking about having a family of the same age. So she was able to communicate with others and start a conversation to inform others just from what I told her. And that's how I realized that this work does have value, that it does actually touch people. And it started off with just my sister, but reached out to people that I didn't even know, that I didn't even talk to. Started off with just my sister and went to my neighbors, went to people in the community, went to people I don't know their name, but I see them on the street. But I know that they're gonna be able to take care of their children, be able to raise a family, and we don't have to go to any more funerals. So, yeah, that's my piece.
Thank you. Are others you going to present? Come on. It's all right. You're on television, so it's okay. No pressure.
All right. Hi, everybody.
Hi.
My name is Devontae Ray. I'm a sophomore at Encina Preparatory High School, and I'm going to tell you what we do. We meet every Monday from 3:30 to 5 o'clock. Right now, we're analyzing the data from the survey we just put out on child abuse and neglect. And hold on.
It's all right, Devontae. Just tell us what you're analyzing. Tell us what you're working on.
We're analyzing data from the survey we just put out.
Mm-hmm.
And so it's a long process. We've been working on it for 2 weeks now.
Wow.
But
okay, good. Thanks.
I got you. No, I got you. Yeah, I don't got this.
Okay. Good. Thank you.
My name is Sequoia.
Hi, Sequoia.
A sophomore at Encina Preparatory High School, but like he was saying, we analyzed a bunch of data from kids that go to our school. It's anonymous, so we don't know any names or anything, and it's just simply asking questions like, if you were in your household getting abused, where would you go? Where would you be more safe to tell anybody? Where would you be afraid? Or just any information about that, and just to, I'm so nervous, oh my God. Just to, get to know, just, I don't know how to word this. Just to know things, intel, to know if the child is safe, and if they're not safe, where could you go? Instead of just, staying home in a place where you're not safe at. So you could have fear and, oh my God, oh my God.
It's all right.
And it's good to know that some of these kids that did say that they're going through this, they have a place to go. And they have somebody that they could tell, and and that they don't have to just be there and at the household that they,
It's okay.
basically to close us out, knowing that we have like a time constraint, with the surveys, we're basically gauging how our movement can help kids that are in need, people that face neglect, abuse, and any sort of detrimental situation. With our own community, me discovering this recently over the summer, I've had a place to go to keep myself out of trouble, keep myself occupied, and learn about a cause bigger than ourselves. It's definitely been an experience to just keep on learning, and throughout this we're also going to be running community outreach events and stuff like that that could possibly maybe even bring in more people, volunteers that can learn about the program and actually just expand their knowledge. I think that this is a really good program, and just thank you, Phil Cerna, also for the opportunity doing this and stuff like that. I see you repping with the green shirt. I appreciate it. But yeah, so it's just, yeah.
My name is Ezra. I'm a freshman at Encina High School.
My name is Adrian Kukua. I'm a senior at Encina High School.
Great.
And we just wanted to come out here and say thank you to Supervisor Cerna and the Board of Community Supervisor. I'm sorry.
I just want to thank you guys for listening to us, because I look at us as the future, and if we can reach out to any kid that's in trouble, they gonna listen from us, not from grown-ups. They gonna listen to us because we're kids, but yeah, we're just trying to help people, get people involved with our program, Black Child Legacy campaign, and we're just trying to make the world a better place, like Michael Jackson says,
Okay, well, stand by. I know we have some comments by my colleagues, and appreciate all of you, your work as our Art and Legacy interns, but obviously you're community members who care about yourselves, your families, your peers, and you're making a difference. So, Supervisor Cerna, Supervisor Kennedy, you have comments?
Thank you, Mr. Chair.
Yes.
So if I'm not mistaken, Kat, I think I've met you before when I was out there. And when I was out there, I think it was about a year ago, I had a chance to spend a morning with a broader group of Encina students that had really embraced and adopted the then RAACD cause and effort. And I got to tell you, it was one of the most inspirational things I'd seen in a long time to note that young people, everyone from freshmen to seniors out at Encina, were not only trying to understand the data and understand some of the recent policy decisions around the effort to reduce African American child deaths, but you guys have become practitioners. You are, right, as someone just said, you're the trusted change agent here. It's not going to be someone in a uniform necessarily. It's not going to be someone in their 30s, 40s, or 50s. It's going to be you guys. So I really do appreciate you coming out today. I know public speaking sometimes can be difficult, but you guys did a great job, and just keep up the great work.
Hang on, Supervisor Kennedy.
Yeah, I just have just one comment, and that's, if you followed supervisors meetings, which I'm just guessing you haven't, I don't say things like this often, but you blew me away, and particularly, young man, that poem was freaking phenomenal, and I want to say, you guys need to stop spending so much time in North Sacramento. Come down to South Sacramento, because we need you down there.
Well, I'm in the Freeport area, so it's cool.
There we go.
Well, very powerful words, powerful actions, and obviously it rings true to the work that you're doing. So go forth and continue to do good, and come back and visit us from time to time. So, yeah, thank you.
Definitely will. Thank you.
Thank you so much. Okay, I'm way out of order here, so I don't know. I got Brandy and Sharia, and
that's a very tough act to follow.
Yeah.
But my name is Brandy Missouri. I'm with Department of Human Assistance, and I'm also an MDT representative with the Art and Arcade CIL. I have with me Heather Gonzalez. When I first started working with the Black Child Legacy Program, I was kind of nervous because I already was enjoying doing what I was doing, so I didn't know what I was getting myself into. With that being said, making the transition of being just a regular DHA worker to a Black Child Legacy DHA worker has been an amazing accomplishment. I can't even describe the feeling, particularly with the new service design that we have, the call center model that started with DHA. I felt like that was going to make me hate my job, a little bit, not getting that customer contact that, that I love so much. So making the movement was the best decision that I've ever made. I've been able to work with families directly. I've been able to help them. I've been able to work with an amazing team. We have built a great relationship, and I'm just so excited of everything that we're doing. So thank you.
Thank you, Brandy. Okay.
Hello.
Hi.
Hi, my name is Sharia Holmes.
Hi, Sharia.
As a community leader, this is my first time, I'm a little bit nervous, but as a community leader for the incubator from our Arcade Community Center, I started as a mother going through birth and beyond, and I got approached before I completed the program about being a part of the community because I reached out to a lot of community mothers of the things that I were going through with my daughter. My daughter has been born with birth defects. It's the one back there that makes all the noise. And also my son has been born with birth defects. But as a mother, I didn't let that stop me. I went out and spread awareness out to people about that, and my visitation worker seen that, so she brought me in, and I was really just stunned, and I'm just now being able to get into with the Black Child Legacy, which I'm really just stunned as much as you guys are.
Great.
Recently, yesterday, me and my daughter got to be on a brochure with another program, and I went ahead and told my team that. So they're really excited about the brochure, and I'm really excited about it as well. It shows that I'm doing something and very constructive, and that I can go out and teach other parents what it's like. I also facilitated with and co-facilitated with the Safe Sleep class and spread awareness out through my friends and family. So thank you guys so much.
Thank you, Sharia. Great. And thank you, Heather, for coming down. Okay, we next have Kim Williams. Kim's followed by Demetrius Stone and Tanya Bean. Hi, Kim.
Good afternoon. I'm Kim Williams. I am the Hub Director for Sacramento Building Healthy Communities, and we are also one of the community incubator leads for the Fruit Ridge. We're the community incubator lead for the Fruit Ridge Stockton area for Black Child Legacy, and it was a great opportunity for us with Building Healthy Communities because the work they're doing aligns so much with the work that we're doing. We're also in the same area. Our boundary areas also did overlap with each other, and so it was just a perfect marriage, I like to say, of leveraging resources and opportunities and expanding the work even broader and far out and reaching and touching more lives. So we're real excited about this program. We've been able to see some wonderful things happen. Excuse me, battling a little cold. We have our CIL is a little unique in that we are all housed in the same area. We're all in the Fruit Ridge Community Collaborative over on 44th, and so all of our partners, we've been able to bring folks together and take the opportunity to resource our partners that are already working in the area and already doing some fabulous things, and giving them the opportunities to really focus and narrow their work to really reach the population that we're trying to serve here. And so it's not BHC doing the work, but it's again in that collaborative spirit that we completely believe in, because we know this work is big and it is huge and it is important. It's a life and death situation for our babies out there, and it can't take, one agency cannot do it alone. It takes a multi agency initiative to be able to do this. And as we all come together as a collaborative, we're going to see the kind of change that we need to see, and we're going to see the lives of our children exist so that they can grow up and continue on the work that we're doing on their behalf now. So we're really excited. We have some partners that are going to share. One of our community roundtable leaders are here with us, and she's a powerhouse. She loves this work. She's a champion for us, and she's going to share. And we also have one of our partners, Demetria Stone, who is going to share the work that they're doing around child abuse and neglect.
Great. Thanks, Kim. Demetrius or Tanya, whoever wants to go. Hi, Demetrius.
Good afternoon, Mr. Chair and the rest of the board supervisors. Thank you for giving us the opportunity to come and share the work that we're doing. As Kim mentioned, first of all, my name is Demetria Stone. I'm the Director of Programs at Pro Youth and a proud member of the Fruit Ridge Stockton Boulevard CIL. It's a neighborhood that I grew up in, so it's really important and personal to me that we make this a very successful initiative. Our role with the Black Child Legacy Campaign, and specifically the Fruit Ridge Stockton Boulevard CIL, is to help reduce child abuse and neglect in the Fruit Ridge Stockton Boulevard area. The challenge with anytime you're delivering child abuse and neglect prevention classes or sessions, the challenge is no one thinks that they're a bad parent. Everyone thinks that what they're doing is for the best of their children. So overcoming that challenge, some ways that we've done that is just making the community aware that our collaboration, as Kim Williams mentioned, we're all essentially housed in the same building. Just making sure the community is aware that our collaboration is even existing. Part of that, we were able to successfully have a great trunk or treat event at the Fruit Ridge Community Collaborative, where we had an estimated, I believe it was 400 families that stopped by. We had some of the probation officers. Officer King was there. He didn't dress up, but he handed out candy, so we really appreciate that. A great opportunity just to make the community aware of what we're doing. One thing that we're doing to address child abuse and neglect is not by simply having classes. First of all, we wanted to make sure we could secure a group of parents who would be willing to listen and whose ear we would have. So we've been able to partner with Oak Ridge Elementary School on Martin Luther King Jr. Boulevard. And we're having what we call family socials. So they're not so much as classes, they're just family socials where parents can interact with their children, and we talk about the importance of overcoming trauma, whether it be self-inflicted trauma or trauma from family members in your environment, community members in your environment, and just making sure that parents are aware that they can change the narrative and reduce that trauma that they've experienced and prevent that from passing it on to their children. So just one of the things that we're doing, I'm going to let Tanya Bean come up and talk about some of the other great activities, including some of our work at Jack Bean Park.
Great. Good. Thank you, Demetrius. Okay, Tanya, and then Tanya will be followed by Ray Green and Renee. So, Tanya.
Hi, I want to thank you guys for allowing me to speak.
Thank you.
First of all, my name is Tanya Bean. It's hyphenated Garrett. My husband might just use my maiden name, but so I have been in the Fruit Ridge, Stockton area for over, I was born and raised there, 50 years. I been involved with a lot with my boys. I have 4 boys, and so they played sports. So I've always been an advocate, team mother for my mom. But unfortunately, June 11th, 2016, my youngest son was killed of gun violence, a third-party homicide. To that being said, it allowed me to just kind of wake up, and realize that my community was in desperate need of attention and help. So when I was approached, went to a meeting I just happened because, I'm gonna back up. Fruit Ridge Elementary School, which is now Fruit Ridge Collaborative. I went there. Jack Davis was my principal. So I was really, really amazed of how they turned, I was kind of upset that the school was gone, but I seen what they did with it. So, it kind of made me realize that things, that were there are really needed in our community. And I've been there all this time and never knew it. So once I was approached with Kim and some other advocate members with BCLC, I really enjoy the family oriented that I felt, that they was able to give me. Black Child Legacy campaign has really helped me heal, not only as a parent, but as a parent that has lost a child. I can reach out to other family members. I can, be that community outspoken person. I was able to do a couple things this past summer, work with different areas of work that was approached to me. So just to say that this campaign is so very much needed in all our communities. I could sit here for hours and just explain to you about what can be done, but we all see, we've seen the benefit, we see the outcome, we know that Sacramento, areas in the areas that are needed, with the Old Park areas, Fruit Ridge areas, Meadowview, Del Paso Heights, we are one community. And as I was growing up, because I am a Sacramento resident, not long ago, I, was able to go to different areas without all the nonsense that's happening now, my cousins. So I just want to thank you guys for just allowing us to, to have this campaign and be a part of it and support us. I also want to thank Kim, most definitely, because she is been able to, me to speak forward. To be a victim of a violent crime, it can tear one's home up. So I'm able to share my pain and heal my pain as well, but able to give it to, hopefully not, but other parents out there as well. So, and Jack Davis Park, thank this Park and Rec, because that was my park. Like, I was...
It still is your park.
Still is my park. I was telling Kim, so mad, but thank you. Thank you.
Thank you, Tanya, for sharing. Thank you, Kim. Thanks, Demetrius, all of you. Okay, Ray Green, and then Ray's followed by Maisha. And then Renee. Okay.
All right, so if the whole team can come, at this time,
okay,
that'd be great. Mark, you can come too. So as they're making their way, I'll go ahead and get started with my
Ray, if you want to raise the podium a little bit, there's a button right there on the side. You can, if you just push it. Okay.
I don't want to mess up anything.
Okay.
So as our team is coming on their way, Lisa as well, getting ready to come on their way, we at Roberts Family Development Center and just the entire Black Child Legacy want to thank you all for making the decision to make this possible, to really make it possible. You have sparked hope again in our community, with everyone standing behind me and those who are not represented as well. You've given us another vision for healthy birth outcomes. You've given us another vision for healthy, safe sleeping babies, for those positive parent engagement in their interactions with their children, as well as providing a healthy environment, physically, emotionally, mentally, and spiritually, to equip our youth and families to succeed. So with that, we say thank you. With the start of 2017, we've established our home at the Greater Sacramento Urban League, room 203. You all are welcome to come join us. And we are just so excited. From there on, we've really been focusing on finding who our MDT team would be. And behind me, and some are not present here, Janelle Gonzalez being one of them with CPS, we became a family. And with that, we made some consistent and very positive strides in the efforts in helping families. So far, we've been able to reach over 25 families with the multidisciplinary team process. Now, that does not include the families that we interact with every single day, every single week. These are the families who have on our intake have had a need to have that sit-down conversation, which has been a big system change. Probation has been just wonderful in referring their services and caseload, as well as DHA. We've been doing a lot of work around awareness, education, and engagement, and the MDT team has been out and outreach, and they have had community involvement as well in those trusted things. We've added 2 CLR members. We now have a total of about 6 to 7. We have 2 new cultural brokers that are being trained at this moment, so they will not be here today, but we honor them today. We also have 7 CIL sites, which we all have been cross-community collaborative in all of those efforts. Today, you hear from some of our most trusted individuals and our most important individuals, which are our families and our service providers. So with that, I now turn the mic over to Del Paso Heights team.
Okay, great. Thanks, Ray. Okay, it's Maisha, and then Renee, and then Tamika. However you want to go. So,
we're going to go out of order.
Okay, all right. Okay. Got it.
Tina Roberts.
Hi, Tina.
I just want to quickly say, I've been in this work for 20 plus years. And today I can honestly say that as a community member, I am so proud that we are able to do what so many across our country are trying to do. I applaud all of you for your support, for your investment in our community. I'm overjoyed right now, and I haven't felt that way in a long, long time. But just to see the real work, the real relationships, the real partnerships, the investment in the people, I'm just so proud of you all. Thank you.
Thanks, Tina.
Mr. Chair.
I'd like to bring up Miss Renee.
Hey, Mr. Cerna, just a second.
Yeah, no, I just wanted to make mention of the fact that I was taking a picture of Tina because I needed to send it to Daryl, who couldn't be here today, to remind him who the real boss is.
Okay.
Good afternoon. My name is Renee McAllister, and I just would like to thank Black League family. I am not a mother. I'm a mother of 4 who are grown. I'm a grandmother of 5 now total. And I was blessed with my second grandson from my daughter who decided she wanted to stay on drugs, and CPS got involved. And I refused for my grandson to be taken away. Since I already had his brother, I decided to take him. But I had no resources because it wasn't in the plan. And I went to Birth and Beyond, and they made a call to Mr. Ray Green, and my phone blew up. I had car seats, diapers, clothes, wipes. I ended up in the hospital. He called to check on me while I was in there, making sure that the baby was okay with my girls. If I needed any, outreach or anything, I had somebody call and pray with me. I am a praying woman. I'm a church member. Faithful in the choir in the community in my apartment complex where I live at in Del Paso Heights, North Avenue Apartments. And I just want to say that I thank God for this organization. I've only been in Sacramento 9 years. I'm originally from Mississippi by way of Monterey, California, and came to Sacramento to better my daughter who wanted to graduate from high school up here with her friends and her cousins. And this has been a journey, and I just want to thank God for allowing these guys to be a team and to be able to bless me, bless my grandson. Thank you, and God bless you guys all.
Thank you, Mr.
And just so you know, you can't see the TV, but the baby was just very prominent on the television set.
He's a star. Okay.
Hello, my name is Tamika Armour, Sacramento County Department of Human Assistance. Good afternoon.
Good afternoon.
In all honesty, Black Child Legacy, I'll say, was forced on me. We had someone go out on maternity leave, and I received a call from the program manager and said, okay, this is what you're going to be doing now. So naturally, my response was, well, alrighty then. So I did not understand what I would be getting into, what exactly the program was at the time. But since meeting everybody behind me and going over to Urban League, where I'm stationed currently, I'm so glad it was forced on me. The only thing I wish is that it had been forced sooner, or that I knew about it sooner. The program is incredible. I know that with the call center now in play, as the other young lady mentioned that also works at DHA, just trying to figure out, okay, how is this all going to tie in? Now I understand. You don't necessarily have to bring the people to you, but you may have to sometimes go out where they are. So I'm fully prepared for battle, and with the individuals behind me, they are empowering me every day to understand my role and to get the word out. And I know that that's important. So I've sat in on the MDT meetings, only a couple so far, but just to see how the families can be impacted, just the way that they've taken it upon themselves, we've taken it upon ourselves to hold their hand through something. Sometimes the Department of Human Assistance, we're not able to technically do that. You're here for cash aid, food stamps, Medi-Cal, and if it's not that, I need you to scoot over so I can help somebody that is. So just to know that we can, as someone said earlier, do a warm handoff, a referral to another agency, and get everything all in one place, I think that's an amazing thing.
Great.
Thank you.
Thanks, Tamika.
Good afternoon. My name is Dominique Herndon. I work at the Deep Del Paso Heights in North Sacramento CIL. I help support Mr. Green in the efforts to move this work, the movement, and the initiative. And I would be remiss if I didn't also speak on the other work that I do as a PAR champion, and just tell you guys about the work of our PAR team, which is youth-led research. And they have developed the research question of how can the community stop the cycle of gang violence in Del Paso Heights and North Sacramento. And from there, they have just grown and shown to be expansive in their thinking and shown to be critical thinkers. We have developed a survey they have distributed within their community. They had an interview with the police department and the head of the gang unit. We're also going to hold, and they're going to facilitate a focus group with community leaders this Thursday. So I just wanted to make sure that you guys know that this work, especially the participatory action research with the youth, is going, it's moving, it's growing, and it's allowing them to glow and grow and just pushing them forward. I would be remiss if I didn't advocate for them and I didn't come up here and say that they're doing a wonderful job and the work is needed. So thank you.
Thank you, Dominique.
Good afternoon. So my name is Raymond Garcia, and I'm here on behalf of ARC Anti-Recidivism Coalition and also SARS, Self-Awareness and Recovery. We're in partnership with Black Legacy, and what we do is we hold healing circles. We also work with probation officers as far as case management, and we go out here to the communities, peace walks, and we're just a part of the community and before I continue, let me just say I'm honored to be here. I'm honored to be here amongst you and everybody in this room, as far as probation officers, police officers, community leaders, and then, city officials, people that are sitting here trying to make it happen, trying to change lives, trying to change the world and make this place a better place. We all have our position to play, and as I look at this room, I'm like, man, it's a beautiful thing when I can see you, me, and these cops all in the same room working for the same goal.
It's a good thing, Raymond.
I'm formerly incarcerated. I've been incarcerated. I've been in gangs myself. And I have a position to play in this community, you know what I mean? But I can't play my position without the support of you guys, and I can't play my position without the support of these probation officers and police officers. So just to be here and be used to make a difference in our communities is a blessing. I thank you, and we're doing it. We're doing it. The community here, we're doing it. The ones that are going to help fix our communities are the ones that are closest to it, the ones that live in the communities, and we're doing it. Believe me, we're getting our hands dirty. We're getting our hands dirty. I mean, because it's personal to us. It's our families. It's our communities. It's our babies that we're giving them our all, because that's our community. Those are our babies, and we want to see them win. You know what I mean? We want to see them live. We don't want to see them die. And I'm tired of seeing people's moms crying and babies dying on the streets. That's not what it hurts. So for you guys to support us and allow us to do our work, it's a blessing. Thank you.
Thank you, Raymond.
Hello, my name is Mark Coleman. I'm a Senior Deputy Probation Officer with Sacramento County, assigned to the CIL in Del Paso Heights. And I just can't tell you how excited I was and how rewarding the work has been so far in being out there and being part of this collaborative to not only bring services, but to connect with the community out there. And, when they say, it takes a village, it really does take a village, and it's just really excited to see where it's going and to continue the work from that side and what this movement is doing is just great. So thank you.
Great, thanks, Mark. Thanks for your work. Okay, thank you all. Then I guess we go to the floor and road folks. We have Jackie Rose, Brittany Rampy, Chanel Seipert, I believe, Elisa Burton, LaDawn Gumbas, Brianna. Oh, okay, that's there. I think our group. So maybe others or some had to leave, but I trust that Jackie's going to be the one who's going to introduce.
Good afternoon.
Good afternoon. Good afternoon.
My name is Jackie Rose, and I'm with and I'll wait for my team to get up here. We're going to kind of make this real short and sweet. My name is Jackie Rose, and I'm with the Focus on Family Foundation, and we're assigned to the Meadowview CIL. I will stand here. I couldn't stand here and tell you how excited and absolutely passionate I am about this work. I've been doing the work for over 25 years in South Sacramento, so this work means a lot for me. But I had my team standing back of me because I couldn't do it without them. They always have my back. Every last one of them that's standing up here, and some of them aren't here today, but they always have my back. I couldn't stand up here and tell you that this work is easy, because it's not. This is hard work, but it's rewarding work. I don't want to, some of the work that we've done is our CIL has gone to every CPS bureau to get the word out about the Black Child Legacy campaign. Our CIL and the Valley High CIL have what we call been on a road tour of every bureau in the county to talk about this campaign and how important it is that when they get ready to close a case, they need to do that friendly handoff of some of those families to us. And we are getting those families. Our MDT works around the clock. We have MDT meetings every Thursday, but at the same time, we knew that we couldn't do the traditional things where we open up at 9 o'clock to 5 o'clock. Our CIL stays open in the evening times until 8 o'clock in the evening. So we flex our hours to accommodate those families in those evening hours, because some of our families work. And so we want to be able to accommodate those families. And so we're excited about this work. I can't begin to thank you all for funding this particular campaign, because it's been a wonderful opportunity to be the leader of this, but I couldn't do it without all these people behind me. But as I stand here and talk, I want to be able to introduce you to our program manager, who is very hands-on. It's who you select to do this work also, who's in the trenches with you to make sure this work gets done. And my program manager works with these families where they are and moves them toward that self-sufficiency state. So we're excited about that. So I want you to meet Yolanda Stevenson, and then we're going to also introduce you to two of our families that we want to actually let them tell you what this campaign means to them.
Okay,
thanks,
Jackie. Hi, Joanna.
Hi, my name is Yolanda Stevenson, and I am the program manager for the Black Child Legacy. This work has been extremely fulfilling, and working with the community exactly where they are and impacting some of the family lives in this MDT process that we have has just been empowering, and it's been heart-wrenching at the same time, helping them get through, helping them find their power, and having them stand in dignity and being empowered within themselves so that they can just keep doing this thing and knowing that they have support and wrapping our hands around all these babies. So in that, I would like to be able to bring up Miss Lisa Burton. She's one of the young ladies that we're working with the MDT. And Miss Lisa, come on up.
Okay. Hi, Lisa. Hi,
Hello,
Lisa.
my name is Lisa Burton, and that little crying baby, that was my Dylan, my grandson. Okay. First of all, he had chips against him. My daughter, through the whole pregnancy, she did meth. And he had to go to CPS. And I didn't know what to do. I didn't know where to go or anything. And I cried out to Sherelle. She's the pastor. And she told me, okay, we're going to get your room together for the baby, because the worker was going to come, and she wanted to see what I had for him, and I didn't have nothing. And so I cried out, I need stuff, help me. And she did an APP out there to everybody. There's a grandma out there that needs help, that she gotta take care of her grandson. And within 3 days, I had a whole nursery equipped with a crib, a changing station, and everything. Up till he was like a year old. She did it for me. And then recently, I lost my Section 8 and then was homeless as November the 1st. I didn't know what to do. And I cried out, help me. And Cheryl came and I know somebody that can help you. And then Yolanda Stevenson said, I'm gonna help you. You're gonna get your Section 8 back. She did calls, emails, faxes, and she didn't let up. Guess what? Yesterday I got a call. Wednesday I go and pick up my Section 8 papers. And they're gonna help me find a place and find a resource that can help me pay for the rent and deposit. Thank you.
Thank you. Miracles come in all different sizes. So.
The next family that I would like to be able to introduce is a powerful young lady. She works for us, and me and Miss Jackie had talked with her. And she was going through some hardship and going through some challenges, so she is now one of our employees, in addition to now our MDT, and her name is Brittany Rampy, and I want to introduce her now.
Okay. Hi, Brittany.
Hello, good afternoon. I first want to say thank you to this whole board and to thank you for everyone who came and just supports this whole campaign. I've been working with youth for almost 3 years, but it wasn't until I met Miss Jackie and Miss Yolanda for Focus on Family that I actually was able to progress and work with youth and really realize my impact. Over the summer, I met a hardship. I was basically homeless. I'm still going through the process of being homeless while still trying to work with youth. I was literally at my breaking point, and I had talked to Miss Yolanda and Miss Jackie because I was being denied from the county. I didn't know what I was getting ready to do, and my biggest thing was, how am I going to try to help other families, and I can't even help me and my 4-year-old daughter right now. Once I opened up to them, everything changed. Like, I can't even express how it feels to have a support of other human beings, of other adults in your corner to make sure that you're not going to fall, that you're not going to fail. It's so easy to give up, and I was at my breaking point. I was going to quit. I was just going to stop, and then that's just even more of a downfall. I was getting ready to be in a circle that I was not going to be able to get out. Just talking to them, Miss Yolanda, Miss Jackie, it's a constant, they're always checking on you. The fact that hopefully by Thanksgiving, me and my daughter will have a place again, that support there has literally made a difference in my life. And I cannot express even how much I feel right now. Being here is emotional for me. I never even imagined getting this opportunity. I hug them every day, and I cry. I always tell them, I'm like, oh, you're gonna make me cry, because I didn't have the mom support and my dad support. So the fact that this whole organization, and then just to get it from you guys as well, it means a difference. Thank you. Seriously, thank you. Thank you.
Thanks, Brittany. Good luck. Okay, good. Well, thank you all for being here. Thanks, Jackie, Liliana, Brittany, Lisa. Okay, next I have,
I am so sorry, I'm out of order. I was just told I was supposed to come up here.
Okay, all right, it's okay.
Hi, I'm Pastor Sherelle English.
Oh, Pastor, okay.
And I'm a proud member of BCLC as a community leader roundtable. And I have 3 words that actually identify this organization. The first being one voice. As a past choir director, when you have all the choir members together, you always say you want to hear one voice, one movement, one goal. And that's what you see behind me. It's a collaborative effort of transformed minds that renewed themselves in such a way that they said, we see one common goal. How do we take care of our children? And you don't see any pompous attitudes. You don't see any I want to bring myself up higher than you. What you see is, how do we get to the main solution? I'm blessed to be able to support any CIL that needs me. I come out of Meadowview today, but I have worked with Del Paso Heights and had the opportunity to get 2 young men cleats so that they could play in their football league. Okay, I've had the ability, as Lisa said, to be able to make out a call and see everyone come together in the community to make sure that that baby had everything it needed to be okay. You know, I have had more opportunities to be available than ever before to our community, to our youth, and to this initiative. And I'm really grateful for that, because initially my next word is hope. I'm a recipient of one of the many grants, and I lead an initiative called JA Moneymakers out of Dyer Kelly High School, Dyer Kelly Elementary, trying to watch the clock, in Arden. And this little girl said, wow, somebody really cares about me. And they have hope. They want to be scientists, they want to be teachers, they want to be police officers, they want to be soldiers. And to know that we're coming out and saying, yes, this really can happen. There is change, there is hope, and it's available. And it's available because we have one voice, and today we have a solution that we can really be active on. I just want to say thank you.
Thank you, Pastor Amish, for your Okay, I believe next, Brianna Davis and Gary Young, Tasha Johnson, Les Simmons, I think, following. Good afternoon.
Good afternoon. I'm not Brianna Davis. But I am Lamar Thorpe, and I serve as Vice President of Development and Communications for the Greater Sacramento Urban League. And when I first started here 5 months ago, I inherited the Black Child Legacy in Oak Park. And then we went through some transitions, and we then brought on board the real Brianna Davis. And so we're excited to have her. I will add that I want to thank, and I didn't get your name, but I want to thank you for sharing your story about your grandson.
Lisa Burton.
Lisa, I want to thank you for sharing your story about your grandson. I'm often asked, what did I study in college? And I politely respond with women. And some of you are giggling, but I actually do have a master's in women's studies and a bachelor's degree in sociology and women's studies. But since college, I've always worked in higher education as a fundraiser, so I've never really had the opportunity to use the real work that I was trying to do in women's studies and community work and advocacy to use. And so when I came here and took this job, I inherited the Black Child Legacy campaign, and there is no greater honor than serving in this role and doing the work that we do in in Oak Park. And it's passionate, and I'm passionate about it because, like your grandson, my mother was a heroin addict when she was pregnant with me, and so as a result of that, I was actually born in prison and raised in foster care. So I'm excited about the work that we're doing here today, and I'm excited that we're working on this collaboratively. And so from there, I will turn it over to our lovely leader, Ms. Brianna Davis.
Thank you very much.
Yes, so I am Brianna Davis. I'm actually the new CIL lead for the Oak Park community. I'm so excited about all the things that we're doing. We're building new partnerships. We're gaining new CLR members. So community members are coming in, they're getting trained, and we're just really excited about the growth that we've been experiencing. Another aspect that I'm really excited about is our MDT process. We are building partners and really collaborating with other organizations and community partners. So to talk really about what we've been doing and the impact that we've been making, I have a couple of people that I want to speak. One is Pastor Gary Owens. He is one of the faith leaders that is involved in our peace walks. And then I'll also have Melissa Hill from WellSpace talk about our MDT process and some of the stories that have come about in that process, and also Tasha Johnson, who is our youth development manager for the Urban League.
Okay, Pastor Gary.
Amen. And actually, it's Pastor Young, Gary Young.
That's what I thought. Yeah, I thought it was Gary Young.
Was it on
Okay.
there? Okay. The New Hope Church, Baptist Church in Oak Park. I actually represent a collaborative of other pastors who have joined this effort with the groups involved. They couldn't be here. Pastor Terrell Jones, Pastor Anthony Sadler, and Reverend Dr. Ephraim Williams. And for a number of months, we've been joining with these groups in the Community Peace Walk in Oak Park because we recognize our shared interest. Our churches are located in the communities, but the realities are most of our congregants drive into the community. So we do have a common ground with the persons who live in the community to make sure that the peace, the violence stays down. And so we've been doing this for a couple of months. We have a group out of our church that actually have been doing it over a number of years on Fridays to walk in the community. Key word that's been mentioned here today a number of times has been the word relationships. And what we found is that we've initiated relationships with persons in our communities that we didn't really know were there. We are benefiting by those relationships. I think our churches are benefiting by the relationships, and certainly our communities are benefiting by the relationship. I want to thank you and all the groups necessary for the opportunity to be able to say a word about this very positive effort.
Great.
Thank you so
Pastor
much.
Young. Next.
Hi, my name is Tasha Johnson, and I'm the Youth Development Manager for the Greater Sacramento Urban League.
Tasha.
And one of the many hats that I wear is going into vocational high schools to train students on job readiness, career exploration, and just preparing them to enter the workforce potentially after graduating from high school. So in my position, I was talking to a young man, and he didn't know what he wanted to do, so I'm asking him a million questions. I used to be a middle school teacher. So I'm asking him a lot of questions, and he's answering, and I asked for his address, and he was like, Miss, you don't want to know that. And I was like, I kind of do, but if you don't want me to, it's okay. So he finally told me that he was homeless. And so, kind of switching hats, I think I physically spun around in the chair like, so, would you like help in that? And he answered yes, and so I walked him through our MDT process that we have in the Oak Park CIL, and got all of his information, and through that, the team in Oak Park was able to come together and get him clothing and get him resources to access housing and shelter. And he is a vulnerable youth. He's an African American male in the targeted population that falls into all those different traps that are set for him, and he's refusing to do so. And he was supported by us in bettering his position and his situation. So the following week after I saw him, he came to the CIL. Hey, and he felt really welcomed and embraced. The following week, I presented in his class, and he was the only one that knew who the Urban League was. And again, this was a different hat, not the CIL hat. And I'm introducing ourselves, and I was like, hey, do you want to share what the Urban League does? And he was like, yeah, they find people houses for homeless people, and they really help you, and they give you clothes. And I'm like, kind of. So he was really excited to share the help that he got, and he was actually educating his peers on not just what's out there as resources, but what the issues are that others face within their peer group. So I'm really excited that we're doing this work, and the Oak Park CIL is committed to this work with everyone else.
Great. Thanks, Tasha. Thanks for sharing.
Hi, I'm Melissa Hill, and I'm the Program Manager for the WellSpace Health Cultural Broker Prenatal Support Program. We are very happy to be partnering with the Oak Park SIL and also the Meadowville the Meadowview SIL in helping them with any pregnant woman that comes in and needs services. I was attending an MDT meeting at Oak Park, and the CPS worker had a referral for a woman that was probably about 33 weeks pregnant, had been dismissed from a couple different OB practices in Sacramento, and so I was able to go back in, get her fast-tracked into prenatal care with WellSpace Health. She signed up in the cultural broker program. Her prenatal support advisor went with her to her first 2 visits because there'd been issues with her and office staff in the past, and I'm happy to say she's getting all the services she needs. And I also got to see at the SIL that she was also getting services from SETA and from DHA, and it's just really great that we're all delivering the same message to these women, and we're just really happy to be a part of this. Thank you.
Thanks, Melissa. Anyone else? Oh, I guess that's got it. Thank you all for sharing. Thank you very much. Okay, then next I have Les Simmons, or Rachel Francios, Antoinette Clark, Paris Dye. Yes, sir. Okay. Was that the luck of the draw that you get to be one of the last teams, or no?
Yeah, that's the draw. And then
I didn't shuffle them, so I'm sorry.
Then I'm also the pastor as well, and typically I go at the end of service and am doing an altar call. But I would say we're all saved in here, and I think we need to do some work to lead the rest of the country. As Chet talked about, the only 2 counties are actually doing this work, and this is sacred work that we're doing. To see it happen on a daily basis at the Valley High CIL, as well as the 6 other community incubator leads spread out throughout the county. This is the sacred work that I feel we're called to do to save lives. I see it happen on a daily basis through the MDT meetings that are happening, bringing together grassroots community organizations, as well as our city and county services to really do case management, strong collaborative case management, as well as on big events. One of the things that I'm really excited about are the family skate nights that we sponsor through our Black Child Legacy. We hold them in the old historical Cal Skate building in South Sacramento, where we see through our program manager, Katrina Simmons, and the Net West, bring together from anywhere from 100 to 150 individuals and really advocate for Black Child Legacy, as well as offer alternative to violence conversations. Another thing that excites me about the work that we're doing is really creating a baseline for first responders within Sacramento County, for us to not only respond in gang violence and third-party homicide situations, but to be able to also interrupt violence, which is a key part of stopping the violence within our community through rumor control, through strong advocacy work as well, though that work is happening. I want to just quickly introduce not only some of our team, but some of the folks that have signed up to speak, some of our youth advocates as well. One of them is very precious to me. I've seen this young lady go through some traumatizing events, losing her sister to cancer, losing her mom to cancer, and losing her grandmother to cancer, but now is in this work of saving lives and building a legacy for the next generation. That's Rachel, and she's going to just speak on the youth piece as well.
Okay, thanks, Pastor. Hi, Rachel.
Hi, I'm Rachel Francois, and I'm a youth leader for the Valley High CIL. I'm in the Valley High area at least 3 times a week with family, friends, or just helping in the community. And whether it's participating in PAR, the Legacy Camp, or even just working the booths at different events for Black Child Legacy, the Black Child Legacy campaign has helped me come out of my shell more and become more of a leader. And not only has it helped me realize my potential, but in that, the Black Child Legacy campaign has really allowed me to get involved and to be a part of the solution, because it is centered around the youth, and if youth don't get involved, then our legacy and the legacy of this campaign won't ever continue to grow. And as a youth leader, I understand that it is our responsibility to carry out this legacy forward and to save our babies.
Thank you, Rachel.
Hello, my name is Nanette West, and I actually am so pleased to be able to speak in front of you today. I have lived around the world and throughout this country, and I have never seen anything like this. When I look at the word awesome, I can't help but think of Black Child Legacy. I was not purposely, I did not bring myself into this work. I was being obedient and was brought on by Pastor Les and his wife, and I have been running with it ever since. It is such an honor and a joy to work with my community. I work in Valley High. I attend church at Valley High, in the Valley High area. I live in Valley High, and I shop in Valley High, so Valley High is my home. I am from Sacramento, born and raised, and I am very, very proud to be a part of Black Child Legacy, and I can't wait to see what it has to offer our next generation, because this is just awesome work that they're doing. And thank you so much for supporting this. You guys are doing awesome work as well, so thank you. We appreciate you guys.
Thank you, Annette. And thank you for answering Pastor Simmons' call. So.
My name is Antoinette Clark, and I'm at the Valley High as a community lead of the Roundtable. And being a part of, I think that this is an awesome program. I have a youth that was in trouble a little bit with the law, and when I got the call to go out there, the youth, and they were talking about leadership and things that we can do, and I said, oh, well, I'm a part of the Valley High program at the incubator lead, and they were like, you know what, I know that program. And before I can get away, I got a call from the probation officer asking me, did we need any help with the situation that we had there? I thought it was really eye-opening to be for them to be so active so fast to get my son in the services that he needed. It was really a great program that I thought, and me being a foster parent, when I went through the whole little system with adopting my younger brother and sister, the sources wasn't out there for us. We were confused, and at first I was turned away. They were like, oh, you're too young for this. You already have kids. That's what I was told way back then. I wish this program was implemented then, because it is amazing what they can offer you and send you in the right path on things that you can get to make our lives better. And I really appreciate you guys advocating and supporting it, and we really appreciate it. Thank you.
Thank you, Antoinette.
And then we have Jacqueline, who's on site, part of our MDT. She's an amazing person. Please.
Well, thank you very much, sir. My name is Jacqueline Ingram Duncan, and I'm an informal supervision CPS social worker, proud to say. And it is an honor that I stand before you today and to work with such marvelous, compassionate people for children. It does take a village to raise a child, but it takes a village to raise a family, and that never ends. It's a lifetime. So we have like a real life story about a 56-year-old gentleman that called in one day, frantically calling. He needed help with his wife and his two-year-old daughter, and he couldn't see that he needed any services or needed to make any changes himself. And so he started talking about the wife, what she was doing, asked me, well, did I speak with her? And I said, yes, sir, but with all due respect, the two of you are saying the same thing about each other. And so he said, well, can I run in, and where are you located? I gave him the address, 7710 Stockton Boulevard, South Sacramento Christian Center. He came on in, rushed in with his 2-year-old daughter, and he was speaking with the pastor for 2 hours. And when he came out, well, of course, we provided daycare services for the 2-year-old. And by the time he came out, he could see that he really needed to focus more on himself and his individual, just things that he needed to focus on for as a human being that he couldn't see before. And so he thanked the pastor. The next week he was out at church with his family, and that was earlier in the year. And today I still see him at services, just engaged in services, strategies for change. He's drug testing, he's taking parenting, counseling with his wife. They have a new baby, and he weighs me down, and he says, thank you so much for helping me. You guys are doing such great work. I'm 56, and I finally feel like I'm grown up. Thank you so much.
Thanks, Jacqueline, for sharing.
I think that's it as far as, unless you have some comments. This is our.
I'm trying to keep it short.
Okay.
Everybody have said it all.
Everybody said it all, but again, thank you, County Board of Supervisors, for you believing in our legacy and supporting Black Child Legacy, and then to the Steering Committee for the Reduction of African American Childhood Death. Thank you guys for really making an effort to bring everybody together. You guys are some heroes, and we love you, and thank you guys so much. Thank you.
Thank you, Pastor Lester. Okay, I have some others, and some of these may have spoken already. They were, but I have Paris Dye and then Audra Sip. Okay. Oh, I'm sorry. Okay, and Bentley Callender, you didn't speak yet. Nope. Cynthia Matthews. Okay, come on down. Oh, okay, great. And then then we have Demore Jackson and Alma Cover. Okay.
Split Hill Farms.
Very, very patient you all are. So.
Does that work?
Yeah, well, yeah, we just put the screen up. Yes, we can get that. Sure.
Good afternoon.
Good afternoon.
My name is Cynthia Matthews, and
hey, Cynthia.
Hi. Recently retired from the state of California in June of 2016, and before I retired, my sister told me that you're going to be helping me, so I'm pretty much volunteering. And also, as a small business owner, my husband and I own American River Home Inspections, so home inspection business. My role as a partner, a community partner, I've participated in quite a few things, such as we had. The first thing I went to was a Make It Matter conference with women, and I facilitated a goal-setting class. I'm trained. I was a trainer at the state, but I did soft skill courses, mainly personal development, and also skill building to get jobs, employment. So in the Make It Matter conference, I facilitated the goal-setting class and helped the people identify goals in their lives and what they wanted to accomplish. Also, I've facilitated a roundtable discussion for our employment readiness program, and it involved community leaders and business owners, and also people just in the program. And we came up to develop components for our employment readiness program. And we have Steve Garrett from the Public Defender's Office, and also Marlon Yarbrough from Probation, who attended that meeting. Okay. So it was really good. And out of that meeting, we developed certain components that we needed to get ready to start helping the youth get jobs. Okay, so with that, I led a resume writing class, and we're preparing to help with interviewing and dressing for success, all the components to take to help people get jobs. Since I had mentors throughout my career, I felt like this is a wonderful opportunity for me to pay it forward. And I'm very happy, and thank you for your support in this. We also participated in a healing circle, and that's when I really realized that we need help, and it's so many people out there who need help. In that healing circle, we had a variety of people. One was just shot walking down the street. Her dad was with her, but he didn't get shot. She just got caught up in the gun violence. We have one young lady who lost her mom, and she's only like 19, 20 years old. Another one was robbed at her job and beat down. an ex-gang violent member, and a mom who lost her son. So it just had a wealth of everybody in there who needed some support. So I felt that healing circle was great. We ended up doing a painting with an organization called Paint Like a Butterfly. And so it was a great bonding experience, and to let the people know that we are here to support them. And they were very appreciative that we were there. I've also been trained to provide training for the Safe Infant Sleep program. And with that, we wanted to tie in our business, and my husband is willing to visit the homes of the families to make sure that their homes are safe, because sometimes they don't know about the wiring with their cords or just simple safe living. So with the Safe Infant Sleep program, we want the whole family to be safe.
Right.
So with that, that's our contribution.
Thank you,
Okay,
Cynthia.
thank
good,
you.
Good. Others? Come forward. Yep. Thanks, Cynthia.
Hi, I'm Paris Dye, and I have the privilege of working with the North Highlands Foothill Farms Community Incubator Lead. I love the work. I love the county partnerships with the MDT and the other people that are involved from the whole work from the top down. I get to call a lot of people. I have more work husbands and work wives than I've ever had before because of the responsiveness that happens. So we do quite a bit of work out there in Foothill Farms and North Highlands, spreading awareness. We attend community events. Our partnership with Twin Rivers School District has opened doors. We are wide open to the high school, to the elementary schools. We do a variety of pop-up parties and different things where we educate people. Hold on, here you go. Part 2. We participate in a lot of community walks. We've done peace walks where law enforcement comes out. We host events at our location like Neon Night, where we have an opportunity to reach about 400 families. We fed the football team. Food is really important. 2 years ago yesterday, we lost J.J. Clavo while he was out trying to get a meal before football. So we were able to partner with the school and take the kids' stuff. We loaf an 800-pound bounce house around to our places and community events. When you have 3 people and an 800-pound slide on a truck, you hope to get a lot of attention, and it does. It just brings out lots of people, healing circles and all of that. But it's a great privilege to be here, and our team is going to be swift and as quick as we can to share what we do.
Okay, thanks, Paris. Okay, next.
Here comes Littles. I'm nervous, you guys.
Don't be nervous.
I don't do this. My name is Audra Sipp.
Hey, Audra.
I started going recently. I lost my son to gun violence last year. It was the worst day of my life. Now I'm taking care of my grandson. I'm sorry. It's really, really hard for me still. All I used to do is sit in my room and cry and tell God I want my baby back. And I wanted to give up, but I can't because I have 5 more sons and I have 7 grandkids. But I love Paris because she called me to the program, and I go down there and we sit in circles and we talk and we express our feelings, and I get to cry because I try not to cry at home. I try to be the big mother and not cry in front of my grandbaby. So I get to cry, I get to paint, and at the end I feel really good. But they're here, they support me. Like, my family don't call and check on me and nothing, so if it wasn't for them, I don't know what I'd do. I'd probably be giving up and crawling in a hole. Sometimes I just want to die, but it's not an option. So I just want to thank them, and I want to thank you guys for this program. I wish it was here a long time ago because I was a young mother. When I was 23, I had 5 kids. I was homeless, but now I'm a homeowner. And I've been married 29 years. Well, not married, but with my kids' as father. One day it might happen, you know. Paris will marry me, you know. Maybe.
Audra, that's on television, so you just told the world about it.
So much. I just want to thank you so much, and I want to thank you guys for being here for me. I'm sorry for always being a crybaby. They gave me my nickname Puddles, and it's fine. I'll be Puddles. God bless you guys, and thank you.
Audra, just for our next speaker, when you sign up, you put what you're going to speak about, and a lot of folks didn't do that, but you put, I wish to speak on the following subject that is not on the agenda. I think it really was. And you put healing, Healing. That's right. And that's right. This you spoke to, getting better.
Thank you.
Thank you. Okay. All right.
Good afternoon. My name is Alma Caravarin. I am a volunteer at the Liberty Tower CIL. I specifically work there with the Participatory Action Research Team, which is the group of youth for our area. The youth there actually come from both District 3 and District 4. So I like to really share the news with you about this amazing group of teenagers. We have 5 of them right now. They've been meeting since June. On a weekly basis, they, at the beginning of the school year, actually, they amped up their commitment to this project, and they started meeting twice after school, which I know is actually like a challenge for them because they're trying to balance other activities, and they support their families in different ways. But after they have experienced, and they have been informed and educated on the issues that are happening in Sacramento, and specifically in their neighborhood, they have been really energized and really developed commitment that makes me really proud about the work that the Black Child Legacy has been able to do in our communities, because it really has activated these youth. You can see some of their faces there. I think it's mostly the girls there, not the guys. But they have been really committed to the work. They have been working on the question, out of all the things that they really found out in information, what they were more interested about, because of the feedback that they got from their peers, was on how third-party violence and third-party homicide is affecting the youth in their area, in their schools. Where their question is, the research question is, how does miscommunication and conflict lead to violence? And in addressing this, they developed a survey. It has been really, really hard process, but they have really stepped up to the challenge. They introduced the survey, so really with a lot of encouragement, a lot of the technical support, technical assistance support team has been meeting with them, and they developed a survey that they introduced to two of their high schools. So they administer 1,158 surveys on one high school, and it's over 500 on the other one, which they're going to continue to analyze for data. But they're very excited on educating the community on these issues, and they are very excited. They will be very excited to present to you guys their findings. They've actually continuously been getting some feedback and some support on how to develop some of those public speaking skills and so on and so forth. But I know that I'm a little bit past my time, but I really wanted to make the connection to how the participatory action research is really has been benefiting from the increased capacity that the Black Child Legacy campaign has been able to help our organization, Liberty Towers, as a church, as a CIL in our area. One of the trends that we saw in one of the graphs that I believe Dr. Evans had with the indicators and risk was that poverty is one of those things that continues to be there. It's one of the highest things that continue to go up, and 68%, I believe. And I think that we recognize at that site how investing in the youth in what is economic prospects and job development is actually going to be an investment to address all of these other things. And the participatory action research team is really identifying those as possible areas and where they want to continue to work and expand this research project to be an after-school program for their high schools.
Great. Thanks,
Thank
Alma.
Hello, I'm Mark Johnson, long-time listener, first-time caller.
Call again.
Yes, so I'm different. I don't really work too much in the community. I work at Home Depot in Carmichael, but I do a lot of my work there for the community at Home Depot. And I've pretty much got into the employment readiness experience, getting in touch with paroles and the sheriff department and a bunch of other businesses on how to help youth that are neglecting abuse get a job, and not only get a job, but keep a job. So I recently, pretty much, the first 2-3 years at Home Depot, I was just joking around, having fun, and then eventually I decided I wanted to promote up. And I had to, on my own, figure out who to talk to, how to promote myself in a way so I can move up in the company. And once I figured out how to do that, I pretty much started mentoring kids and people below me. And my first was a minority girl from Guatemala. Taught her what to do as a supervisor, who to talk to when you wanted to interview, how to do that, how to make sure you put yourself in a position to when a position opens up, how to get it. And then once I moved up on, she was able to get my position. And then from there, I started working more with the Law Associates, which are about 18, 19. Like right now, I have one that just graduated from Center, another one just graduated from Del Campo, another one just graduated from San Juan, and how to help them move from the lot to on the floor, which is a little bit of a pay raise, how to exceed there, and also started working with my mom, Miss Paris, on high school kids and how to interview. A lot of times their parents will tell them to go out and get a job, but they won't tell them how to get a job. The difference between saying ask and ask, how that can take you so much further in life. So that's why I love Black Child Legacy, is because it's not just Black Child, it's all children. And they're all walks of life, and a lot of times they just need a slight helping hand in order to move on and to grow and become bigger. So I don't too much go into the community. I help where I can, and I do a lot of work at Home Depot, and I help a lot of people that way. So I don't want to keep us waiting because I'm hungry, so thank you.
Thank you, Mark.
Oh, this picture too.
Okay.
I look good in this picture.
Very good, thanks. Okay, next. Good afternoon.
Good afternoon. My name is Bentley Callender, and our company is Callender Insurance Services. We're an insurance broker, and we are part of the incubator team in North Highlands and Foothill. And what we do is we assist really anyone that comes to us, but we assist with helping people enroll in healthcare coverage, which is really important to what we're talking about here. We also assist with mentorship and engaging male youths with the employment readiness program and entrepreneurship. One of the things that we're talking about here and listening to a lot of the stories and testimonials, we're really talking about relationships here. And I think this is what's great that the Black Child Legacy is bringing to the community. And personally, and I think there's a lot of studies out there, stress is such a huge contributor to things that go wrong in the community or in society. And one of the things that this is doing is helping lower the stress level. It's giving people an outlet where to go to find the help that they need, which is really, really important. And bringing awareness to the community. One thing about what we do as a company, and a lot of people don't know this, is that it's not just us, but it doesn't cost anyone any different to purchase healthcare coverage if they go through an agent or broker. It's the same price, but the thing that we can do is help navigate the system. Even after someone buys a policy, we still help them navigate the system. So that's one of the things that we're bringing to the North Highlands Foothill Incubator.
Great.
Thank you.
Thank you, Billy. Okay.
Hi, my name is Hasmin. Most people call me Peanut. I'm the DHA Human Services Specialist that's associated or outstationed at Liberty Towers. So anybody that comes in the door, whether they're Black Special Skills, caseload assigned to me or not, if they have questions about CalWORKS, food stamp, Medi-Cal, GA, I know all the regulations, and so I'm there to navigate, to help them basically know what program ins and outs of what they may need for them, individuals and families. The other thing I really like this program is I've been with the county for 12, going on 13 years. I've always been some kind of public contact worker. I've been clerical for a long time. Then I was a HIS, doing all levels of the job, and I was a job club facilitator. Before I came here. So one of the things that I really like is that when you take that element of, oh, you're the government,
that stigma that people don't want to talk to me because, oh, well, you're the government, we don't trust you. But then, when you take the eligibility element out of it and you can talk to people person to person, you really find out, what kind of issues and situations that they may be facing and that fall in the category of what we're doing. And so I really enjoy it. All of my coworkers are hating. They're at the bureau and they're in the service center design model. They're so jealous. But I'm really glad that I was able to take this position because I really want to be able to reach out to the community, and this is my chance to do it.
Great.
So thank you.
Thank you. Okay.
Hi, I'm Ross. I'm obviously with the North Highlands Foothill Farm CIL. I've been working in the North Highlands Foothill Farm area for about like 7 years now. And I guess I kind of want to talk about like what it was like before the Black Child Legacy campaign and like what it's been like after that. I got notes. I'm like, when I first got there, right, there was kind of this narrative. Again, our area is unincorporated. So like, you guys are our only real representation, right? So the narrative is that we're kind of a forgotten area, right? But now with this campaign, we feel connected to the whole county. We feel like we're part of something bigger, and I see it with the youth especially. They feel empowered, they feel like they're part of something bigger, and they actually feel like they can make a difference. And so I'm seeing that like narrative change. And the other thing that like I've noticed is, we have worked with a lot of families. One family came in, the guy was asking for money. We were able to get him a job, kind of get him some support, and he was moving forward. But then he moved to the south side, so our services didn't reach out there, whatever, and he couldn't make it back. So we kind of lost touch. He lost that support, and the guy relapsed, right? Now, with our network, with Black Child Legacy campaign, we can be like, oh, you're moving to the south side. Oh, I know some people out there, right? Like, let me give you a handoff to them. Oh, you're moving to Del Paso. Oh, like, let me give you a raise number, right? So people, as they move around, can still stay connecting, still get that support. And I think that has been some of the big changes I've noticed from this for the people that I've worked with and with the community. Thank you.
Thank you, Ross. Okay. Okay, thank you so much.
Peanut and puddles.
Thank you guys again.
Great, thank you. Thanks, Mark. Okay, hopefully I didn't miss anybody. I've got two other slips here. I have Elianne Murphy, and is it Demore Jackson?
Lamar was with the Urban League, and Elianne had to go.
Okay, all right. So did we get everybody covered? Is there anybody else that didn't get a chance to speak that I may have overlooked? If not, it's been a pretty powerful morning and early afternoon with all the sharing of stories and the good work that's gone on, certainly in the Black Child Legacy Project. So with that, I don't know if there's any other comments by board members. If not, Mr. Cerna, Ms. Peters. Phil, yeah, Phil, punched up first.
So, thank you, Mr. Chair. Always actually can't wait to hear the progress that's being made on this important front from everyone. We hear it now on an annual basis. I tend to be a little closer to things on a more frequent basis, just because I'm checking in with Chad or others about how we're implementing our planning objectives. But it really is the stories we hear from mothers and grandmothers and those who have lost their children, and some of it's difficult to listen to. It's very emotional, but to know that we have this effort that is so sincere and well thought out in this county, I couldn't be more proud, and I couldn't be more proud of my colleagues too, because this is not about one single individual. This is about the county, its infrastructure, its people, its elected leadership, working together with our nonprofit partners, working closely with certainly the Sierra Health Foundation, and so many other organizations to do and to achieve something special. And I think, as the chair mentioned earlier, this is really about measuring the most important aspect of what we do collectively, and that's saving lives. So I Mr. Chair, I'm just a little bit overwhelmed in a good way. And I want to commend everyone that had a small role to play, a big role to play. I want to certainly encourage those that perhaps are watching that don't know much about the effort to do some research, do some homework. I suspect they can probably just do a Google of Black Child Legacy campaign and find plenty of information to lead them in the right direction. I would also encourage all of our offices to get a hold of extra copies so that we can share the information directly, the hard copy materials in terms of the annual report with our constituents. And again, I just want to thank all of our, certainly our county employees, our various departments, probation, DHHS, DHA, and everyone else that's been part of this incredible effort. Thanks.
Thanks, Bill.
Okay, thank you. I wanted to say thank you to Sierra Health and the county departments, all of them, for this incredible effort, the way it is integrated between government and a private nonprofit. The teamwork that is shown in setting up all these different centers and everyone who's working there. I cannot believe the respect and love that I heard today. It's not always what happens here in this board chambers. The enthusiasm was palpable, and I really am coming away from this very positive and feel like all of the people who spoke here today are going to make a difference for future generations. So thank you for your work and dedication. Thank you.
Thank you. Okay, Supervisor Frost.
I just want to echo the words of my colleagues, but also wanted to thank the county staff for all that you do. You've changed the way people look at CPS and human services and government, and I think it's amazing what you do. And probation is always there. Thank you. But to the community and Black Child Legacy campaign and to all the partners, thank you for your compassionate leadership and for the hope and support that you bring to the community. And I'm new to this board, so I don't know all of you, but I'm looking forward to supporting your effort, and I think you folks are the closest to my district, so I'm looking forward. I just signed up for your email newsletter online, so let's connect. So thanks for all that you're doing. I appreciate all that you do.
Great. Well, again, thanks to go around to everyone, certainly my colleagues for their comments and certainly the support of this board, but the support of the broader community. And it's an incredible effort that's going to have remarkable results. And I think today was a real testament to all of that. So with that, again, thanks to all who stayed with us through the presentations. Again, very important, very powerful. And I know good things, many good things lie ahead. So thanks again. And with that, we could conclude the morning session, and we're going to take a break. We said we'd be back about 2:30. We'll say like 2:40 now. We need about 40 minutes. We'll have a closed session during that intervening time. Is that correct? Is that the plan?
What I was going to recommend is to come back at 2:40, have close, and then come back and open.
Okay,
our
can we go directly to closed session at 2:40 then, and come back? We'll adjourn for a brief recess for a break. Come back. We'll go into closed session at 2:40. Return here.
Right after that, yep.
Right after. So the afternoon will get bumped for those who have been showing up now for the remaining morning item, and the afternoon items will be through the afternoon. So there'll be some reshuffling, not shuffling, but just going to push stuff down. So, okay. So we'll be back in open session roughly around 3 o'clock or so. So.
This meeting of the Board of Supervisors is back in session. The board is adjourned in closed session and will reconvene in open session at the conclusion of the closed session.
Good afternoon. Want to call back into session the Sacramento County Board of Supervisors November 14, 2017 meeting, and thank all who joined us for the afternoon session. Actually, we still have a portion of the morning session remaining. We didn't adjourn to almost 2 o'clock from the portion of the morning session. So I know there are a number of you that are here on items that are on the afternoon agenda, so we're going to do our best to try to manage our way through that. And the reason for the consultation up here was to see if there was any shuffling that could occur. But I think in light of certainly the attendance and the speakers, we're going to keep it in the order. We'll do our best to, again, move expeditiously, but also take into account testimony and certainly the board's deliberations on the matters on the agenda. So with that, we'll go ahead and call the roll to reestablish quorum in session. We did have a closed session. Nothing to announce out of that, I don't believe. Is that right, Ms. Trevon?
Right.
Okay. All right. So Flo, call the roll. Let's get started.
Okay, Supervisors Frost. Here. Kennedy.
Here.
Peters. Here. Cerna.
Here.
Natoli.
Here.
And you have a quorum.
Thanks. And I would just make an announcement that we've been given information that I know there's a number of folks that are going to want to address the board off agenda on the in-home supportive services, but unfortunately someone who has a green Honda Civic, you don't need to jump up right now, but you're double parked at the SEIU office at Capitol Avenue, and if you don't get the car moved or make arrangements, somebody's going to move it for you, and it may cost you a bit. So I don't know who that might be, so you may want to check that out and get word or get the car moved. So also, I would just note that if you're here to address any item on the agenda or not on the agenda, we have a number of speaker forms, but would encourage you to fill out a speaker form, and then we'll call upon you as we get to those agenda items. So without any more delay, we'll move right into the remaining portion of the morning agenda, and thank those folks for their patience since they waited all morning and now back this afternoon at 3:20. Okay, thanks.
Okay, that would be item 35, the Sacramento County Children's Coalition 2018 Work Plan.
Okay. And back again, and thanks for your patience as well.
Sure, no problem. Thank you for accommodating us by allowing us to come and speak this afternoon.
Yes.
So hopefully I have a PowerPoint coming up soon.
Get that up.
Oh, excellent. Thank you. Well, good afternoon again, Chairman Natoli and the rest of the Board of Supervisors. I know we have a packed agenda this afternoon, so we'll try and get through this as quickly as possible while sharing the pertinent information about the work plan that we have planned for 2018. Really briefly here, we'll just touch on a brief overview of the coalition's work, talk about the subcommittee work plans, most importantly, probably address some resources, constraints, and some upcoming strategies. And also, we don't want to leave here without some requests from support from the Board of Supervisors. And we'll have time for questions and wrap up at the end. So the Sacramento County Children's Coalition is really privileged and excited to present our work plan for 2018. The information presented today was written really to provide the Board of Supervisors with an understanding of the scale and scope of work we have planned for the upcoming year, understand some of the coalition's resources, constraints, and strategies, and help identify a path forward around some requests we have for support from the Board of Supervisors, which I'll cover towards the end of our presentation today. So members appointed to the coalition by the Board of Supervisors play a really vital and key role in the coalition's operations by making decisions about the direction and work of the coalition as a whole. Members serve on 4 standing committees of the coalition, as you see on the overhead there. The Executive Committee, which is comprised of the board chair, vice chair, and the chairpersons for the 3 other subcommittees listed in front of you there. As well as members serve on other committee advisory groups such as Human Services Coordinating Council and First 5 Advisory Committee. Members also participate in other community meetings and report pertinent information to the general membership. So I'm going to just provide a brief overview of each of the 4 subcommittees. So in 2017, the general membership began development of a strategic plan to improve our ability to identify, evaluate, and act on children's issues in a way that best takes advantage of all our available resources and staffing. In 2018, the Executive Committee will complete the strategic plan for approval by the Coalition. Some of the activities that we do have planned are, again, finalizing our strategic plan, developing action plans to implement, which is a key and maybe something that we've all identified as something that may have been lacking in the past. Document a complete strategic plan and deliver a comprehensive plan document to general membership as well as the Board of Supervisors. Our timeline, as you can see in front of you, for our goals, strategies, and tactics, we'll have that complete by April of 2018. We'll have action plans in place by June of 2018. And we request to present to the strategic plan to the Board of Supervisors sometime around that same summer of 2018, so roughly around July. I'm going to move on to the CPS Oversight Committee, which is one of the 3 subcommittees in addition to the Executive Committee. Excuse me. The CPS Oversight Committee will continue its regular activities of reviewing critical CPS cases to evaluate efforts of all service providers involved in each case, as well as interview child welfare system partners, including county CPS, to learn about services and how they can be delivered to the community. Our findings from these activities will be presented in the Oversight Committee's annual report to the Board of Supervisors. In addition to this, the Oversight Committee representatives will participate in the Child Death Review Team's recommended Child Abuse and Neglect Time-Limited Subcommittee, which Sheila Boxley discussed this morning with CAPC. We'll examine CDRT data from 69 child abuse and neglect fatalities that occurred between 2004 and 2015. And again, that's part of what was discussed this morning with Sheila Boxley's CAPC group. Using the information gleaned from this subcommittee, we will develop a proposal for a series of community meetings which invite representatives from various child serving systems to discuss communication issues and barriers to collaboration between systems and identify solutions that may reduce the instances of critical incidents and child deaths. Now, this was formally recommended as a blue ribbon panel, but after some discussion, we've decided to recommend this as a set of community stakeholder forums to get a much, I guess, broader look at some of those issues and how we can help address those issues as a coalition. So the Oversight Committee will address this as a comprehensive proposal which will be submitted to the Board of Supervisors for endorsement sometime in 2019. The subcommittee, the CPS Oversight Committee, has also expressed a desire to resurrect the Children's Report Card, which was formerly published by the Children's Coalition in partnership with other contributing organizations. And we tend to explore the idea of we tend to explore the idea with the Children's Coalition's general membership by the end of 2018. This is something that was done, the Children's Report Card was something that used to be done or produced by CAPC and a couple of other organizations. There is now another organization which we have sort of just had a brief informational meeting with, who also produces a Children's Report Card. And the organization's name is Children's Now. So we're not looking to create more work for ourselves or other organizations. If there is already an organization out there that is presenting a report card on the health of children in each county in the state of California, we'd just piggyback on what they've already researched and completed and compiled, which will help us, again, set forth our strategic plan. So moving on to the third of the 4 subcommittees, the Policy and Advocacy Group. So last month, the Coalition endorsed a report and a series of recommendations written by our Policy and Advocacy Committee related to the implementation of the Continuum of Care reform in Sacramento County. So this report was submitted to the Board of Supervisors as an attachment to a letter of support for services to support foster youth impacted by these system changes. The Policy and Advocacy Committee is committed to continuing to follow the implementation of CCR in Sacramento County and will produce a second report in 2018, which provides updates around the implementations of CCR in Sacramento County and how children and families are affected by the system changes. we do recognize, and just in talking with other partners, agencies, and organizations who are actively involved in the continuum of care reform, that there are a lot of obstacles and challenges, not the least of which is finding suitable resource families willing to take on some of the children that are going to be in need of services due to the continuum of care reform changes. The committee will also work to identify other current issues affecting the health and well-being of children in the county, which may result in letters to the Board of Supervisors communicating policy and/or budget recommendations. And finally, the Children's Trust Fund Committee will continue its regular activities of monitoring the balance of the Sacramento County Children's Coalition Trust Fund and reviewing the performance of and approving invoices for its contract with the Child Abuse Prevention Center, the county's designated Child Abuse Prevention Council. In addition to this, the committee will continue the development of an RFP for services that will connect youth preparing to live independently to life skills training programs. The committee intends to release the RFP, make recommendations for awards, and execute agreements by the end of 2018. The executive committee feels this is a really critical part, and it sort of plays a hand in many other issues facing our county. Mainly, we have a lot of youth who, even once they turn 18, even when they age out of foster care, they unfortunately have not been living in an environment nor been provided with life skills training that will enable them to be effective members of the community. So it's really important, we feel, to have this RFP in place, make recommendations for awards, and execute agreements, and I'm sure we'll get some great proposals once that RFP is released. Now, some of the resources and constraints and strategies of the coalition. The Sacramento County Children's Coalition has capacity for up to 30 Board of Supervisor appointed members. Currently, we only have 15 seats filled. Each of the members serve on working committees, which are made up of coalition members and some non-members. And those subcommittees are the the 4 committees that we just discussed earlier. One of the strengths and benefits of the coalition is that members comprise a wide variety of diversity and expertise. Currently, we have members who represent National Human Development Foundation, Board of State and Community Corrections, education consultants, Center for Fathers and Families, Sacramento Delta Foundation, State Department of Education, CPS social workers, Pro Youth and Families, mental health consultants, SETA Head Start, disability rights advocates, Sutter Health, Twin Rivers Unified School District, homeless and foster youth liaison, and professionals from the medical community and county child protective services. The Children's Trust Fund receives funding from various sources and distributes grants to organizations providing child abuse prevention and intervention services. Individual and charitable contributions or grants can be made to the Children's Trust Fund. And also the coalition receives staff support from DHHS at a level of 0.5 FTE. So we have a part-time person who definitely assists us with the operations of the coalition. Oops, I'm sorry. So some constraints the coalition operates under. We do have challenges with consistent participation and meeting Brown Act quorum requirements. Ideally, that would be an easy fix, by just having those who have volunteered for the coalition just to be able to commit to showing up to the meetings, which, number one, when you have 15 individuals, anywhere from 15 to 30 individuals for a volunteer work, although we're all passionate about it, but finding a time where everyone is available has really been the challenge. We also have some younger members. I like to think of myself as one of the younger members, but apparently my kids tell me otherwise. But we have younger members who also would like to be able to participate remotely, and sometimes that can be a challenge, and obviously the Brown Act quorum is not able to accommodate that. So that's just one of the challenges that we have. Also, we have occasionally more staff support that may be required depending on the number of projects that we take on at any given time. And challenges with filling some of our available seats. We do have a youth seat, That's really challenging to fill that seat. Obviously, we want to hear from the youth if we're a coalition for children and families.
It's a what seat?
A youth seat, I'm sorry, for a young person. Sorry.
It's okay.
Still coming over a sore throat here. But finding youth that are able to get to our meetings and participate. Transportation, getting out of school a little earlier, finding a meeting time that can accommodate them, that can be a challenge. And we've also had a little challenge filling one of our seats, which is drug, alcohol, and prevention, as well as some other seats. Economic development, housing, out-of-home care, sports and recreation, violence prevention and treatment. All those seats have historically been difficult to fill for a variety of reasons.
How many people are on the coalition overall?
Currently, we have 15.
15.
We have,
and half of them you can't get to come to the meetings?
It's been a challenge. We've lost some members as well who have voluntarily sort of excused themselves just because of the sometimes the commitment.
Yeah.
So that's going to be one of our asks today, is if asking if there is. We're basically seeking support, which I'll get to certainly in a minute, but we're seeking support to have engaged members of the community who have the ability to participate on the coalition as well. That's part of what we're doing. That's part of our strategic plan, but we're also open for other ideas on how we can fill those seats or where we can look to fill those seats. All right. Some of our strategies to mitigate some of the constraints include, as I just discussed, exploring ways to increase membership and member participation. Ideally, what we are looking for is members who can participate on the coalition who have experience in decision-making and quite simply getting things done, whether they be nonprofit organizations, CEOs, directors, looking for those really engaged, active members who also have connections that will allow us to have effective partnerships with other organizations. Also looking to indoctrinate new members through a comprehensive orientation process, which has been lacking. We do feel that's important to make sure that members who do sign up know that they know what exactly they're signing up to do, as opposed to having another bullet point that they can put on their resume. That they know what it is the coalition has tasked with doing, and that they have capacity to do that. Also, one of our strategies is to increase visibility and engagement within the community. Enhance collaboration efforts with similar missioned organizations. In other words, if someone approaches us about an issue they would like the coalition to assist them with or endorse them with, if there is already an established organization in Sacramento County that is uniquely qualified to address that, the collaboration can also simply be referring that person who is requesting that support to another organization who's better equipped to assist them. And also looking to expand funding for the Children's Trust Fund from additional sources. And in closing, I certainly will take questions, but in closing, I just wanted to say the Children's Coalition really wishes to thank the Board of Supervisors for their support. Really all the work that we've done, just the fact that we exist really could not be done without your support. We'd like to request the continued support of the Board of Supervisors, County Department leadership and staff in the community by asking to bring issues to our attention for review, consideration, or work. Obviously, as part of our coalition, it is our job, which we will be doing through some of our community stakeholder forums, to find out what those issues are. However, if there are other issues that the coalition may not be aware of that are very important to Sacramento County, having those issues brought to our attention would be really beneficial for us developing that strategic plan. Also asking to include the Sacramento County Children's Coalition in a budget process as an advisory role, and really support our efforts to maintain a healthy and active membership, whether that be helping us achieve quorum, conduct coalition business, and again, as I mentioned, referring new high-energy members to the coalition. So in conclusion, that sort of brings us to our shameless plug here. Once again, if there are any members, and again, we had some great groups that spoke earlier this morning, from the Black Child Legacy Campaign, the Child Death Review Team. A lot of things that we do in Sacramento County, as you all are very well aware of, sometimes we operate in silos. If there are folks who are doing great work, whose expertise, knowledge, and experience would be really beneficial to furthering the coalition's mission and goals, we have 15 open seats available, so we'd be more than happy to take any recommendations from the Board of Supervisors or anyone else to help us fill those roles.
Thank you for the presentation. Very
Yes.
good. And we have some questions or comments. Supervisor Peters.
Yeah, seems to me that your membership is probably the most important thing you're asking about, and I would suggest you meet with Paul Lake or someone that he designates to talk about the kind of people, the areas that they represent, to revamp the committee, and maybe the areas they represent aren't the ones that are needed now. Maybe they were 15 years ago or whenever the committee was put together. But I'd look at that, and then he would also know other groups that might have come together recently and be interested in your, and then maybe after you get to that point, Paul, run it by the chiefs of staff and just make sure that.
We will do that, Supervisor.
Yeah, I mean, that's the best way to do it.
Yes.
We all have trouble getting people on commissions, trust me.
Yes.
And then if you require them to be high energy, that's even more
It's a
difficult.
whole nother story. Thank you. That's a great recommendation. Thank you very much for that. I think what we found is that of the 15 members, everyone is passionate about children and families. Everyone is particularly passionate about what they do. For example, at Pro Youth and Families, we're really champions for children being advocates. We have medical professionals who are really champions for healthy children. Child abuse prevention council members.
I understand. Probably worth talking to Paul about.
Yes, thank you.
Yeah. I just had a follow-on question. One of the committees here, the CPS Oversight Committee, and I know the role that group played, certainly when we had some very tragic child deaths, probably going back 20 years ago and coming forward, and I know that committee played a very key role and continues obviously to provide that oversight. But any thoughts about how, again, does the work that's given to that oversight committee, are folks feeling that they have a full plate, or they feel like that the connections aren't there between maybe the community and the coalition, or I don't know about staff and coalition. So I'm curious, just if you could just briefly respond to that, because that to me, I mean, all these things are very important, certainly the advocacy and the oversight for Children's Trust Fund. But when I think about the oversight committee and the work of that group a number of years ago and continuing, to me, that's very important. That's the community eyes of folks who are dedicated to the elements of looking at some of the things we heard about earlier today, as you said, at-risk situations, but some, were actually children not just in peril, but may have, died and or other conditions. So I'm curious as to just, what the take of the coalition and or the committee is on the work that they're currently tasked with, and whether people are feeling fulfilled in that, or that there's, are there other thoughts you might have?
Yeah, I'm not sure if the staffing, or if they're feeling overwhelmed, is an issue. I think the CPS Oversight Committee members, and I'll defer to anyone else on my team here who can speak more to that than I can, if someone can. But I think it's more a matter of the CPS Oversight Committee. I think it really comes down to the members that we have. So sometimes they may refer to Michelle's group at CPS, or defer to them on what decisions need to be made or what issues that we should be addressing. So I don't think that they're feeling overwhelmed. I think we just have a small number of members who are currently participating on that committee. And really, again, getting those engaged members, finding members who are well-versed in what CPS does, and putting them on that subcommittee would be key to really making that committee take off and thrive.
What sort of staff, do you have a half FTE staff support now?
Yes.
You do. So you're asking for an additional half FTE? Is that what the request was?
No, not necessarily additional FTE, but more members in the community to serve on that subcommittee who are well versed and maybe even have experience with how CPS operates, even knowledge of the CDRT team.
Okay. I would concur with Supervisor Peters. I think, meeting with our staff around this and maybe even with some response to we had the work and kind of the work plan, but I think there are some other things embodied in here. And I know, Nav, you and I have at least talked on a couple of occasions about some of the things. And so I would suggest we might, as we talked about earlier today, some of the report backs after we get some further review of it, to have some reflection and maybe some recommendations come back to this board as it relates to membership is one thing, but I think also the work and support the work that the coalition and our other committees do. So, okay, Supervisor Cerna.
Thank you, Mr. Chair. So I had a question about the history of looking to other governing bodies for assistance, especially when it comes to recruitment of your board. Tell me about the history reaching out or working with First Five, for instance.
I'm not really familiar with working with First Five. I'm not sure if Ernie can speak to that. Ernie Brown, who.
My point, it's kind of rhetorical. My point is that might be a good opportunity to perhaps give a similar presentation to. Remember, the commissioners that serve on First Five, for the most part, are not elected representatives. Right. And so I think whether you would try to garner interest from them themselves to possibly consider serving, as long as there's no conflicts. But I think just kind of getting the word out through other means besides just the Board of Supervisors, and using some subject-specific decision-making bodies, and obviously it should be obvious why First Five would be one of them, since we do focus on early learning and health for children aged 0 to 5 in the county. That might be an avenue to explore.
Sure. Perfect. Thank you. Appreciate it.
Okay. No other comments, and thank you so much for you and your fellow coalition members being here today, for your work, for the energy and effort you put into it, and for preparation of the report. And I trust we'll be hearing back hopefully on some of the efforts, not only to recruit new members, but also maybe to look at some of the activities and be supportive in any way we can. So
yes, we really appreciate it. Thank you for your time.
Yeah, thank you very much. Okay, so I had no one sign up on item 35. Anyone here wish to address item 35? Okay, if not, this is a receive and file, and with that, then we will do just that and then move to the next item.
Item 36 is the 2017 Domestic Violence Death Review Team Annual Report.
Okay, who's going to introduce this item? And I know I saw our district attorney was here earlier. There's Paul. And thank you for your patience. I know that, again, continue to have a full agenda, but Paul, would thank you for being back for I don't know how many years now. But anyway.
Actually, I believe this is my 10th year.
10th year.
Yes.
Well, welcome back.
This is the 18th presentation of the Domestic Violence Death Review Team report. I'm pretty sure I've been here for the last 10. So,
okay.
Thank you, supervisors, for having us and for your giving us your time. As I said, this is the 18th presentation of this report. I also wanted to thank publicly the members of our team. I'm not going to go through naming them all because I know you're limited on time. I did want to, the team really wanted to send a personal thank you and a message of hope to one of our longest members. Her name is Jane Cohill. She and her husband escaped with their lives but lost all their personal possessions and home in the recent fires. And we know that she's safe and sound and she's able to live with some family, so she's not homeless, but we just wanted to send out our thoughts and prayers to her publicly.
Okay, thank
you. So that's the way I'd like to start.
Okay, thank you for sharing that.
And before I actually get into the actual cases that we reviewed this year, I did want to do something a little different. As you can tell from the report, I wanted to start with a little bit of good news because there isn't a lot of good news that I usually talk about in the Domestic Violence Death Review Team report. A number of years ago, we came to this board with the recommendation that this county start a family justice center. And I thank the board members that participated in that first two-day strategic planning session, and I'm happy to report that we have been open for a year now with Phase 1 of the Family Justice Center, and that we are about to open Phase 2, the completion of that. The construction is now supposed to be done in mid-December. We were hoping it would be available for the kickoff event this Saturday at Sacramento State. I hope you can all be there. But it won't be. It'll be done a few weeks later, and then we'll actually be able to get moving on that in just a few more weeks after construction is completed. And we sent you a number of graphs to try to break down the efforts that the Family Justice Center has done so far, even though it's only been open in a limited capacity. We wrote grants right when just before we opened to try to get money for some legal representation. There are so many people that come into family court that do not have the funds to be able to hire an attorney, and they are trying to get help and trying to become safe, and they're looking for a temporary restraining order, and they're faced with a 50-page form that many lawyers, I actually had brand new lawyers in my office try to fill the form out, and they were unsuccessful on it. So it's a very daunting first contact with the system, and it makes many victims that right away just say, I can't do this, I'm just going to quit, and they do not follow through on that restraining order. We wrote that grant, and it was accepted. We got 3 lawyers to do this self-help every hour that the court is open, Monday through Friday. We were hoping to get 1 or 2 people a day, so we put in that grant that we would serve 200 people in the first year. And as you can see from the results of our report, we had 1,187 people that we were able to help with civil restraining orders, self-help form completion. And another real positive of that is the trust that was created between the advocates and the legal team with the victims that did come into that center. We had 800 people come for follow-up services. That includes more legal services and more social work services. One of the goals of the center is to try to inform everyone that comes in about the safety concerns that they are entering into when they create a restraining order, because research has shown the most dangerous time for a victim that's trying to leave a violent relationship is when they first communicate that they want to end that relationship. So safety planning can take a long time before someone is actually ready to communicate safely that they're willing to leave. Sometimes that can be a couple of days, sometimes it can be a couple of months before that communication should be done based on the safety plans that people put in place and that advocates put in place. So we've been able to reach 2,000 people or have 2,000 clients come in the first year, and that's with 4 cubicles, a small space for attorneys to talk to clients, and our Phase 2, which will be, again, thanks to, in many parts to the CEO's office, the CFO's office, and this board getting us that location, will be able to open up and have a real collaborative center where victims will be able to get many services that they need in one location, and not a new location that they have to go, another place that they have in line, but actually a place where they already go, where they are already going to family court. We can give them all the services they need, save them from having to take 4, 5, 6, 8 more trips to different agencies in town, and get them safe and make them feel, instead of that first initial contact where they felt like the system didn't care at all, where they were given a document with no help, they're actually being supported, and Sacramento County actually cares about their welfare. So that is some positive news. When it comes to the actual workings of the Domestic Violence Death Review team, we reviewed 9 cases this year, the team did. There's one difference this year as compared to other years. In every other year, every case has been an actual homicide. This year, they had 2 cases presented that were attempted homicides that had so many repeat issues that the team felt that they were obligated to review those cases, and those cases were reviewed by the team. And if you're looking at your charts, the two cases that were attempted murders were number 5 and number 7 in the charts that you have in the report, in case that was not clear in the report itself. Two of the cases, one of the cases in this, of the 9 that were reviewed, took a real toll on my domestic violence unit in our district attorney's office, because a number of our employees had a very close relationship with the victim. In 2 of the cases out of the 9, the defendants were actually involved in the criminal justice system at or around the time of the murder. In the case that really impacted our unit, he was actually had pled no contest or guilty to the crime of stalking. He had bailed out and was waiting sentencing. The day he was supposed to be sentenced, he actually instead drove in the early morning to the victim's house, and when she opened her garage door, he confronted her with a gun and killed her. It was a gun that he had stolen from her in a burglary just a few weeks before. That case, and also another case where a murderer had actually been arrested for putting a gun to the victim's head in Placer County, and he actually bailed out at a very high bail in Placer County, and then 3 days later finished the job killing her in Sacramento County. Those cases it took a real toll on the people, the advocates that were working with those victims, the DAs, the prosecutors that were having daily communications with the victim. And when we looked at all of the cases together, again, we see all of the lethality factors in every single case that we reviewed, that if they were brought to a court, to a judge who had control over whether somebody was let back out into the community or whether they should stay in custody because they pose too much of a danger, if we had judicial officers that were trained on the newest aspects of lethality and strangulation, if we had our prosecutor team were able to communicate that to the judges, if we had law enforcement officers that were trained to look for it at the initial contact with the victim and put it in their police report, then we would be able to communicate to the court why these people who have all these lethality factors really are a danger to the community. And instead of maybe a slightly higher bail from $50,000 to $200,000, which is one of the cases, this person really needs to have no bail and needs to remain in custody. What we have done before we made this presentation to the board here today is we wanted to make sure that if we proposed this, that we could actually implement it. So we went to law enforcement, the law enforcement management in our community. Our district attorney, Anne Marie Schubert, has a monthly meeting with all the law enforcement management for every police chief and the sheriff in our community. And we proposed that we put this lethality assessment into action with every law enforcement community in Sacramento. And we were met with just absolute enthusiasm. Everyone thinks it's a fantastic idea. There is a 11-point validated program, validated question answer that law enforcement can give to a victim right at a crime scene, right when she or he is just been abused. And that assessment, the law enforcement can easily be trained on how to use those 11 questions, make an assessment right there, and make a determination: is this person a high risk for an upcoming lethality event with this abuser? If in another state, Maryland, what they do and what we are proposing to implement here is if that person rates as being high risk in the assessment, that law enforcement immediately calls one of the 24-hour hotlines that we have available in this county. Weave has a hotline with trained advocates. My Sister's House, the Community for Peace. The Community for Peace actually has a team that will roll out. So in Citrus Heights, we have the best of all worlds going on. But if that's not available, we can have somebody on the 24-hour hotline and actually make contact with that victim and explain to them what the lethality factors are, what the danger is involved, and start a safety plan right there to make sure that they are working with the concept and knowledge that they need to be able to make themselves and their family and children safe. When we look at that program, if we're going to do that, we need to have law enforcement then document that. So what law enforcement does now when they go out and they talk to a victim, they take a statement, they finish their investigation, they book any evidence they have, and they submit their report. What we're asking them to do is take one extra step, do this assessment, this 11-question assessment, and then document that in their police report, that you asked the questions, what the answers to the questions were, and then what the assessment was and what steps that you took as far as if you called for a hotline advocate or not.
So Paul, are you recommending then the review team, and I assume through District Attorney Schubert, that this be implemented immediately, or does this take time to roll out? And you're describing how it works and how it would be implemented, but so how is this? Can this be done under the authority of the district attorney, or does it require this board to give some direction regarding that, or what?
It really doesn't require the board to give much direction. What we've done is we've kind of gotten the district attorney, Anne-Marie Schubert, to talk to law enforcement. It really requires the chiefs of the law enforcement agencies to say, yes, we're going to implement this. Okay. And it will require some training. So I'm not sure if it's going to take 6 months for the training of all the law enforcement officers, but that's the only question that we don't have answered right now is how long it's going to take to get the training done.
But to your point about the cases you were describing earlier, then there's at least some reason to believe that in maybe one of those cases, if not both of them, that had that lethality assessment been done, there might have been, folks might not have been released on bail, at least on a lower bail. Is that right?
Yes. Okay. Yes.
And so then you might have had a victim alive versus one who was killed, obviously, as you reviewed these cases. So.
Yes.
Okay.
And even in the cases where that may not have happened, where we might have kept somebody in custody, we still would have had victims that would have been informed about the lethality factors and about safety planning. And 2 or 3 of these cases, this incident happened just as the lethality factors have proven. Right when the communication happens that I want to leave the relationship is when the argument starts that leads to the ultimate act of lethality. And if victims are trained as to how to approach that conversation and know that you should have a safety plan in place before you do it, and not necessarily a one-on-one conversation when you're alone and there's a weapon handy for the perpetrator, those simple steps, do it in a phone call, do it in a public place where that person is unarmed and you have support systems around you. There are all sorts of ways that you can make yourself safe when you're deciding to make that communication. So that kind of knowledge in and of itself, if you got on a call to an advocate on the hotline, may also be able to save someone's life. The third part of this is the part that none of us have control over, but we're going to propose it to the presiding judge of the Superior Court. We believe that judges also need to be trained on lethality factors. I know that there are a number of programs that are now training judges in other states on strangulation and lethality factors and how they impact personal safety and community safety. And I think that this would be something that would be advantageous for any of the judges that are involved in the domestic violence court or the family relations court, and really any of the judges, all of the judges, because they often are on the night call and have to make decisions about criminal protective orders when domestic violence calls come. The current presiding judge is ending his 2-year stint, and our next judge is going to be starting in January. So as soon as he is in place, we're going to propose this to the presiding judge.
All right.
And those are really the bulk of our recommendations for this year. I don't know if anyone had any questions, or we tried to. I tried to anticipate from questions from years past and break down some graphs to make it easy for everyone to know where these are occurring, how it's being impacted.
No, very, very thorough. Thanks, Paul. Okay, we do have a couple questions, comments. Supervisor Frost?
I have a question relating to page 9. It's talking about the zip codes of clients in other cities outside of Sacramento City.
Yes.
And in specifically, well, I guess in Citrus Heights we have a couple of zip codes, and it looks like we're up there. But then if you go down to page 14, we have way more deaths. It seems like we have more murder-suicides in Citrus Heights than anywhere else. Is that a fluke, or are we just having worse problems in Citrus in those?
No,
areas?
I would not say that Citrus Heights has a problem that is bigger than other places in the community. When we do our cases, we're limited as to when we can review them. We review them when they're murder-suicides because the police investigation is already completed. And then there are other domestic violence murders that we have to wait until the prosecution of the case is completed. So every once in a while, there will be this, it'll
like an anomaly.
Look like this, where one area is more impacted by domestic violence homicides than another. But I can tell you that is not a long-term.
It seems like it goes up and down. Sometimes we have more deaths in our city, and sometimes we have none. So
exactly.
It's year by year, it differs. Okay.
Right.
And not all of them are reported, right? I mean, not all of them are domestic. This is just the one domestic violence that you know about.
Right. Well, the cases that we look at are the domestic violence homicides, and we always find out about the homicides. Every once in a while, somebody can try to hide a body after a murder, but it's very rare that we don't find out about a homicide because that person will end up being missing and somebody will make a complaint. But the domestic violence, the number of domestic violence incidents is sometimes a misleading number. Because to be able to get a number for domestic violence, you have to have people make a call. You have to have people access services. And I know that, like, a Community for Peace out in Citrus Heights does a wonderful job of communicating with victims. And by doing that, they actually increased victims' security to be able to come out and say, I've been a victim. It's kind of like what we've seen going on the Hollywood tabloids. People are finally feeling comfortable in those situations to say, I can speak out about the abuse that has happened to me and I'm not going to be ostracized. When you get a protective community like they have in Citrus Heights, and the combination of a Community for Peace and the Citrus Heights PD, then victims feel more likely that it's okay for them to come out and talk about their abuse and feel that they're going to be supported. So sometimes if you have a higher number of reported domestic violence, it actually means that your system is doing a better job.
I was going to say, we have a lot of resources on that side, but we also have resources on this side too. My Sister's House and others. So
yes, and Weave does a fantastic job too.
Thank you.
Any other thoughts or comments? I just had one quick observation, not unlike other reports we've seen, Paul, but this year on 8 out of the 9 cases, you had drugs or alcohol as a factor, and again, I think just screams out once again to, I think, the substance abuse and the role that plays, obviously, in the dynamics of some very tragic cases that you folks have, reviewed. And I think, again, it's just another challenge for this community to continue to try to provide, services should people wish to avail themselves of it for those abuses.
Yes.
Yeah.
I'd agree.
Okay. Well, having that, again, this is a receive and file. I want to thank you for sharing the good news on the Family Justice Center. Again, that's been in the works, and I know obviously members of this board and general community, and certainly led by former District Attorney John Scully and many others, been a real labor to get it to where it's at. And phase 2 coming up pretty shortly. That's good news in all of today, and I think to work with informing folks of some issues of danger as it relates to domestic violence and potential victims and victims. That I think it's a good approach. So you'll keep us posted on that. So.
Okay, will do.
Good. All right. Nothing else. I don't have anybody sign up on item 36. So with that, we'll receive and file. Thank you, Paul, for your patience today. I'm waiting for this afternoon. Okay. With that, Madam Clerk, we'll move to next item.
Item 38 is the Mather Revenue and Expenditure Workshop.
Item 37, please.
Oh, I'm sorry. Sorry about that. Update on
The
full
folks in the
service.
front row, they were all excited. They were getting to 38, but not yet. Okay.
Update on full service rehousing shelter siting options.
Okay, Ms. Edwards.
Good afternoon, Chair Natoli and members of the board. I'm happy to be here to talk about the siting options for the rehousing shelter. You approved this shelter in the June budget hearings, and our goal at that time was to find a site that could house 75 homeless individuals that would accommodate pets, partners, and possessions. In preparation, DHA staff had several meetings with community groups.
And just a second, I don't know what's going on over here, but you're too loud. We can't hear the speaker. Hello?
Okay.
Thank you.
Okay.
We had several meetings with community groups, including local shelter providers, the Sacramento Region Coalition to End Homelessness, and each group shared their perspective on siting considerations to best meet the needs of shelter guests, including low barrier entry, proficient shelter operations, and optimized service connections. Insights were offered on the importance of a strong peer support structure, securing and storing belongings, and ensuring strong health outcomes with medication management and follow-up on health and behavioral health appointments. So we began by searching for a single site that offered dormitory-style quarters for up to 75 people. County representatives from real estate, general services, planning, and DHA actively research and assess potential sites throughout the county using the following criteria: compliance with shelter zoning provisions, the size of the parcel or a building so that it could accommodate a 75-bed shelter, access to transportation or services, and neighborhood compatibility. Since June, staff have assessed approximately 50 sites countywide, including county-owned facilities, private vacant lots, and buildings. The common challenges with many of the sites include site appropriateness, the significantly higher cost associated with using a non-county-owned facility, and the project timelines needed to get a site up and operational. Given these challenges, we are recommending an interim approach using a scattered site rental housing model. This provides a more immediate solution to sheltering persons targeted for the full-service rehousing shelter. Moving forward with this approach will allow us to continue to assess shelter sites with your guidance and preferred areas and funding parameters. Additional resources will be needed if a county-owned facility is not used. This interim scattered site model will serve the same number of people with the same level of service as a single site. The scattered site interim housing concept can best be described as a third-party provider holding the lease on a private home and outfitting it to accommodate guests for short-term stays. The homes can accommodate up to 5 guests per night per location, and the house is supported by a live-in monitor. Careful measures are taken to ensure neighborhood compatibility, and the provider establishes a communication channel with neighbors. House rules are in place to prohibit loitering in front of the residents and other potentially troubling behaviors that could disturb the neighbors. Once the guests are placed in the home, case managers offer ongoing support on site with frequent visits. They arrange transportation for appointments so that they can access all the services that they need. Rehousing support for the guests begins immediately upon entry so that we can connect them to stable income, public benefits, and permanent housing. Partners, pets, and possessions will be welcomed along with individuals with varying degrees of behavioral health concerns. The advantages to this model is that it is a proven model in Sacramento County used by self-help housing for both interim and permanent housing. This approach has low upfront costs and a quick startup timeline. This also offers more options to engage groups that are sometimes unwilling to go into a large single shelter, such as youth, women, veterans, individuals in the LGBTQ population. Sometimes those folks want to stay in their own communities. And that's true for a lot of the homeless population in general, is if they're homeless in, say, Citrus Heights or Arden Arcade or Carmichael, they want to stay in that community. It also does not overly concentrate this population in any one given neighborhood. This model certainly requires more coordination efforts by all, but the advantages outweigh this disadvantage. So to ensure that we can shelter homeless individuals timely with the approaching winter months, I am asking today for the authority to pursue this interim scattered site option. We will then release an RFP quickly in order to get services implemented as soon as possible. And I'm happy to answer any questions.
All right, thanks, Ann. We don't have anyone signed up to speak on this, so Supervisor Kennedy.
So we're talking how many homes? 60?
We're talking about 10 to 15 homes for
how many people?
About 5 people each.
For 10 to 15 homes for 5 people each. How many people were we talking about?
How many, pardon me?
How many people were we talking about citing?
75. We're really targeting the same population that we were in the single site. 75
so we're looking
people.
At 7 to 8 people in each home?
5.
Supervisor. Yeah, so the math's not working for me.
Supervisor, this is Paul Lake. That would be, we're looking at 15 houses at 5 apiece. That would be the 75.
Okay, I got it. And is it okay if I ask a member of the audience to come?
Sure.
In?
Yes, you can. Yeah, that's fine.
John, would you mind coming to the podium?
Stand by.
You a question.
Mr. Foley. Didn't even have to fill out a speaker slip, John. You got called on.
Apologize for putting you on the spot.
John Foley, Executive Director of Sacramento Self-Help Housing.
Yeah, I'm sorry for putting you on the spot, John, but you know, you and I have worked on this type of project for a very long time in the past, and it's not easy. I mean, I remember when I was serving on your board, it was very difficult to find homes.
Yes.
What do you think the challenges are going to be to locate 15 homes?
We have 2 different kinds of houses that we do. We have permanent supportive housing where each person has their own bedroom, and we like to get 6-bedroom houses for that. There are not a lot of 6-bedroom houses. That's been challenging. We contract with HUD for that through Sacramento Steps Forward, and our contracts, if you average it out, we should be opening 1 house a month, and we really stalled out several months ago, and we just couldn't find any. And so we've transferred one of our staff people, so she works half-time just talking with realtors, just talking with property managers, very aggressive. Well, Patty Eplinger, I mean, you know Patty, and she's been very effective, so we are doing fine with that now. The other kind of housing we do where people can share bedrooms because they're just there on a short period of time, like the program we have with Well Space or the one we did with the city with Common Sense, which this program sounds like it's very similar, where it could be 2 people per bedroom. We can manage 4-bedroom houses. There are a lot more 4-bedroom houses than there are 6-bedroom houses. So Patty commented earlier today to me, actually, gee, I'll make people happy, because frequently when I'm talking to groups, someone will come up and say, can't you use a 4-bedroom house? I've got a 4-bedroom house. And for the other program, we really can't. So we think we can do this. I mean, 6 months is what they put in the report. That's going to be challenging, but I think it's probably doable.
Okay. And in your experience with this approach, there really hasn't been a whole lot of neighborhood pushback, has there?
No, I mean, when we move into a house, of course, we put a sign up right away on the house that says, here's our phone number, here's our name, call us if there's anything comes up. And when we move in, we talk, well, it's the same thing you would do if you moved to a different house. You know, you're out mowing the lawn, you talk to your neighbor that comes by, you go next door, maybe you don't borrow a cup of sugar anymore, but there's always something you need to do. And so we are in communication with our neighbors right away, both our staff who live in the house, you know, our house leader, as well as our case management staff. And then if something comes up, they know who to call right away, so we can get involved. Yeah.
Okay. Thanks, John.
Yeah, sure. Thank you.
Thanks, Pat. Supervisor Peters and Supervisor Cerna.
Oh, before you go away.
Yeah, John?
Yeah, I'm sorry.
Do you conduct neighborhood meetings to discuss compatibility? So the neighbors know that you're there in advance and, give them your phone number and those kinds of
For us,
things?
neighborhood compatibility is thinking about, the kind of neighborhood into which I'm going to have somebody move. So I try to avoid areas that are heavily drug infested. I try to make sure that there's good public transportation, that, they can walk to shopping pretty easily, that kind of thing, and that our folks will kind of, be comfortable there. But usually we don't have, those kind of neighborhood meetings until we've actually gotten to the house so that people can actually see what we're doing. Okay. I mean, part of what we like to do is invite them in, and until we secure the house, we can't do that.
Yeah.
So we try and do a meet and greet once we're there.
So to the inside of the house, what if you're having 2 people per bedroom, what is that? Do you put a half wall down the center or a barrier of some kind for people sharing a bedroom?
No.
No? They just share a bedroom?
Yeah.
Yeah. And
which I found doesn't work if I want them to live there as a permanent housing situation.
Yeah.
People really want their privacy if they're going to be there long term. But the idea with, like our contract with WellSpace, for example, is 6 weeks. That's how long people stay. People are just fine. I mean, when the alternative is being on the street, particularly sharing a bedroom for 6 weeks. They wouldn't be if they're going to be there for 3 years, So, yeah. That's a good question.
Do you have, what does the management of each individual building look like? Is there someone there 24 hours a day?
Yes, we have a part-time staff person that lives at each house.
And will that be what happens for this new proposal? So there's a staff, I'm getting nodding heads, so Paul?
Yes, Supervisor, that would be the intent for this contract.
So there's someone there as kind of the manager of the facility, and then specialists come and go as needed?
That's true. The person who lives there, their main job, well, I mean, in some ways their main job is to be a role model because they're usually formerly homeless folks, but their secondary job is to call us 24 hours a day if anything is going wrong and we need to get a regular line staff person there, or to, sometimes they can just take care of it themselves, of course. But no, we want someone living in the house that's going to be responsible.
Do you, when you intake the people, do you get people with similar problems? Like, do you house drug addicts together versus people who've got other kinds of problems, or how?
One advantage we have when we have enough, like that common sense program that we did for a couple of years, we had 5 houses, so we had a chance to try and get people who, like if we have people who are trying to stay sober, we aren't going to move, if we can help it, a person into that house who is actively drinking.
Okay.
So we try and, as best we can, and I don't know who's going to get the contract. Hopefully it's me, but maybe somebody else. but with 15 houses, there would be a good opportunity to mix people up, whether it would be young people. Transition age youth aren't necessarily a good fit with some of the older homeless folks, so sometimes it's better to do an age thing too.
So what Ann described earlier about young people as a category, women as a category, LGB?
We certainly have had women who could not live in a mixed gender house, and we had to have an all-woman house for them, yeah.
So you do something about that?
In fact, that's part of what we do at the intake, is really explain the situation so that people know what they're getting into, and they can explain what aspect of it is going to work or isn't going to work. I mean, maybe they need to be in a certain neighborhood because of things going on in their life, or maybe they, can't live, be in a house with men, or can't be in a house with women, or, whatever it is, yeah.
Okay. One of the things, maybe this is an Ann question rather than you, sorry, you. I want to ask you about
yeah, thanks.
Thank you.
Kind of what happened here in June. We were talking about, a single facility, and then because of the problem stated in the staff report, you're going towards multiple. But it also talks about the finances are better this way, if I understood the staff report correctly.
Well, if we went, it's very complicated depending upon which option you choose. This is very cost effective. That is very true. And if we were to use a single site that was a county-owned site, that would be cost effective as well. But if you start looking at leasing a building that's available for lease, or purchasing property and either building a building or bringing on modular buildings, that becomes very, very pricey, and then really takes some time to implement. So this is both cost efficient, And it's something that we can implement quickly, and there are some significant advantages to this model as well.
I can see the implementation quickly. I did wonder when we were first looking at this how we were going to buy a building and outfit it and all that kind of thing. So my primary concern is compatibility with the neighborhoods. I understand what he said about, you know, you wait till you choose a home and then you tell, you know, the people in the neighborhood. For group homes, there's a rule about a maximum number of people. Is it 6?
Yes.
Yeah, so,
and we wouldn't be putting more than 6 people in a home. Yeah. And I think that it is a legitimate concern, and it's something that Mr. Foley and his organization has done really well. Again, don't know who the contractor will be, but they do have a long experience of being really good neighbors.
Well, that's really my concern, is being really good neighbors. I certainly, over the time I've been here, had many complaints about group homes and the loitering that goes on and the noise. And I imagine that the manager can do a pretty good job of people from loitering in front. But I mean, people have to go outside. So what? I mean, if they're in the backyard.
And there are behavioral norms and rules, just like there are with any tenant or even someone who resides in a shelter. So, you know, they can't be carousing loud parties in the backyard till all hours of the night, just like I couldn't if I was a renter in a neighborhood without somebody complaining. The on-site staff person 24/7 is a big advantage, and then they also have a number to call. There's, you know, an organization behind the manager that's on site that has a cadre of staff to come in if there's a problem that needs to be addressed immediately. I'm going to have my staff standing by. I mean, we've got several staff assigned to this project that will be able to address issues quickly as they arise as well.
And Supervisor,
I understand your concern completely, and we're going to do everything.
What is our ability as the county to shut a building down if it's a problem? If, you know, you just got the wrong combination of people in there and the neighborhood is unhappy?
Since we will be holding the contract with whatever vendor is selected, we would make those decisions together, and we would have every right as the person paying the bills to say, we don't want you to use.
Okay, so we have every ability to say we don't want you to use that. Does that mean a legal action, and we have to write them a letter that says this home is off the market? And how fast does that happen?
Well, and it gets complicated because of a lease. It depends on how long a lease that they have and what other uses they might be able to use that property for. So I don't know that we would have the authority, any legal, I don't know, I'm going to look to Robin to assist me with this one. I don't know we'd have any legal authority, but we work in close partnership with our contractors, and we would work together to solve whatever it was that needed to be solved.
Well, I'm thinking more, my experience is more where you have to call the sheriff's department because there's a lot of loud parties at a house and that kind of thing. And it's not high on the priority list. They may or may not get there. This is a different group, and it could cause a neighborhood great angst. And that's why I want to know more about how fast.
Yeah, I think John the better.
How nimble.
It is a question for me, after all. This has never happened in our experience. We've done this for a long time. But should it happen that a house was out of control, we would shut it down. I mean, we can't function that way. We're certainly not helping anybody. So we would just move everybody out of the house.
Which legally would be separate from the lease arrangement, the contract.
I understand,
for
Right. Yeah, so I'd still be stuck paying the rent, but we would just have to move the people out.
So you're paying the rent. Typically, how long is this lease? Is it a year? 5 years? Probably the term of your contract, huh? If you were to get it, whoever gets it.
Yeah, should we have this contract, I would imagine we would start out with a one-year lease. That'd be pretty normal, and then renew it at the end of the year.
Supervisor, if I may also add, as we go through the procurement process for this, one of our requirements is going to be experience in managing these types of properties and demonstrated experience that they either don't have, haven't had historical problems in this of this kind, or that they can adequately and have adequately managed it. And we'll make sure that within the protocols of the contract and working with them, that there are a lot of layers of dealing with these problems, including involving county staff, to make sure that we're holding the contractor to certain standards.
Okay, so it sounds like what you're saying is if there's a disturbance of some kind, that probably we're talking about a couple of hours maximum to get people on site to help quell a disturbance, if that's the right
Comes John,
terminology.
he's going to give you a time frame, how quickly they can get there.
I know you said it hadn't happened, so...
Well, I've had disturbances. I mean, we're dealing with people. So when something happens and the house leader calls up our staff person at 2 in the morning and said, this has happened, this tenant's boyfriend has now come to the house and is causing a problem, the house leader then calls the police, and our staff person rushes over, and we get it straightened out.
Okay.
I mean, it's,
Will the sheriff's department or the city PD, wherever these are located, will they be aware of which houses these are?
Well, one reason we put the sign on the house is so that the officers, as they arrive, will see what it is. I guess my hope would be in working, since this will be whoever does this would probably work with you to work with the sheriff to make sure they understood what was going on at each house. It's my understanding that's actually who's going to determine who's moving in. It'll be the outreach team, and the sheriff's department is going to identify the homeless folks and bring them in. So there'd be a pretty close relationship, I think, with law enforcement.
Thank you.
Yeah, thanks.
Okay, next, Supervisor Cernan and Supervisor Frost.
Thank you. So I have a number of questions. Forgive me if you've already addressed them in your presentation. I had to step out for a moment. But are we just talking, Ann, about the unincorporated area?
No.
No.
Okay.
Countywide.
Okay. And is there any assumption at this point about kind of the distribution between the number of these homes in the 7 cities versus the unincorporated area?
We haven't got to that level of detail. We really, it's around availability of homes, and we certainly want them spread throughout the community so that there is access in neighborhoods, but we have not dictated where, because that could be problematic based on availability.
Supervisor Cernan, one item that I think we need to clarify, I was waiting for you to come back, is Paul has a clarification that you asked me about the River District. I want to make sure that's in the record.
Yeah, and we'll get to that.
Oh, you want me to wait? Okay.
Yeah, we'll get to that. But in terms of the distribution, I would assume then that because it's going to be countywide and that's going to include potential sites in incorporated areas, that we would work very closely with the various city administrations so that we have an understanding of where these locations would be relative to other either future or potential similar service sites. For instance, the city of Sacramento is looking at, I think, at least a couple of different low barrier triage centers, if you will, of their own, using a different model, a model that would have a larger aggregation of folks at the site, so with its own impact. So I think we have to make sure we're coordinating hand in glove with the city folks.
Yes.
And then part of the question was answered in response to a question that Supervisor Peters asked, but I want a little more detail. I'm not sure who the right person is, but so give me an understanding of how AOD services would be administered, for example.
So both mental health services and drug and alcohol services will be accessed through the normal way anyone accesses them now. The difference is there's going to be a case manager to help them navigate those systems and get to those systems. There's not going to be an on-site mental health counselor or substance abuse counselor at the house. There will be on-site case management services at the house and transportation to other appointments as needed.
what's the frequency of kind of direct access, do you think, to these service touches? I mean,
it really depends upon the individual. Some people may need very regular, multiple times a week contact, and others may need less. It just depends upon the severity of their impairment.
And I assume that these units would have strict restrictions on possession and consumption of alcohol and illicit drugs on site?
Illicit drugs for sure. Again, these are individual residents in a home that, I don't know, John can answer based on his program what the rules are. I know illicit drugs are not allowed.
The way we've always done it is people have house rules, and it includes no weapons, no threats, no violence, no drugs, no alcohol on the property. Okay. We do have a couple of permanent supportive housing houses that are wet, where people who come through the SIP program and are not able to not drink will have a safe place to live and get medical help and other things. But other than that, we don't allow alcohol directly at the houses. People can drink, but just not, not there.
Okay. Question for Ann, is there any advantage that staff has concluded comes with citing these various full-service sites near our DHA bureaus?
That certainly is a consideration, and that might...
walking distance within...
Yes, I mean, that's... Again, we're going to go out to a procurement process to select a vendor, and then we're going to work closely with the vendor on selecting sites.
But we do have some control ahead of time by kind of giving the parameters that we give to the vendor population to say this is kind of what we're thinking, right? So that could be something that develop early.
Yes.
So I'd encourage us to think carefully about that, because we're already making statements about how our DHA bureaus, I believe, are going to function differently per some of our other initiatives that we adopted earlier this year, where if someone needs access to services, they're going to have a more immediate ability to acquire them if they go to a DHA bureau.
Yes.
Okay. And then same thing with public transit. I assume that when we go out looking for a contractor to manage this, that we would have something to say about the import of locating these sites near public transit.
Yes, that's critical.
Okay. And then finally, what happens if you have 5 people, 4 of them have a single dog and the 5th has 2 dogs?
Well, I think as John stated earlier, that one of the advantages of hopefully having 15 homes is that you can try and balance that in the way in which you place people, and that would be another consideration, as well as gender and other sort of compatibility issues.
Okay, but
because dog compatibility is also an issue.
So so it sounds like that might be one of the criteria for how you group folks, is by pet ownership status, I guess?
It certainly will be a compatibility consideration, yes.
Okay. I'm looking to Rob Leonard, what's our restriction on number of animals per home, per square foot of lot? I don't know what the metric is.
It would be four animals.
4 animals. Mm-hmm. Okay. And then one of the things I know that we've been very consistent about is that this is also about securing possessions. I assume there's a way to do that, even if someone comes with a lot of possessions and it might be, fairly disorganized, might be in the form of a shopping cart or a couple shopping carts full of stuff, that can be, if it's going to be stored outside, it's stored outside neatly, somehow shielded. It's not going to be some visual
That is true, and I think garages are going to be, homes with garages will be the best way to store some of those belongings.
Okay. And then what are we thinking in terms of when we would know whether or not the model's working? 6 months?
I would say it's going to take us 6 months to get up to full speed, fully operational, and then within the year we would have a really good idea. We'll have a sense in 6 months about how it's going, and And then after the full year, we'll have a much better idea.
Okay, and then maybe this is a question for John. What in your experience have you seen in terms of the ability to serve some of the most challenging cases? So those folks that are literally, high on meth, that are currently living under a bridge or on the parkway. Are those the candidates we're talking about that would be eligible to live in an environment like this?
Well, you'll be determining, I think, who you would be referring for this program, and I think your idea was that the Sheriff's Department and others would be identifying people that they've encountered, and I assume that would include some folks that meet that description, although an awful lot of the people we encounter have more physical disabilities, maybe mental health disabilities, some combination of that, and it's certainly true if someone continues to be a heavy user of meth, they're very challenging to figure out where they could be permanently housed and have it be stable. But many of these people need really permanent kind of services, and that'd be part of, I think, what your program is intending to provide is ongoing services. And so hopefully the program could be linking up appropriate housing location with heavy, perhaps really heavy service provision.
Yeah, I would hope so, because we've made some overtures this year about the connection between some of the other initiatives we've pursued, namely that of the Parkway, and the fact that we're looking at the full, what was then considered a single site or perhaps two sites to satisfy this intent to bring a full-service shelter to Sacramento County as a means to add capacity, so not all, but some of the folks that we might encounter, that our Ranger Patrol might encounter on the Parkway, would have that presented as an opportunity for shelter.
Yes, I mean, the way we do it, and if we're your vendor, we would do it that way. The intention is to basically not say no to anybody but we would take time to explain what they're getting into, and some people might say no to us.
Understood.
Because we do have house rules and everything. But when we move people in, then we would do everything we could for as long as they're at the house to be able to keep them to stay there and be able to help them in whatever needs to happen to move towards moving into a permanent housing, situation. And I think that's the full intent of your staff, and we certainly support that.
Oops. Thank you, John. If I can add, the outreach component, we're going to be working really closely with the sheriff's team and the Parkway team to really identify folks on the Parkway, as well as DHA social work staff. So those are going to be the primary outreach targeting for the population for this program.
Okay, great. That's good to hear. Thank you.
Okay, thanks. Supervisor Frost?
So a lot of my questions were answered throughout that, but I did have a couple more, and one related to low barrier. The 75 unit was supposed to be a low barrier, meaning anybody could come
And that
under
is
any
still true.
conditions. So what you're saying is you'll interview people as they interview into these homes, maybe someone who's has violent propensity for violence, or you might put alcohol and drugs in one home, and then the services come to that home, or group meetings at that home. Is that what you're saying? It's kind of organized in that way. Women in one house, or specific to gender and issues.
So there will be a lot of compatibility issues that will be taken into consideration with both the county and the provider that's selected. In the makeup of the population in the houses is going to shift, because the goal is to rapidly rehouse folks out of these shelter beds into permanent housing. So it doesn't mean that there will always be an all-women home, but there might be at a given time. And certainly we're not going to put a whole bunch of violent people together. So all of the things that John talked about in terms of compatibility will be taken into consideration before putting someone in a home.
But when we were initially talking about this 75-bed facility, in my mind, I was thinking this was the low barrier. These are the ones who are most likely to use the emergency room, who have been out there a long time. Is that correct?
So it is, yes. It is yes and no. It is a low barrier shelter. These people have not necessarily been high utilizers of the emergency room. A lot of the folks on the Parkway are very sort of deeply ingrained into the Parkway. They don't necessarily use emergency room services, but they get a lot of attention from the sheriff and from the regional parks rangers. So that we are going to serve the hard to serve, the low barrier population in this model, as we were going to in the single site model.
This will be kind of reserved for those, the hardest
yes,
cases.
Absolutely.
And will these locations be anonymous? So, like, say they have drug dealers that want to find them, or someone they owe money to. Is this an anonymous location?
It's not anonymous in the same way that a domestic violence shelter might be anonymous, because the homeless individuals that will be residing there are going to have family and friends that may want to visit them. So it's not anonymous in that way, but it is, again, monitored by the house manager, the backup staff that are available should there be a problem.
And Mr. Foley was talking about the folks who would be staying in the homes would be part-time on-site, but 24 hours.
They do
24 hours a day doesn't sound like part-time. So are they paid part-time? And then my next question is this, are these county employees, or are they employees of whoever we contract to manage these homes, and in which case would make a big difference in liability and cost and the whole bit?
Yes, they will not be county employees. They will be employees of the organization that we contract with. So just assume that it's someone like John Foley's organization, they would be his employees.
It's all included in the contract cost?
Yes.
And is that considered like a job training? Will there be job training in these facilities, and is that actually a job opportunity for people who are coming out of homelessness? Is that how you're training these people? You said many of them have been homeless, so is that part of a job training program?
The programs that we run, where we have houses that are like this, most of the folks that are serving as house leaders have experienced homelessness themselves, yes. Some of them have been at Mather Community Campus. Some of them have been through Women's Empowerment, or a number of programs that have gotten them. Some of them have part-time employment. Particularly in our permanent supportive housing programs, often the house leader doesn't have a lot to do because the people have been there for a few years already. They're pretty stable. Things are pretty good. In the houses we're talking about here, not so much. And so those folks often have work to do because they have to move a new person in. They're assisting someone to move on, and dealing with the anxieties of this person who's just moved in and just encountering 4 roommates for the first time, and that kind of thing. So it's a part-time position, but there are weeks where it's full-time. Yeah. But yeah, and a lot of training and a lot of support. Yeah.
That's it. Thank you, Ann and John.
Supervisor Natoli, if I could, just one clarification, if I had. Paul, can you clarify the River District issue, please? River District.
Yes, the question's arisen about staging and how we're going to stage this. When we were originally going to have a large facility, we're going to be looking at 1 or 2 locations to stage people and get them moved into this. As we're looking at this new scattered site model, probably that staging, quote unquote, is going to occur in the field when we make contact with the people and get them to agree to come to the shelter There won't be a centralized, we're not anticipating a centralized staging area in any specific neighborhood. The social worker will go out, do the assessment, and make contact with the contractor and identify a location that will be suitable for that person, and we'll move that person right there. So we're not anticipating at this point having any kind of centralized staging in the River District or elsewhere. That's what we're contemplating at this point.
Okay. All right. Thanks for the clarification. Next to Supervisor Peters and Supervisor Kennedy.
I have a couple questions. Obviously, mentally ill people, are they going into these homes?
Yes.
Really? Okay. Is there any likelihood of garage conversions that
No.
turning them into bedrooms?
No, we're going to have no more than 5 residents per home plus the house manager.
Okay. And then, I don't know whether it's you or Paul, but can someone describe to me, kind of minute by minute, someone comes across a homeless person, an official of some kind, and they say, yes, they would be willing to go somewhere overnight. Since we're talking about not having a central place that they could be taken to.
Right.
You call it in the field. Explain to me exactly what happens.
So this is going to be sort of an invite in versus an outreach out. So we have sheriff's deputies and park rangers who see folks on the parkway all day, every day, and they know who's out there, and they're going to work with us and tell us, hey, the folks in this camp are willing to come. So then we'll send social worker out, someone from the provider out to assess and figure out where the best place is, and are they in fact willing to come and follow the rules, and then transport them to the place.
Sorry. So first of all, you just keep referring to the American River Parkway because there are a lot of homeless camps.
Correct.
Okay.
Yes.
So if the sheriff's deputy or other official, they have to make a phone call to somewhere where people are waiting to be called on, and they get in their car and go out to wherever it is. I mean, that sounds like hours. I mean, aren't people going to be tied up for?
Well, with my social workers are going to be doing a lot of this, so people will be able to call us, and we can then deploy the people to an area. But we're really targeting folks that we already know about all over the community.
So you probably have a map of some kind that you know where you got a camp of 10 here or 20 there or 5, and this, particularly this first year, you're going to go after those camps.
Cindy Kavanaugh, Director of Homeless Initiatives. We've been meeting, we had a meeting today with law enforcement, park rangers, DHA staff to work up the protocols. We're going to meet regularly. We're actually talking about using a common electronic device as well. So we have a few weeks to work out all the protocols, but I think it's very exciting because it's new collaboration that I haven't seen, and we will be figuring a lot of this out to make it work for the provider, for DHA staff, for law enforcement. We want to time the decampment with trash pickup and with facilitating folks entering a home. So there's still a lot to work out, but we are actively in conversation with all the parties.
Sure seemed like a single site would be more efficient.
We still have to do the same outreach. The encampments are all over, or the vulnerable people, so you're still coordinating who should come in, how to stage it. You're still managing vacancies with invites. Initially, it'll be easier. Turnover will be slower, in a sense. But both the sheriff and Parkway feel they left today saying, I think this will be easy. And I'm kind of with you. I don't think it will be that easy, but they know the folks, and maybe that's the important part. And we can time it with their, again, cleanup and their conversations.
Okay, as long as you're there. Then let's go back to this mentally ill, obviously mentally ill being put into these homes. So the next day, at some point in time in the next 24 hours, people get services that come to them. So someone who understands what to do with someone who's having mental health issues comes out. they leave them there? They're not going to take them to a mental health facility?
Actually, Ann's probably a better person for this, but only if, I mean, we will be connecting with mental health services unless they're in a crisis situation. We'll be connecting them with services. This would be the same in a central location as in multiple. That's where the coordination in multiple locations does become a little bit more challenging, but I'll have Ann speak more.
Yeah, if someone is in a mental health crisis, we're not going to bring them into the home. We're going to take them to the hospital.
Okay.
So someone with a mental health condition is not necessarily ill-suited to go into a home unless they're in a mental health crisis, and we would not put someone...
I guess that's what I was thinking was
yes,
crisis.
We're not going to put someone in that's in a mental health crisis. We're going to deal with the crisis first.
Okay. Thank you.
Okay, good. Supervisor Frost and Supervisor Kennedy.
I'm still on the mental health. This is one of the things that is needed the most, and that I'm always hoping we're not going to miss the opportunity, but at the same time, in my, district, people are in the neighborhoods, people are sensitive to that, and they're sensitive to, citing such homes near a school or whatever, near their children walking to school. So is there sensitivity to those types of things when you're citing these homes? Or do you even, with only 5 people in the house, do you even run into these issues? Because it's pretty quiet. How do you deal with
John
that?
could probably better answer that, but again, as you said, there's only 5 people in the home, and they're supervised, and staff on call as well as the house manager, so they're there to
and they're interviewed before they go into the home, so if there's any concerns, they're not going to go into that home.
So if, for example, if there was a pedophile, we would not place them in a home that had the boundaries of near a school or children, etc.
They have quite a checklist.
That's a extreme example, but we certainly would not do that.
Do you have anything to add, John?
I think she did great.
Okay.
So there's no requirement to notice this because it's really under 6 per home, so as far as zoning and everything.
And yet, I want to reinforce that we'll do outreach to the neighborhood as we bring people in. John has done an excellent job doing this in neighborhoods. He was just describing to me out in the lobby about opening up a home where there was some neighborhood angst, and they had a barbecue and invited the neighbors, and so it's those kinds of neighborly things that can be done to help with the neighborhood issues.
That's really good, because I think in my district people would want to know and be included.
Yes.
And you probably ought to have a designated person in your office that we can call when they call us.
Are we going to know as you're citing these homes, the locations?
We'll absolutely let you know, of course.
Before? Is there a public are you approaching the neighborhood before the home is cited or after?
After.
Supervisor, the part of the difficulty would be they need to secure the house and get the lease in place. And if they wait to do significant outreach to the community to make sure that they're welcome there, they may lose that lease opportunity. So it's kind of a chicken and egg sort of situation.
Sounds familiar.
Yes.
It sounds so familiar.
Okay.
But you'll let us know before.
Yes.
Not necessarily before you.
As soon as they sign the lease.
As soon as we know where they're going to be, regardless of where it is in the lease signing process, we will let you know.
Well, then, if there is a problem in that home after you lease it and you fill it full of people and the neighborhood has a problem, you will deal with it. You'll remove that person from that house.
Yes.
Immediately.
Yes. We're going to try our very best to manage the situation.
I mean, hopefully there won't be, but.
Correct.
Okay. Well, that's comforting.
It's as important to us as it is to you that we are good neighbors, because if we're not good neighbors, we can't use these homes for this purpose. And right now, that is our option. So we're very committed to being good neighbors so that we can house these homeless individuals that need to get off the streets. And then I also want to reiterate, this is an interim solution. We will continue to look for sites, and then we will assess whether this is a better option or we want to move to a site. So we can still explore other options. But we feel really strongly about this now so that we can do something.
It seems just from a personal level, a smaller one would be spiritually more healing, but that's just my personal opinion.
All right. Anything else? Not Supervisor Kennedy.
Yeah, I just wanted to make the statement that I probably asked fewer questions than most, and these are all very good and necessary questions because of my experience in dealing with this model. I mean, I've been talking to Cindy about why don't we do more of this, and we kind of accidentally ended up doing it. It does work. I know that there's angst on behalf of the board. There should be, but my experience with this model has been very successful. That's why I asked the loaded question, the leading question of Mr. Foley, and that have you had many problems in the neighborhoods? Because in my experience, it's been flawless. I mean, as you said, these are human beings, so nothing's perfect, but I'm looking forward to this as an experiment that, should it go well, I think will be a permanent part of our long-term solution.
Okay, thanks. Not a lot of questions. I think a lot of the things that may have been on our minds were asked respectfully by different members of this board. I would just offer a suggestion, though, that as we move forward, certainly to keep in mind, obviously, the need to be successful on a number of different fronts, just as you've outlined, for the people we're trying to serve, for people who have made their own personal commitments in neighborhoods and certainly in the community. And again, it's not going to be perfect, trying to make those matches. But I do think that the scattered site approach and with the proper management and oversight can be successful on a lot of different counts. And I think it'll be incumbent upon the professionals as we make assessments about how folks are receiving services and whether it's appropriate for the placement for some of the folks who are tougher to serve. And that's what we're looking at. I would just say, to the point one question I was going to ask, and you touched on it, that if folks have sex-related offenses, and we know that, we need to be very, very careful. And I'm sure, obviously, whether it's John's program or anybody else, we'll look at that, because I think that probably more so than even the drugs and alcohol or behaviors might be a bit erratic because of mental illness will become a immediate concern. And so I think we just need to be careful about how we deal with that in that residential setting, because then that presents different than maybe an institutional setting where you might be able to get some separations because just of where you physically cited that. So I would just offer that as another observation that I'm sure you've given a lot of thought to. Man. Okay, I don't have anybody signed up on item 37. So is there any other comments by board members? Do you need direction around this? I think you want us to adopt this then?
Yeah, yes.
Okay. All right.
Move the item.
Okay. Been moved and seconded then to approve the staff recommendation with the direction as outlined. And funding's in place. In fact, if we don't spend it pretty soon, you're going to have money left over. Okay.
Only November.
All right, that's right. It's only November. Okay, weather's turning on us, and so let's. Nothing else. Please vote.
Ms. Peters? Unanimous vote. Okay.
All right, and again, appreciate people's patience. We're going to continue to work down through the items. On item 38, I go ahead and call that item. We may have. Try to keep this a bit abbreviated. I want to hear from folks in the audience. We've got a couple of incoming bits of information, and I think we can take that into account and maybe even come back quickly. So, Ms. Peters.
Item 38 is the Mather Revenue and Expenditure Workshop.
Okay. And we're going to make it probably a shorter workshop than we may have anticipated, and I think take board comments, take our audience comments, and we can come back on this. I know we have another item where we have audience members that are interested, and then we have an off-agenda item as well. So we should get to this pretty quickly. Okay. Troy.
Fair enough.
Do you want me to go through the full presentation, or would you?
Well, you had a slide presentation. Maybe you can at least touch on some highlights. I don't want to shortcut it because you're bringing board members up to date. People have had a chance to read that. There's a report out there. You have folks here on some specifics as it relates to that, and I think you get some board comments and maybe some direction out of this today, and we could actually have you come back before the end of the calendar year and actually have done with maybe some of the items as well. So
I think one is towards the end of the calendar year. There's part of it which is a long-term disposition of property too.
Right.
So I want to keep both in play.
Without throwing you too much off base here, Kelter, if you could, get to your presentation, and then we'll take the public comment and get board member questions.
Sure. Fair enough. Troy Givens with the Department of Economic Development. It's a pleasure to be here. We had scheduled a workshop for May 3rd. We'll try and abbreviate that according to the schedule you just outlined. Our intent today is to provide the board with an overview of properties the county owns, receive some direction on preference for future property sales, discuss timing and future of property sales, and discuss any projects that may be discretionary that the board would like to provide direction on. I believe we're going to shortcut that process a little bit and take board comment, as well as any members from the audience. So with that in mind, we'll talk just a little bit about how we accepted some of these properties. We are now 25 years post-closure from the former air base. We've spent a great deal of time repositioning the base from a military installation to a general aviation airport, upgrading infrastructure, of course, replacing jobs that were lost with the base closure, and integrating the former base into the community. The properties highlighted here in blue, which we'll discuss at a later date in more depth, were transferred from an economic development conveyance from the federal government in 1997. We have properties here outlined in green that were properties that were transferred from the federal government in 2013. Each sets of those properties that were highlighted in blue and highlighted here on the screen in green have a 10-year reinvestment requirement from the time of their conveyance from the federal government, where proceeds are required to be spent back at the base for infrastructure and job generating related activities. As you would note doing the math, the 1997 requirements have expired. The 2013 requirements for these properties that are highlighted on the screen are still in place. So we have a number of properties that we can talk about at a later date regarding their disposition. There are 5 in the short or near-term property phase. We have 1 property that is expected to close towards the end of this month, which is a 17-acre piece of property that has about $2.95 million in proceeds that we sold to the Veterans Administration. The properties highlighted here on the screen, and then properties that we will discuss as you've outlined at a later date. So with that, I think it might be best to forward to board comment and then any public comment as well.
Okay, just briefly, and I want to get to the folks that want to weigh in on this. I know we've received correspondence from the City of Rancho Cordova, as well as I know we have some of our representatives of our veterans organizations here. And I would just note that I think it's important that as we talk about property disposition, because that certainly has a financial component to it, but also has a future utilization component. And I think we've been very thoughtful, working prior to the incorporation of the City of Rancho Cordova, but since then as well, about land uses both in the Mather Commerce Center, but certainly on the entirety of the former base property. And as you mentioned, Troy, being 25 years, nearly 25 years post-closure, we're still somewhere along the ways in reuse and conversion, and both the economic development conveyance properties, but other properties that came under other conveyances to the county or county entities or other entities, including Cordova Recreation Park District received a property at the front for some of the uses there, the Mather Golf Course, the Mather Lake. I mean, there's been a lot of different exchanges of property, including the airport itself. And I guess I would just want to highlight that part of the commitment has been not just for the financial piece of this, but the reinvestment, as well as obviously long-term uses and their compatibility. And thus, I think we'll, the discussion today. I think obviously bringing board members up to date should they not have some of that background detail, and kind of going forward, because as I raised the issue in budget deliberations earlier this summer, that when we receive the proceeds from that sale, it's been plugged into the general fund, consistent with obviously any conditions that no longer restrict that money. But I think there's still a lot of work to be done, and there's a lot of opportunity out of Mather, and I think we have the ability to partner, as we have in the past, with either private and or other public entities and concerns and organizations. And I would be hopeful that, because of the late hour today, maybe we don't get into as much detail on that, but that we can come back at a very near term and have some more focus on that, particularly in light of some of the comments that we've received both in writing and maybe added to. But I think also some of the opportunities still exist. And I guess lastly, I would just say that as it relates to the request by City of Rancho Cordova, we'll hear in a moment, but there is, I think, some time frames that are important that relates to that particular request. And there are obviously others who would like to see us do certain things and either hold properties off this immediate sale. So I would just say there's some of these that I'm not prepared to go forward, at least this board member isn't, without having further conversations with county staff, with organizations, and the City of Rancho Cordova about those opportunities before we just go off and sell them on the open marketplace. So, agreed. I don't know if there's any other questions or comments at this juncture. If not, we can take comments and any feedback from folks. And I know I have 3 people signed up to speak. And we have Ricky Carikas with our Veterans Organization, Stephen Heisler for City of Rancho Cordova, and I believe Bert McChesney as well. So, Ricky, thank you for your patience along with others in the room, and appreciate you being here.
Chair and Board of Supervisors, thank you so very much for housing us today, or hearing us today. Hope everybody had a restful Veterans Day. I know I enjoyed some free meals with my wife, so greetings. I'm the Vice Commander of Post 709 of the American Legion. My name is Ricky Carikas. I met with my previous Post Commander, Mike Hughes, and I'm also here with Ben Robinson and Melvin Buzzer, previous Post Commanders of 10-125 of the VFW. We are your newly elected young Mather Veterans Memorial Hall Association. We are slowly trying to formalize ourselves so that we can speak on behalf of all of the veterans organizations in the local community. The mission of the Mather Veterans Memorial Hall Association is to secure a location for veteran organizations to meet, plan, and execute community enhancement projects to serve both veterans families, and the local community at large. It's our vision to collaborate with the city, the county, and state governments as we try to secure grants while coordinating fundraisers and seeking private sponsorship. The justification: the veteran service organizations of Rancho Cordova and the Mather Field have tirelessly served this community without a place to call home. As of 1 November of 2016, we have served over 130,000 patients at the Sacramento VA Medical Center at Mather through services such as wheelchair ambassadors, concierge services, call reception, personal visits, and we even have a program designed and aimed to ensuring that no veteran passes away alone. These services are not possible without the thousands of hours from our hundreds of volunteers in our veteran service organizations. Unfortunately, we do not have a central location to collaborate in, to run our meetings, to store materials, maintain a phone number and a mailbox, or even just host a fundraiser to enhance life in this region. It is the position of the Mather Veterans Memorial Hall Association that with a central location, we can better serve our community and help this region take care of the warfighters who have sacrificed so dearly to live in a country free of tyranny. We're currently executing a 3-step process to achieve short-term, mid-term, and long-term goals. The first step is preparation, paperwork, and legalities. Us being a young organization, the Mather Veterans Memorial Hall Association has successfully completed all the requirements from the Internal Revenue Service in obtaining a 501c19 and receiving an EIN number. We have also successfully established a corporation number from the Secretary of State, and we're currently working on our Constitution and bylaws. The second step is the goal. In order to get the community focused on a goal of building a Veterans Memorial Hall, we would need to have the physical address for the potential future site that we can focus the community support towards as we come together as a region to build and fundraise. And then finally, step 3, the means. Once we have a location, we can begin to modify floor plans and meet specifications and an estimated overall cost and set targets for fundraising. Our goals, short, mid, and long term. Our short-term goals, 6 months to 1 year, is to hopefully get a veterans headquarters. This could be something as small or as simple as a room that we can have access to plan and organize. This would give us a small central location to set up proper communications. The hope is that it would be large enough to host our meetings and potentially house some of our materials. This could be a vacant room already in existence, either in the public or the private sector. Our midterm goal is hopefully 1 to 3 years, to perhaps use a building temporarily while we secure a location. We've observed several locations in the area that are vacant, and perhaps we can house those areas while we wait for a transition to happen. This building could be private, or it could be a public building that we could use while in transition, perhaps a portable on public land. The idea is that it would be large enough to host meetings, set up an office, store materials, and perhaps even host a fundraiser. And then finally, our long-term goal that we're aiming to achieve between 3 and 5 years is to establish a permanent building dedicated purely for our veterans, where an entire veteran community can come together and work towards community enhancement. We would want this space to be large enough to host large meetings, fundraisers, and provide office space, and have storage for essential materials. In closing, the Mather Veterans Memorial Hall Association is committed to this community and to this project. It is our dream and our ambition to ensure that every veteran and family member not only have a place to gather as a community, but that these gatherings provide us with an opportunity to serve here at home yet again. I'll take any questions if you have any.
Any questions? No, I don't think so. Thank you, Ricky, for summing that up. And again, it's certainly appropriate to be here today to, I think outline, some of the work that you're doing as an organization to get prepared for, I think what's on your list there of things that we'd like to achieve. And I know that you've had some conversation with the city, certainly visited my office, and I think we have some opportunities, certainly with some of the land holdings, to look at, some of the, I think, prospects for what might be the future. So, we're not going to conclude anything here today, but again, we'll be back shortly on this item with some additional work. So,
I appreciate that. Thank you.
Thank you so much. Okay, I have Bert McChesney and then Stephen Heisler. Stephen, excuse me, Stephen. I said Stephen.
Thank you. Good afternoon, Honorable Chair and Supervisors. My name is Stephen Heisler with the City of Rancho Cordova. Also here with me is Bert McChesney with the Veterans Resource Centers of America. VRCA is the developer and manager of Phase 2 and services provider for all 3 phases of Mather Veterans Village. Also here is Stephen Dawes with Mercy Housing California. He's the developer and manager of Phases 1 and 3. We are here today in support of the goal to end homelessness in our region. We appreciate the decision the board made last week to provide additional funds to the whole person care effort. As we look forward to the positive impacts of that program, we must continue expanding the amount of housing with services available to this population in order to maximize our success. The Mather Veterans Village is a project well on its way to doing just that. For those who don't know much about the project, it is a 3-phase, 150-unit, permanent and transitional housing project for our region's chronically homeless and disabled veterans, located at the former Mather Air Force Base, just 1 block away from the Veterans Administration Hospital. To give you a quick update on the current status of the project, Phase 1 of the 3-phase project is complete and successfully operating. Its 50 units of permanent supportive housing were completely filled in less than 30 days after opening, and it has been running smoothly ever since. Phase 2, which is the 48-bed transitional housing and services heavy component of the project, is moving steadily forward with its final architectural work, but it still has a funding gap. Phase 3, consisting of another 50 units of permanent supportive housing, has received a low-income housing tax credit award, and we are anxiously awaiting the final pricing of those credits and our construction bids to determine if full funding has been met. We recognize and want to thank you very much that Sacramento County has been an integral partner to this project so far. Your help with providing the property an initial $1 million grant, support for obtaining Housing Authority rental vouchers, and other funds has been instrumental in moving this project forward. I want you also to be confident that the City of Rancho Cordova is doing its best to complete this project. To that end, in the last few years, the City of Rancho Cordova has provided millions of dollars of project grants, loans, fee reductions, grant application support, and support for, I'm proud to say, not one but two legislative amendments that made millions of dollars of additional funding possible for the project. Truly, we have gone above and beyond to help our veterans. In closing, this is a project that was started nearly a decade ago, and here we are today on the very edge of completion. The last two phases are shovel-ready, and your support for the requested $1 million today will significantly aid us as we continue to shoot for a construction start date of spring of next year. Thank you for your consideration, and I'm happy to take your questions.
Great. Thanks, Stefan. Any questions of Stefan? I think it's pretty self-explanatory, and I know there is some time sensitivity. I've certainly shared that with our staff. They're aware of that. So stand by. We may have some questions yet, but I don't have anybody punched up. So, Bert?
Thank you, Mr. Chairman. Bert McChesney. I'm with the Veterans Resource Centers of America. And to reemphasize what Stefan said, we're very close to being able to start construction. We've secured for phase 2, 2 rounds of state VHHP money, Home Depot Foundation money, Department of Finance grant through the city, the strong support of the county. And it's been challenging because that's the transitional and service component for all 3 projects. So 46 units of transitional housing and the ability to bring in a lot of service resources that otherwise would not be available in phases 1 and 3, but we can use to complement those. But it's a much harder challenge to get the capital funding because you're can't use tax credit financing, can't use affordable housing program funding, you can't use MHP funding. So there was a lot of resources not available to us. So it made it much more difficult to put the final funding together for that project. We're doing the final budgeting for it now. As Stefan said, we have a bit of a budget gap. We're also a little uncertain as to what's going to happen with construction costs, given the fires, given the hurricanes. All that's going to increase our cost with phase 3. As Stephen can share, we've gotten tax credit financing approved. We got a VHHP funding approved for that. So both projects are right on the cusp of being able to be completed. And thanks to the great support of the county and the city and all the other partners that we've had, including the American Legion, whose team helped provide a lot of the furnishings for phase 1. So they've been an integral part. And I'd like to offer, we have a meeting room available at Mather Village now that you guys would be able to use in the interim if you need it. So we do have the space, and they've been great partners to that project. So happy to answer any questions you might have.
No, thanks for that offer, Bert. I guess for either you or Stefan, very briefly. So what is, from the time frame, and I know Stephen's here from Mercy as well, when do you need to have a knowledge of a commitment on that gap funding? How soon? Yesterday?
Basically yesterday. That's the final piece of the puzzle, and we'll need that in order to secure our construction loan. That we have to be able to demonstrate to the construction lender that we have all our financing in place, and it's that last piece that we're missing to be able to complete that.
Okay. Let me just turn to you, Nav. So if we, if the board wanted to have this back before us, say December the 5th, where you can examine, I mean, you just received a letter, we're aware of the request, you have been for some time, and in light of the sale of the property, we haven't received those proceeds yet. Obviously, that's been plugged in for budgeting purposes into the general fund. But again, we knew this was on the horizon. That's one of the reasons for the workshop. There's more to explore about other sites and their disposition, but this is probably the most critical. Is that something? Do you believe you could be back at least by the 5th or the 12th? So, again, with them needing to know that in order to go forward, and some decision by this board, assuming that there's a willingness to consider that, I think it needs to be pretty imminent. So.
Yeah, we can bring something back. Most likely by the 12th, we need to study the request. We got the letter. We know they verbally have told us what they're requesting, but we want to look at the nature of the request versus financial commitment. So I will look more towards the December 12th date to come back.
Okay, which would be basically less than 4 weeks from today. So, and I would just say that again, we've invested and reinvested very heavily at Mather, and I think it's important. And with this, if we're a partner, in addition to obviously having made available some land in the past, and obviously worked with the city and with our developers, we get additional permanent supportive housing into the inventory in a place that is already permitted, anticipated, and ready to go. And I think that's really important to the long-term prospects of some of the things we talked about just a moment ago on the item, and moving people to permanent supportive housing or permanent housing, as well as the transitional component that'll be a piece of this as well. And I think those beds, in addition to the community campus, I would just lastly say that this is immediately adjacent, as everybody's aware of, it's on this board and staff, is adjacent to Mather Community Campus. We've made significant investment in general fund dollars there to preserve that program, and for not just veterans, but obviously for homeless in a transition mode. And I would think that some of the revenues, whether they be current ones or in the future, that campus is in need of a bit of a refresh as it relates to, with the new development next door. We're looking a little worn around the edges there. Doesn't take anything away from the program success. So I think as a part of this, I'd like to certainly have some examination about that. And today was to kind of set the table for this discussion. So, okay, I don't have anything else for any questions of any of the folks that have presented. Okay.
Thank you.
Thank you. Those were only 3 speakers, and again, this is very abbreviated. I think there's a lot more focus we could bring to discussion about sites. Do you think, and I'm going to ask you about some agenda management here, but again, this has been a long time in waiting in coming to this board. I was very intent, at least as board chair, to try to get this to us. Obviously, we have a very imminent issue, but there's other discussion I think we ought to talk about as relates to the endowment for the preserve, and some of the other future uses out there, including some commitments to complete some improvements. I would like to give it the due attention that I think it deserves, but we're not going to get that this afternoon as we approach early evening. So I'd like to work with you on the agenda for the 12th, and put this early enough in the agenda where we could have that conversation.
Yeah, I just would caution, we'll work on agenda management. 12th is getting to be fairly packed with other items. It's the end. This could end up going to January, but we do want to have that discussion with you because there's some big policy issues that we want some direction from the board.
Okay. Well, and maybe you could break those apart then. Then if you're having the bigger workshop, it's one thing about, the request that's before us on the housing, which may have some shorter triggers that, don't coincide with a workshop talking about more broadly the issues that have been outlined in the staff report and that Troy talked to. So again, I would be certainly interested if we needed to kind of break those out with the request for the permanent supportive housing contribution here. So, and then obviously as we look to the veterans request and some other things as property dispositions and use of those properties, working with the city. So. You think you can get back to on the one request by the 12th?
I think the main, what I heard today is there's a desire to get more detail from, forgot the gentleman's name that just spoke, about the request for $1 million. We're going to work with him.
Stephen Heisler on behalf of the city, yeah. And Mr. McChesney on behalf of
and then we'll
services.
come back to you on the 12th on that particular request.
Yeah.
I'll work with the clerk and with you, Supervisor Natoli, on the broader discussion that we want to have today. When can we bring that back and have that conversation?
And then we can continue this discussion about the unrestricted versus restricted funding and disposition of properties and the investment potential for some of those monies.
Correct.
For some of the needs that we've identified here. So, okay. Well, again, in light of the time, I would move that we continue this workshop, I guess, abbreviated workshop.
Let us just bring up a new time. I need to manage the agenda for the 12th. We will bring it back on the 12th. It's just I don't have all the items in front of me. I don't want to get in a situation.
Okay, so you can bifurcate it, though. I'm okay with continuing with the workshop, but as far as the request on the Mather Veterans Village.
Yeah, it's bifurcated. Okay. Just that one item, we'll bring that back. Okay. If we have time on the 12th, we'll put the other items on.
Okay. All right. Is that understood by then, everyone? Do we need a motion to that effect? Or you want to?
No,
okay, so that's the direction, and so we will be back on the 12th relative to the Veterans Village. We'll be back potentially on the 12th or right after the first of the year on the broader discussion about properties and some of the site utilization and so forth and disposition of those properties. So, okay, is that okay with folks on the board? See head nods? Okay, very good. Well, thank you for your patience, and we'll see some of you back on the 12th and others back maybe there or thereafter. So, all right, that takes us then to item 39. Again, a long-awaited item today, but I know there's been folks in the audience who wish to address this board on matters that we're going to hear about here today for some time. So if you want to call.
Item 39 is the amendments to the Locke Foundation bylaws.
Okay, and we do have several speakers. If there are others who didn't sign up, you're welcome to. I have 4 speakers, and we'll take some staff report and some board questions, and then we'll go to our speakers. So.
Good evening, Chair Natoli, members of the board. Rob Leonard, Deputy County Executive. This evening we bring to you proposed amendments to the Locke Foundation bylaws as brought forward by the Locke Foundation itself. Section 15 of the current Locke Foundation bylaws state, and I'll quote, any changes in the number, tenure, qualifications of directors, or any change in the composition and or representative groups with directors shall be the subject of approval by the Sacramento County Board of Supervisors following a public hearing on the proposed change or changes. And so as part of your consideration this evening, we do need to conduct a public hearing on the proposed amendments to the bylaws, again, as brought forward by the foundation itself. We're also presenting a recommendation that the board consider directing the county executive to assemble a multidisciplinary team to conduct a public forum in the town of Galt as we've preprepared for this.
You meant Locke.
Town of Locke,
you can go to
I'm
Galt
sorry.
if you want to, but
I'm sorry. The town of Locke, as we learned of a number of issues related to sort of general county business and jurisdictional responsibilities associated with Locke, and a number of items that aren't related to county jurisdictional responsibilities that really aren't the subject for county engagement, but there are a number that are, and so we're suggesting that the board consider directing the county executive to conduct a public hearing in the town of Locke. I'm going to make some brief background comments, and then with the concurrence of the chair, ask Stuart Whitehall, who's chair of the Locke Foundation, to come forward and walk the board through the proposed modifications to the bylaws. Locke is located in the Sacramento Delta, approximately 30 miles south of downtown Sacramento. The town was built in 1915 after a fire destroyed the Chinatown area of the city of, or the town of Walnut Grove. Since at that time the California Alien Land Act prohibited Chinese from owning real property, the town was built on land then owned by George Locke, and building owners leased land under their buildings on a month-to-month basis. Due to the unique status as the only town in the U.S. built exclusively by Chinese for Chinese, Locke was added to the National Registry of Historic Places in August 1970 and was designated as a National Historic Landmark in 1990. As currently reported on the Locktown website, the current population of Locke is between 70 and 80, and approximately 10% of that population is Chinese American. In 2003, the Board of Supervisors took a series of actions to subdivide the property in the town of Locke and combine the ownership interest of the buildings with the underlying land. At that time, the board also created 2 nonprofit organizations, the Locke Management Association and the Locke Foundation. The Locke Management Association, which we are not focused on tonight, as no modified bylaws have come forward or being presented to you for consideration. The Locke Management Association owns, manages, and maintains common areas including residential streets, parking lots, the garden area, and walking easements. The Locke Management Association also levies and collects monthly assessments from property owners to cover maintenance and operations and liability insurance. The Locke Foundation, which is the subject of this matter this evening, has a purpose of educating the public about Locke's history and legacy, and solicits donations and grants to preserve the cultural and historic significance of Locke. The Locke Foundation staffs the Locke Boarding House Visitor Center and provides docent-led tours, maintains oral histories, and organizes special events, among other things. So with that, in the concurrence of the chair, would, unless there are any questions, ask Stuart to come forward.
Let's see if there's any questions first of anything in the staff report. Just one, by way of background, when they were formed, both the foundation and the Management Association, for the purposes as you outlined them, there was a certain construct, though. The membership was basically to be reflected nearly identically or identically. Could you just run through that? Because, again, we may hear, and again, not to lose the focus on how this matter gets to us as it relates to the foundation, but I think that's not unimportant. If you could just, there is a chart in the staff report, but maybe you could just briefly address that so there's an understanding about
I think at the highest level, in response to your question, Supervisor Natoli, the two bodies that I mentioned had the same body serving. The same individuals served as both the Locke Foundation and the Locke Management Association, and do do so to this date. They served as the two different functions, two different sets of bylaws, two different functions, but the same people, same composition, just essentially wearing different hats. And as I understand it, at times on a given evening, both bodies would meet. One meeting would close and then the other meeting would open. So two different bodies, same composition. The proposed bylaws that are before you this evening change that. They do propose, the Locke Foundation is proposing to change the membership of the board of directors of the Locke Foundation. So I could walk through, if you'd like, the table.
I don't know if that's necessary. I think, though, as it relates to governance and certainly the Management Association responsibilities as initially called out for, and then the foundation's responsibilities initially called for, we've got copies of that. But I do want to I want to ask council very quickly, because there's been a lot of correspondence, some as recently as this afternoon, and it continues to come at a pretty steady rate. My recollection is, Robin, that in the information, and that council has advised that under the current construct, that irrespective of what private counsel might tell folks, that our council has opined that the Brown Act was to apply for the open meeting laws and for conduct of business, both the Management Association and the foundation. Is that accurate? And maybe you could elaborate, because I've been instructed that we're going to probably hear from some folks who see that differently, both the foundation board members maybe, as well as some citizen members. I want to be clear about what our advice has been, though, relative to that. So
let me back up a little bit.
Sure.
So as this town from 1915 was transitioning from private property to an incorporated entity that has an incorporated township that has private property rights, not just a single landowner. The board worked through with SHRA and consultants to set about finding the metes and bounds and the designating the streets and the public areas that would be public, and identifying the properties that would be available for private property ownership. In doing that, CDBG money was used. And I think that's an important thing, because that has a public purpose requirement. And here we're establishing private property rights, yet having the sidewalks and the streets and those things that are part of a normal town that usually evolves over time with those things set aside. So what was set up in these two organizations is the organization that would be its own governance for its public purposes, for its public areas, and what the memorials and those kinds of things would be done, and then essentially an HOA that would help organize how they want the town to look and how they want the town to be managed. As it was set up with CDBG money, it was required that those public purposes be conducted like a public entity. Yet it allowed for a 15-year transition period. So yes, it was set up that it would be a Brown Act governed body, but it does allow for, and as long as the county and the state Parks Department were part of those governing bodies as they were constituted, it would be mandatory that the Brown Act is followed, but it does allow for some transition over time to an entity that's independent and stands alone. So as we transition out of it with its bylaws changes, that may not be mandatory as it goes forward.
Okay, but heretofore, up to this very moment, when that applies and should have applied, and that's what council has offered, and so, because again, I know I've...
That is correct, but they have council and they have responsibilities unto their constituents as their membership requires of them.
Right, but to what you said, though, formed utilizing public monies for the disposition of helping to map the town, to unite the underlying properties with the structures above, and to marry that with the private ownership of a number of buildings and other facilities, but also the county still has a role. I mean, incorporated or not, in town.
A very minor role at this point.
Well, no, I'm talking about generally. We still do building inspection. We still do code enforcement.
Oh, sure.
I'm talking about, when you talk about an incorporated town, those services, they're not charged for them. They're just as if they would provide for any other Delta town that's not incorporated as a municipality. But I just want to be clear, because I know that the question has been posed. I've seen correspondence. I've seen what council may have advised the foundation, and over the last year and a half, that they could take their meetings. They didn't have to publicly notice those meetings and so forth. In my view, has been and will remain, unless you tell me that there's some other legal parameter that would have allowed those meetings to go to that particular, to not have to conform to the Brown Act, because that was the way this was formed. And until these bylaws are amended, if and when, then that still applies, right?
Applies, and it would be for those persons in those meetings to answer as to what took place.
Right, but I'm not saying yes, but I just said, but the LMA and the foundation were and are required as of this moment, unless we change that, and I understand we have the ability to change that, to conform to open meeting laws and to public records acts and to posting meetings and so forth. So
that's how it was set up, yes.
Okay, thanks. Okay. Thanks, Rob. Okay, I don't have any other questions, and now we have some folks. So, Stuart, if you want to come forward and.
Thank you, Rob. Good evening. I know it's been a long evening, and hello, especially to Chair Natoli. He's been a good friend of Locke. I kind of, in the report that you've received, you have a lot of the changes and whatnot that we've brought forth, and hopefully I can clarify some of the whys. The Locke Foundation, and to clarify something that was just brought up, we have not for years operated with the same boards. We've had a mixed board. And this goes well back into the period when Supervisor Natoli's Chief of Staff, Pat Brazil, was on both boards. This is something that's been going on for a long time. Again, we're a town of only 70 people. There are two boards with 13 chairs open. And it could be quite a burden for someone to serve on both boards. Initially, the Locke Foundation was a very little sister. We had no funding. We had a budget of zero. We had zero in the bank. And whereas the Locke Management Association pretty much has guaranteed income through assessments and whatnot. But as the years went on, the Locke Foundation did start doing many of the things that we wanted to do in our mission goals, and that's primarily to educate the public and support the town of Locke. So we started having our Locke Asian Pacific Spring Festival, which is our signature event of our town, like the Rio Vista Bass Derby or the Cortland Pear Fair. We constructed our memorial park, and which houses our memorial and the tile project. And in 2006, when the state parks bought the old boarding house in Locke, they refurbished it and opened it as a unit of state parks. And through contract negotiations, the Locke Foundation took over the responsibility of keeping the boarding house open 4 days a week, maintaining the inside of it, getting insurance for the directors. The Locke Foundation continued to grow. We opened up a membership, put out our historic walking tour, put out our newsletter, and getting farther and farther away from what the Locke Management Association is, which really is as Rob Leonard mentioned, they take care of property in town. Locke Foundation has nothing to do with it. We're a charity that's charged with education. And now we do the Chinese New Year celebration out there. We funded signage. We just expanded, we being the Locke Foundation, expanded our scholarship program from 3 to 4 this year. We have docent-led tours, etc. We grew, our coffers grew, and individuals that initially served simultaneously on both boards through attrition and interest some of them decided they may want to be on the LMA board, some wanted to be on the Locke Foundation board. And then the question I dealt with Ms. June Powles-Mays a lot about is, do you have to serve on both boards? If not, if you serve on one board, can you serve on another? If you serve on one board, can you not serve on another? And Ms. Mays did actually work with me on the bylaws and actually gave me quotes to put in specific areas, clarifying who can sit on the board. The seats mandated for both boards initially, which were 3 residential seats, 3 commercial seats, 3 Asian organizations, state parks, historic, at-large, and then Sacramento County. Those seats have suffered with the foundation, and I'm going to speak only for the foundation here. We only have 1 of the 3 residential seats filled. We have 2 of the 3 commercial seats filled. We lost one of our Asian organizations that wanted to participate in the Locke Foundation. State Parks opted not to seat someone on our board because they were worried about conflicts of interest. We don't have someone with historic expertise. And then, of course, Sacramento County has not opted to seat anybody on our board since Pat Brazil's retirement. Mm-hmm. So we only have 7 people on our board now, but we can't have any more people on our board. And we have people willing and wanting to be on our board that already volunteer for Locke Foundation activities. They sit at our boarding house, they lead docent tours, etc. They want to be on our board, but they can't because of the makeup of our board now in these mandatory seats. So what we'd like to do is cut our board down to 11 seats max. Make the mandatory seating 2 commercial, one of which would be a liaison with the Locke Management Association. Cut it down to 1 residential seat, representing the residents of the town. 2 Asian organizations, and I've lost my train of thought on the last one. So what we have is 5 mandated seats and 6 at-large seats. So And we're really after separating the LMA from the Locke Foundation. The Locke Foundation would like to operate as a traditional 501c3. And we've hired a lawyer to help clarify this situation, especially regarding the Brown Act. And when this lawyer is the signature on our original Articles of Incorporation and is one of the main lawyers that helped put the original community advisory report together on Locke back in 2003. And he simply states, no, we're not associated with Sacramento County. We received no funds from Sacramento County. Sacramento County doesn't seat anyone on the Locke Foundation board, so we're not subject to the Brown Act. It really wouldn't be that big a deal. I mean, transparency is not an issue with us, but we have issues with people who are simply attacking the Locke Foundation. So we just want to be as effective as possible. So I had been working with Ms. June Powles-Mays for the last 10 months, but the thing that really put this whole issue of changing our bylaws up in the front burner is I'm also in discussion and negotiating a new concession contract with California State Parks and rewriting our operational plans and our interpretive plans. And as you all may know, California State Parks is going through their transformation period. There's new designations, new requirements as far as money and whatnot goes, and Locke Foundation is moving along with them and trying to develop what's called a cooperating association with them. They are not comfortable with the Locke Foundation not having a resolution of our association with Sacramento County. So we can't move forward with our contract with state parks until there is a resolution. So
Stuart, is there any time sensitivity relative to that contract as it relates to the state? I mean, obviously, you've had the relationship, so I mean, again, it's not a matter of weeks or anything like that. Obviously, you bring this matter before us for a combination of reasons, but is there any particular time sensitivity to that? Did the contract expire when, the end of this calendar year?
we've been going year to year.
Okay, we're going year to year already. So,
Yeah.
okay.
And it's a very slow process.
Okay.
So I would like to point out one thing. Locke has been a lot of headaches, I know, for you guys and especially for us out here, but Locke is extremely special. It's a place that Sacramento County really can be proud of. It should be one of those places like Old Sac or whatnot, when you have friends and family come in, take them out to Locke. It's a mind-blowing experience. It's a jewel, and it's significant on a county, state. It's got national significance. It's a national historic landmark. It's got internet. It's the only rural agricultural Chinese American community in the United States.
Still remaining.
And the Locke Foundation is the only organization whose principal goal is to advocate for the town of Locke and preserve its history and to educate the public about it. And we just want to be as effective as possible. I hope this
I'll only
doesn't-
correct you on one thing. I frequently take family from out of town to Locke. I never take them to Old Sacramento.
Very good. Thank you.
Okay.
Keep bringing them back. And I bet you they like it too. And it's getting better. It's getting cleaner in the front, the main streets, the back. There's many other projects that the Locke Foundation is trying to do in reference to the history and culture, and the Locke Genealogy Project, the history, the building genealogy, the Locke Centennial Photographic Survey of the whole town. We want to expand our oral history program. And I want our relationship with the county to be a good one, rather than be a constant source of headaches. You know, regardless of how this goes today, we will still have, obviously, with a town like Locke, have a lot of overlap with the county. So I'd like to encourage you all to vote for the change in bylaws. So thank you.
Thanks, Stuart. Any other questions, Mr. Walthall? Okay, good. Stand by. We have some before we're done. But okay, thanks, Stuart. All right, Mr. Leonard, anything else you want to add before I go to public comment?
No, nothing to add.
Okay. All right, I have a number of folks signed up, about a half a dozen, and I'm going to give 3 minutes to each speaker. James Motlow, Russell Ohms, I'm taking these in order they were given to me, Deborah Mendel, Rhonda Maiden, Lisa Kirk, and Martha Esch. So James, you're up. Good evening.
Good evening. Thank you for this chance to speak. I am James Motlow, co-author of the book Bitter Melon, Inside America's Last Rural Chinese Town, which features oral histories in my photographs of the residents of Locke. Bitter Melon was named by the Commonwealth Club as Best California History when first published in 1988. It's now in its 6th printing, and I brought each of you a copy today in order that you may use it to enhance your knowledge of Locke. I lived in Locke for most of the 1970s and was fortunate enough to return in 2010. Today it is my community and my home. For the last 3 years, I've been the treasurer of the Locke Management Association. I want to offer my support with the proposed changes to the Locke Foundation bylaws. I also want to offer my support for the Locke Community Forum. As treasurer of the LMA, I would like to give you a bit of background of some of the challenges faced. The LMA is currently composed of 31 members who own 51 properties of commercial and residential buildings plus garage. In addition, there is the Boarding House Museum that is owned by the state and one building that is owned by the LMA, which is currently under contract to be sold, for a total of 53 assessed properties. Of these current 31 members, 15 live in Locke and 16 live elsewhere. When I started as treasurer, there were 4 members of the association who were refusing to pay their assessments. Following our CCs and Rs, I worked with 3 of them to pay what they owed, which was collectively over $10,000. In the end, all 3 were settled in small claims court in favor of the LMA. The 4th is an estate of the deceased owner, and I hope to deal with that estate this coming year. My position is a volunteer one that I take very seriously. I want Locke to be healthy. My involvement in Locke is no different when I lived in the 1970s, when I and my non-Chinese neighbors, like Russell Ohms, helped our elderly neighbors with home repairs inside and out, water and sewage repair, general town maintenance, and providing transportation from everything from doctor's visits to food shopping. We did this all because it was the right thing to do and because we loved our neighbors and the town. That same sense of giving back is what propels me to give up the hundreds of hours of my time that being treasurer has taken. What has been difficult is the nonstop continuing lies, disruptions, and half-baked fake news that flows forth from a single individual whose stated goal is to bankrupt the LMA through endless litigation, whose claim that the Locke was a global village and should not be designated as anything special, who wants the LMA dissolved and the CC&Rs rewritten to her own liking. Well, the courts have sided with and awarded the LMA every step of the way. The true history of Locke still prevails, and the LMA still has the support and backing of the vast majority of the members. I worked with Leo Goto in the county, in the Sacramento Housing and Redevelopment Agency in 1970, and all of its public meetings concerning Locke. Currently, I, along with the LMA board members, have been working with June Powell Mays, supervising deputy counsel, to how best to address, to respond to the endless, baseless attacks about our procedures. We have met with you, Mr. Supervisor Don Natoli, to also discuss best how to address these attacks. We deeply appreciate their knowledge and their input. With that, thank you for letting me share my thoughts, and I hope you enjoy my book.
Thanks, James. I have it already, thanks. Okay, great. Next, Russell Ohms. Russell. And then Deborah.
Yes, my name is Russell Ohms, and I'm the current chairman of the Locke Management Association. I've been the chairman before years ago. I just want to say I really heartily endorse this change in the bylaws for the Locke Foundation. Earlier, when we would have 2 meetings in the same night, the first meeting might go on for, I don't know, till 11 o'clock, and then we'd adjourn and then open up the next meeting. And by that time, it was like, okay, let's get out of here. So what we did is we separated the meetings. But that was a problem too, because as we said, we had a 13-member board, and people were driving sometimes 60 miles one way to get there. So it meant 2 times a month they would have to come to Locke. And the River Road is not a very nice road at night, and a lot of our members are getting older, and well, luckily the fog is gone, but they were driving back in the fog. So I'm going to try to stay and speak just to this agenda item, and that is the foundation. So it's going to be wonderful for them to operate as a separate entity, really. We will have accountability because whatever monies they get and any decision anything they want to do in town has to come through us. We will also have 1 member for certain on the board to report back to us. And it'll give them the freedom to get help from outside of Locke, because Locke has 74 people, and it just doesn't have the bench. I mean, like a football team, we couldn't even do a football team. I mean, we couldn't do a volleyball team. I mean, there's just not enough people that will volunteer. And was what James was saying, it's quite onerous what we face from one person. And I don't know what to do with that. I don't know what you can do with that. But for 6 years, one person has been on a mission to destroy us. I don't want to stay on topic. I'm going to speak hopefully afterwards to explain it. But I heartily endorse it. I look forward towards it. And I believe Stuart and the membership he will gather will really be a benefit to Locke. Thank you.
Thanks, Russell. Okay, Deborah. And then Deborah's followed by Ronnie Maiden.
Good evening. I'm Deborah Mendel, and I am currently on the Locke Management Association Board of Directors. I'm also the secretary. I also live in town, and that's my home, and I own several properties in town. And I'm here to express support for these changes. I used to be on the foundation, but as Stuart expressed, it's been difficult to be on both boards. I was the secretary until last December when I resigned because I'm just up to here with the volunteer work that I do for the LMA Board of Directors. So it's a lot of work, and since the LMA's been in a litigation, we've had to let go of a property manager, and the volunteers like myself, we wind up also be taking on property manager type roles. Lately, I'm the fire lane parking enforcement lady. Noticing when someone's parked in a fire lane, putting notices on people's cars. This is stuff that a property manager would do. So we've got our hands full. And the work that Stuart has done as chairman of the foundation and the other directors that still remain on the foundation is obvious in their revisions. It's come time. I had no idea about this 15-year transition thing. I'd love to know more about this because I didn't even know about this. So we appreciate, though, the LMA appreciates that there is one line, maybe more, in our bylaws, the LMA bylaws, that says that the boards shall be the same directors. So we would be happy to address at least that, as soon as possible. We're not prepared to do any revisions in the immediate future on the LMA bylaws. But this is a great thing. It's going to open it up. I know a lot of the volunteers for the board, and I know some of them have chomped at the bit, hoping that they could actually participate more than as volunteers, that they could sit on the board and have even more input. And it's just been nothing but good stuff. And I've got 50 seconds here. I just want to show you what the board has done. This is Locke Foundation. Locke Foundation's gotten roadsides, road signs rather. Whoop. These were really important, something that we couldn't get done for ages, and I think it's the treasurer of the foundation, Eileen Leong, she finally made that happen. We've got a beautiful marker from the Native Sons of the Golden West that's in a common area in Locke, and just recently they translated that placard into Chinese. And I live in Locke. These people are always looking at this stuff in town, and it's just great what the foundation does. Just expand it, approve these changes. I think it's going to really work out well.
Thanks, Tara. Okay. Just a question for Ronnie. So where's the call out for the 15-year transition? Is that in the bylaws?
It's in the board packet from April 8th, 2003.
I'm just trying to find it. That's why I'm asking right now. I'm trying to
and Robin, I don't believe that was necessarily hardwired into it. There wasn't a hard calendar set. As I recall, the language dealt to essentially it was expected that with the construct that resulted from the action in 2003, that as the organization stood up and moved forward, there would be a certain sort of maturity, my word, not a word that was in the report, of those organizations, and that it was expected that modifications would be made as they stood up and started to establish independence.
And it was to establish the board assurances that the CDBG money would be paid back within approximately that amount of time.
Right. Yeah, I'm not contesting. I just didn't see where that's at. So maybe somebody could find the particular point. And I will hear from other speakers. I heard you say that, and I know it was referenced in Deborah's comments as well. So, okay, Ronnie, come forward. And then following Ronnie, I have Lisa, and then Martha.
Hi, for those of you who don't know me, my name is Rhonda Lee Maiden, aka Ronnie, which is how Don knows me. I'm actually was a full CAC member for all of the years that it took place. I'm a founding LMA board member. I am a founding Locke Foundation member. I'm no longer on either of those bodies. It interests me. What Stuart said about starting with zero is true. However, immediately upon becoming the Locke Foundation, they receive funding from 3 different Chinese organizations. About the proposed changes, I would really like the people of Locke to participate in discussions about this. The people of Locke are left out of everything. The board members behind me, the LMA board members behind me, 2 of them live together. One of them is a renter of the other. A 4th, who's not here, bought a house from one of those 2 people. When they state that one person is making all of this unfounded trouble, that's not true. There are several people who've moved out of town because of these folks. I would really like you to pay close attention to what is going on. I was on the board for a year. I went off and then was asked to step back in. I kept insisting that Brown Act must be followed. I was shouted down for years. When I was off of the board, from the audience, I said Brown must be followed. I was told it did not, and it was not, for years. I also said that Davis Sterling must be followed since we own land in common. We were specifically not supposed to be an HOA. There were many people who were against us being an HOA, but we still own land in common, therefore Davis Sterling does apply. Again, I was shouted down about that. Before we make any changes at all, the people of Locke should be consulted. We should start having open meetings that people aren't afraid to attend. And that doesn't happen either. Don, that first year, before we became the CAC, well, the 2.5 years, that first year that we were holding meetings in Locke, just in the transition process, and afterwards, we had committees, not based with board members, but of people in the town. We had a garden committee of people who actually gardened and people who were concerned about it. We argued. We got all of our fights out there in that little forum so that we could come up with recommendations. That doesn't happen anymore. The people of town of Locke are left out of much, much, much of the things that go on there. Yes, they've had the Locke Foundation has had some nice events, so I'm told. I wasn't told about them before they happened on many, many times. I wasn't given a notice or asked for my recommendation for people to be on the board. Please think about this carefully.
Okay.
Thank you. And please check into the stuff that's going on with the LMA.
Okay. Thanks, Ronnie.
Oh,
Okay.
as usual, I'm an hour and a half late for my class at Sac State.
Sorry about that.
Hi.
Okay.
Lisa Kirk, I've been a
We can
business...
write you a note if you need be, Ronnie. So.
A business owner in Locke for 12 years. And I did look forward when I first came to town about it progressing. And I know the foundation has done some great things, but what I wanted to see was the streets improved, the walkways repaired. We have a walkway that has a hole that a child fell in the other day. And these are the things that I thought a nonprofit could do. We went to Tesher, one of the Chinese organizations went to Tesher Construction, asked if they would get involved in helping to do maybe some sidewalk repair. They said, you know, you guys are in the middle of all this litigation, and didn't want to help. Before you close down the foundation, maybe you should have a meeting with them, a joint meeting, and involve the state about what you can do to improve the common area walkways. We invite tourists everywhere. This just isn't about the back. It's about all the people in the front walking up and down. And the city of Ileton got sued over a similar situation. So, you know, we need to pay attention, and I don't want to see it separated at this point. And if you do separate it, you know, we need to have some input on, I don't need to be appointed as a business owner by the directors. The business owners there can appoint their own people. The nepotism needs to end. Do not take that clause out. Arbitration needs to put in there. Yes, we've had litigation because arbitration was not in there. And we're not even discussing the association, which is a part of this. We have to discuss the association and the fact that it comes under Brown Act and is an H&O at the same time. They just sued someone under HOA, but you really did a public taking of someone's property under a public entity. So, you know, we'd like to see the litigation end. We'd like to move the town forward, but it's created such a rift. And I was told early on, I was an invitee. That's the way the CCNR and bylaws explain who I am, and that I had no rights. So that does put me aside. But I have an interest, and I do love Locke, and I do love what I do there, and I love all the people that come there, but I want it to be safe. So before you start changing everything, maybe sit down and have a meeting about the association and the foundation, because if you make the foundation private, then as far as getting grants to do improvements or to buy buildings, does that just fall on the association? And can they get those grants if there's not a foundation attached to them? So I think there's a lot more to look at this, and I would appreciate a town meeting that includes the foundation and the association. And as far as CBG money being paid back, I think they had $60,000. I don't think it's been paid back. And if you're talking about the money that bought the property underneath those people's houses, I don't think all of that's been paid back either. So you might want to look at that. And the fact that Brown Act, I never thought the foundation should follow the Brown Act, and you guys need to do some ratification of the appointments of the association. You've let that go, and because you've really not had oversight, we've gone into this horrible lawsuit that I hope someday will end. Thank you.
Thanks, Lisa. Okay, Martha. Martha's the last person signed up to speak on this. Good
evening. Thank you so much for all the hard work and long hours you guys put in. I don't know how you do it. Could you put some of this up here? Thank you so much. I am the person who bought the property back. I'll try to keep this on task here. Okay. I have a You can't talk about the Lock Foundation without also talking about the Lock Management Association, because they have duplicate bylaws, duplicate board structure as prescribed, 13 chairs, and duplicate seating. 3 of the seats are designated with a racial requirement, and they are both public boards. That is wrong. It's wrong. It's discriminatory. It's unconstitutional. And the makeup of the current population of Locke is about 80% Latino people. How about we get some board seats for them if you're going to designate racial requirements for matters that, board structure for matters of our town. Duplicate bylaws. More time is needed to allow due process for the residents and homeowners of Locke and Locke South to be properly notified and given the opportunity before you make any changes to this Locke Foundation Board regarding removing voting rights or the rights of the public to attend their meetings and other Brown Act mandates. Walkways. Locke Foundation has preservation purposes as well as the Locke Management Association. They've got that is duplicated in their purposes, preservation. So, and the 2003 document that you folks sent me under my CPRA request, 1720, shows a 2003 Locke document that on the bottom of page 26 states that the Locke Management Association shall maintain the sidewalks and public walkways. Lisa Kirk mentioned that there's a gate, a kid fell into a hole the other day. There is a huge 6-inch wide board missing in the walkway next to Al the Wops that's been missing for several months now. And and there's cracked sidewalks all over the place. The Locke Foundation, together with the Locke Management Association boards, they took it upon themselves to remove the cement sidewalk on Lot 159, which is a common ground area, and replace it with tan bark. Now this was, and they created a trip hazard coming over to my ice cream parlor. They removed the ADA access that I had installed at the property that they sued me for, and they continue to now bill me for my violation of not being their prioritized race, which is in their both bylaws. But they removed the ADA access, and they recently built a fence and installed 2 great big brass plaques that completely block off the wheelchair access to that property.
Martha, you need to wrap it up. I know there's been a lot of history. You've been before the board, but it's equal time here, so I'll give you another minute. Let's go.
Okay, thank you. Need to remove the discrimination from both sets of bylaws. Article 5, Section, I believe it's 9 or 10D. Remove that discriminatory clause that gives both boards a mandate to consider the ancestry as a factor in the assignment of right of first refusal. Remove that clause, because that's what they took my property away from me for, and now their lawyers want everything else that I own. So I might be living in a refrigerator box soon, and I'll be coming to your board meetings speaking for homeless rights if that happens. Please allow everybody a meeting before you make any changes to the Locke Foundation. Dissolve the Locke Management Association. Its purpose was gone long ago after the land transfer was made, and Locke does not need a homeowners association for 31 property owners and about 50 people living there. Cortland gets along just fine without, we don't need the double taxation in Locke of $1,400 a year to pay for no services whatsoever and trip hazard, fire hazards. Thank you.
Okay, thank you, Martha. Okay, that concludes the speakers. I ask my colleagues any questions of staff at this juncture. Ms. Ross.
I want to clarify that I understand this is kind of a new, all this is new to me. This is not an incorporated city, it's a corporation through the Secretary of State, basically.
Correct. It is not an incorporated city.
And so we were involved until 2015, at which time it kind of concluded our involvement as far as having ownership of any properties. All the properties were sold back to the owners in the city.
That actually occurred back in the early 2000s. That was part of the, it occurred a bit over time, but the properties were united. A lot of the land was held by,
lease.
Yeah, they were leased, and so the buildings above were owned by residents and business owners and other property owners, but the property underneath was, as outlined in the staff report, that was part of what we did, is united the land and the structures as a part of that, and then folks were able to own both, and there was purchase opportunities at the time we actually did the transaction. Some of that didn't occur right away, but most of it did. So that was part of the part and parceling of the.
So basically, what they're asking is to change the structure of the board and separate it out so that the Locke Foundation manages the business and the Locke Management Association manages the properties, the care of the, it's kind of like CC&Rs and property management. Is that correct?
That's correct, with the foundation looking to make some changes in the defined composition of the body, existing bylaws versus proposed bylaws in the process. But
so they don't all have to be members of the Locke Management Association to be on the Locke Foundation board.
That's correct.
And okay. And
may I clarify?
Okay, yeah, sure.
The Locke Foundation doesn't have anything to do with businesses, and most of what we heard here today is Locke Management Association. The Locke Foundation is not involved in any lawsuits. We have nothing to do with the buildings, the sale, the right of first refusal, assessments, any of that. We don't make any decisions regarding those. We're a 501c3 charitable organization.
You're the Locke Management Association.
This is the Locke Foundation.
Oh, the Locke Foundation is the management, is the 501c3, and the Locke Management is the 501c6.
Correct. So the Locke Foundation doesn't have anything to do, although with what Ms. Kirk said regarding fixing sidewalks and making the town safer, the Locke Foundation certainly could have, as we grow, the ability to deal with these things. But when it comes to the nuts and bolts of the land and whatnot, that's Locke Management Association stuff. We're a foundation.
You're a nonprofit.
We're a nonprofit, yeah.
But the Management Association receives the annual membership fee or assessments.
Yeah.
And they put that money back into
donations.
the town to make the town better.
They manage the.
And you want to operate as a nonprofit and move forward as a nonprofit.
Correct. The only funds we get are what are donated and what we make on events. We don't have any responsibilities for maintaining the physical part of Locke.
And the only thing noticed today is the foundation.
The foundation wants to clean up their side of it and not be so connected to the LMA.
Correct.
Okay, got it. Thank you.
Thank you.
Okay, thanks. I'm going to just weigh in here with any other questions that, and certainly I appreciate all the testimony. I know folks in the audience certainly have all been a part of not only the conversation, but the work and the efforts and even some of the back and forth that's occurred in the community. But I think the initial establishment was not only well-intentioned. I think it was something that was very, very important to bring the ownership of the buildings and a lot of the original either descendants of the original residents and of the town, and allow those property rights that were excluded going back to early part of the last century to wipe away that particular scourge and to allow the ownership to be in the rightful hands of those folks who had the buildings and in a lot of cases maintained, lived there, raised their families there and such, and certainly the businesses that were conducted from the time the town was established up until this very moment. But clearly the creation of this, and I appreciate certainly Stuart's explanation and offerings here as on behalf of the foundation, but this is entangled a bit by design. I think there was the overlap and some expectation. Again, it was not tried and proven as it related to self-governance. Obviously, structure mirrored both foundation structures, nonprofit structures, but also management association. But I think it was correct. It wasn't established as a homeowner association. It was a management association. There was all this discussion about common ground and about common usage and some appreciation for the aesthetics, as well as obviously some of the intended improvements, many of which have been put in place over the last 15 years. And I'm going to suggest here for today's purposes, again, that's why I asked Stuart earlier about any time sensitivity on the boarding house. I think that as I've talked with Mr. Gill and certainly Mr. Leonard about this, that I think certainly there can be a separation. I mean, they are created with a structure that links them, but I think some of the discussion about management activities, as well as obviously the foundation and their direction, reflect difference of opinion. We've heard some of that here this evening, and I think having a town forum, so Nav, I'm going to look to you. We can certainly bring in purposes of bringing this multidisciplinary team, but I think to have this discussion in that setting, and again, I think we need to be clear about what's before this board, and the fact that anything that relates to the LMA would have to be initiated at the LMA level and come back to this board as well. But I think for purposes of proceeding, that having that town forum, and hopefully we'll get a place big enough to hold all interested parties, and to have that discusussion, to have a date to come back to this board, certainly with keeping the consideration for the foundation request for change in bylaws. But I think that it relates to governance too, that the state opted out of the LMA some time ago, and as Stuart pointed out, they opted out of the foundation. The county has not made an appointment since Pat Brazil left county service, and she was not just my appointee, she was the county's appointee. And I think that we need to sort through those things a bit. Again, we can't change them of our own volition, but I think some direction from this board is to having the town forum, the community forum, and let's have the conversation here. Again, we may not hear anything different than we've heard here today. We might, though, as being a setting where it's certainly probably more comfortable for folks to come and speak their mind. And then I think, to try, get this on a path where some of those issues can be addressed. And obviously we have a specific request on the foundation, and I'm not going to ignore that, but I don't necessarily feel compelled to have to act on it here this afternoon. I think what we ought to do is have this community forum, and then we can recalendar this particular request, and it may be accompanied by other actions as well. But I think in order to provide enough information to not only me as immediate representative of the area, and again, I will say this for the record once again, that Locke is a very unique place. It's very special. It has a lot of character. And people have some very deep affinity for the community in which they live, in which they conduct their business, and for all the history that's been written about and the history that's made there every day. And I'm very appreciative of that and of the events and the highlight, and I think the international stature that community has. But it's also a place where people reside and conduct local businesses and so forth. And I think that this approach to self-governance, I think, was done in a very thoughtful, deliberative way, and we looked at how that was going to be part and parceled out relative to 6 and 6, and then those 12 making the selection of the the other party on the LMA, and linking the LMA and the foundation, not necessarily in perpetuity, but certainly as a part of the effort to move the improvements forward to provide for that governance and representation, both at the local level, but also recognizing that there was interest from other organizations because of the cultural and historical relationships and appreciation for all that brings to that community, but also then with the state because of the ownership of some of the land and obviously the boarding house and other lands that are adjacent, and then obviously the county's involvement. So that was done with clear intent, and I think with the expectation that we certainly could revisit that as it evolved. And it's not, again, it's probably appropriate that we're here at this point in time. I didn't know about the 15 years, and I'm still wondering what that is in the staff report. But nonetheless, we're here. We're almost 15 years later, and for whatever successes, and there's probably a lot of those, and any other challenges, I think it's appropriate that we have a town meeting. We can get calendar this for January or February to come back for the full consideration. But I think as a part of that, to have a conversation then about the other side of this, that's not necessarily the request before us, but obviously relates to the LMA, the representation there, seats that are unfilled, and what that presents from difficulty, and a very small number of folks to draw from. When you look at it, whatever that count is, it's not even 100, and think that people are going to continually step forward and expect that they would do that. That's a lot on the residents and the parties, the business owners, and so forth to expect that. But that was part of the challenge, I think, of the piloting of this governance structure. So I'm going to suggest, Nav, and I don't know if how soon we can get that meeting put together. I appreciate the notice that was given on this, and obviously those that were interested and able to be here were here. But I think we can expect that probably if we convene that, and maybe we convene the two bodies with a duly noticed discussion, and allow for sufficient time for input and have that discussion right there in the community. I think it's appropriate. I'm prepared to attend that, and I would encourage you and others to help put that together. So that's kind of where I land this evening, and I'm not looking for a long delay, but I think it's appropriate that we have that meeting first. So
we'll work on that meeting.
Okay, would you think that we could do it before the Christmas holiday?
We will give it an attempt.
Okay, so we're going to see if we can do this in the next 4 to 5 weeks.
If not, it will be early January.
Okay. And again, get a place that's accessible in the evening that doesn't conflict with other things, and we can continue this item. I'm fine with we actually putting it into a date in late January.
Let us come back with a date. Well, let's get the meeting scheduled. We can announce the date.
Okay.
Make sure everybody knows when we're coming back.
Because I'm not looking for long delays. Just for everybody's purposes here, this has been a bit of a delay getting to us for a variety of reasons. And requests from the foundation came in many months ago. We've had requests to have issues in lock discussed at our level, and there's been, it hasn't been this energy around it. So I'm going to, again, I think certainly with deference to my colleagues and the hour, ask that we do that, and let's set a goal of being back here within about 8 weeks, 2 months, being back to this board, if not sooner, and certainly have a community meeting as soon as possible, and not to conflict with the holidays, and then we'll go from there. So, any other?
Is that a motion?
That would be my motion.
Second.
Okay.
Can I just ask?
Oh, I'm sorry.
Can I just thank the author?
Yes.
Is it Mr. Motlow?
Hello. Yep.
And I wanted you to know this is a beautiful book, and I love to read, and I was wondering if you'd consider signing it. I knew once we voted you would probably be on your way home.
That comes
and I have
cost.
a library, so I will keep this in my library. It's in line, by the way, behind about 10 other books that I'm supposed to be reading. But thank you.
Okay.
Yes.
All right. So, yes.
Mr. Chairman,
yeah.
I apologize. I was assuming you had one of the tickets saying that I was going to speak on.
Yeah, we have that. We're going to get to you next year. SEIU. Yeah, we're getting there. We're just concluding this item, and we're going to come to you right next. So, thank you for your patience. So, I would move that we continue the matter, and we'll bring it back. We don't have a date certain, so we're going to continue to.
Not date certain, I think, but I get the direction is to try to get the meeting going. In December, come back to you in January.
Come back in January. That's the intent of the motion, is to bring this back, and with the benefit of the input of the community meeting. So, okay, that's my motion. Have a second? Second. Okay, please vote.
Unanimous vote with those members present.
Okay, and thank you all for being here this afternoon, this evening. Have a safe return to your destination, and we'll be down in Locke fairly shortly, so thanks. Okay, with that then, we do have some off-agenda speakers, and I know some have had to leave, so I don't know if you were the kind of designated spokesperson after most of the folks had to leave, so you can just, we can give you
My name is Mikhail Faruqi, and I'm a disabled person who resides in Ms. Peters' district. I have with me Ms. Tabitha Otterson, who is my care provider under IHSS. I noticed a large amount of distress here by members of the board about all the issues of homelessness and drug addiction and alcohol use and the lethality of the people who use alcohol and drugs, and all these issues lumped together. And I wish to bring to the board's attention that there's something backing this up, which is the disabled individuals and the IHSS care providers. Because what we have here is IHSS providers who are struggling to provide the services that disabled individuals need, faced with an increasing rent situation here in Sacramento because we don't have any rent control ordinances, unlike other metropolitan areas like San Francisco and Los Angeles. So we have investors moving in, buying up property, raising rents, putting the disabled individuals under stress. I wish to speak for a disabled friend of mine who has a tiny studio apartment which they're now demanding $900 a month for, which way exceeds his Social Security payments, struggling to get it paid through SHRA. On the other hand, the IHSS providers who get sometimes 20 hours, sometimes 30 hours worth of time at $10.80 an hour, which is even less than a lot of the proposed minimum wages in areas like Portland, etc., are expected to pay rent, feed and clothe their families, and provide in-home services for us disabled people. We've got a confluence of events that could possibly result in disabled people not receiving these services, not receiving the help they need, being pushed onto the streets, being made homeless, seeking self-medication through street drugs, which a lot of them have done, given up on the system altogether, hiding under bridges, because they don't want to come forward, that they've been exasperated by the lack of help they got. And on the other hand, you have in-home workers who see that the shortage of funds in order for them to be able to have a reasonable wage, a reasonable contract, has prevented them from providing services to us disabled individuals, which on the other hand makes our living situation a lot worse, and has a potential of either having us evicted from our homes or having the IHSS workers being evicted from their homes. And I'm sure with the county's distress over homeless situation, crime, drug dealing, and alcohol abuse, and people camping out on the parkway and camping out in McDonald's, and this sort of stuff going on, I'm sure you'd recognize that a stitch in time here would save 9, and that the wages of the IHSS workers and the availability for IHSS services for disabled people is of great importance to prevent a bad situation from getting worse. And so I wish to stand here and speak on behalf of the SEIU and of disabled individuals, one whom I'm myself, and on behalf of the workers, a lot of whom were here today and had to leave because their disabilities and their workers' time limits had expired. They had to go. And I thank you for your time, sir.
Well, and thank you for staying. Thank you for speaking on behalf. I know of, again, a great number of people, probably, 75 or 100 folks that were here earlier today. And obviously we speak on behalf of those who receive the care, but also the caregivers as well. And I know we are in negotiations. I know that some of us have been visited by some of the representatives from SEIU and some of the caregivers, and as well as those are recipients, and appreciate you highlighting those issues because, again, they're very real, certainly for you and for this community, and we'll certainly take that into account as we continue to work through the contract for our compensation for our IHSS workers. So.
I appreciate the board's time.
Thank you very much. Did you want to speak?
I didn't write a paper.
Well, you can come on. That's all right. Well, you're the last two remaining, so.
Well, I've been an in-home care worker since.
So just tell us who you are, if you don't mind.
My name is Tabitha Otterson.
Okay.
And I've been an in-home care worker since 2007. I have had various clients with different disabilities, different challenges that would have loved to, stay in their home and not have to be in a hospital or a hospice care, which those are also good too, but I think the program is important because a lot of the times people don't have family or close friends around, and so even I'm going back to school to do further certificates and stuff because I know a lot of people might not be certified as like RN nurses or CNAs, and so I guess they're understanding why the income is 1080, and I know they were trying to say, hey, well, are we able to get, you know, a higher rate of pay because we do all the grunge work, we do different things of, you know, assisting people to their appointments, to cleaning up after, you know, to making sure that they're taken care of. So it's a great job, and it takes a lot of time and effort and energy, and I wouldn't change anything for the world of my choice because I've done retail, I've done janitorial, I've done a lot of stuff in my work experience. So I just appreciate that there is a program in place. People can depend on other people, and other people are there, and their heart is there for people. So I just appreciate that that program doesn't get cut because there's been words saying, oh, well, they're trying to cut the Medi-Cal, they're trying to cut the program. So it's got everybody high-strung, and yeah. So
Okay, well, thank you for staying for what you do and for certainly making the choice to serve others as you do. And again, I think both of you speak to obviously the importance of it from a couple different perspectives. So,
thank you.
Okay, thank you very much. Okay, and Jeffrey Tardagia, I guess Jeff had to leave. Jeff left. Okay, so anybody else that I missed? Oh, yeah, sure, Mr. Holmes. Okay, you're welcome to speak. Sure, off agenda.
Okay.
Okay, Russell.
I've been thinking about this for a year, so this is a year in formulation. As I said, I'm the chairman of the LAC Management Association, and we're just a nuts and bolts organization. That's all we do. We're simple. We're volunteers. We're not paid. We don't write our checks. All our money goes to an accountant. They write the checks. We look at them, make sure they're signed, we sign them. That's it. There's no subterfuge. There's no hidden agenda. We post our meetings. We follow the Brown Act. It's difficult to follow the Brown Act, but I like it. I like to play stud poker open-handed and watch people bet. I'm not into these guys who are like this. I'm not that guy. I'm also a chairman who likes to run meetings. I like to facilitate, get everybody involved. For 6 years, we've had one person successfully use the county agencies against us, and we get no help. She is called the health department, the zoning department, the building department, the code enforcement, the DA, the sheriff's department, the county council, the Fair Political Practice Committee twice, the grand jury, and HUD. It cost us $5,000 to defend ourselves against HUD. The DA, multiple times they call us. We're constantly writing letters. We're a formal body. What are detention? Yes, sir, no, sir. And this person, it's like being in a ring with no rules. This person's like, we're queens, okay, we have to no hitting below the belt. This is an MMA fighter who's kicking us, defaming us, lying. I mean, there's a great quote, give a lie a 24-hour head start and the truth will never catch up. And what do you do with a lie? There's nothing, it's a zero. There are no two sides to this. You have a lie on one side and the reality of the truth on the other. That's not two sides. And most of us are human beings. I always believe in two sides. Oh, what's your side? What's your side? But while one side's totally made up, what do you do with that? So I'm frustrated. I mean, I can't tell you, I live with Deborah, who is the secretary, and she'll spend 4 to 6 hours a day answering. For example, we've been given a bathroom. Well, that bathroom it's an attractive nuisance. Drug dealers are in there. There's drugs, there's clean, there's blood, there's clothes. They smash it, they break the windows, they start fires in it. We had to repaint it. They break the locks. And then she'll schedule for a lock. And, okay, meet the guy, he doesn't show up. Meet the guy, he shows up, he doesn't have the part. Meet the guy, oh, get the part, wait for mail order. Oh, wait. One little problem. I mean, and this goes on and on. There's no end to it. And I don't know what you can do about it. I know that the bureaucratic bodies are formal and they're required to answer. But, when you get letters from the DA, again, she posted her agenda 72 hours. We're rigid about Brown Act. When I was chair, I had he's still, no, he's gone. I had a lawyer for 5 meetings explaining the Brown Act. I've read the Brown Act 3 or 4 times. But when it comes to answering it, I don't know. They say, well, that's not Davis Sterling. Well, I'm not a lawyer. You're lucky. This is a nice meeting. You have a county council, you have lawyers, you have a sheriff in the back to protect you. We have none of that. This person brings in big men who are angry, who met her on the street, made us out to be monsters, and they sit there like this. And it's horrible. The meetings are horrible. The reason there's no one on the committee, no one wants to be on the committee. No one wants to upset this person. So, I talked to an owner yesterday. He wants to, at first, right of refusal. He wants to sell his building and get his brother off. They're 50-50, but he doesn't know he can afford it. So he wants a 25% share sold to somebody else, so he gets some money out of it, and he's going to buy his brother out. First right of refusal. Does it come into effect? I don't know. What do I do? And we've been involved with a 6-year litigation with this person. It just goes on. She appeals. What do we do? We're stuck. We're committed. We're not backing down. We're going through. We can't help but do that. That's what happens when you get involved in litigation. But I don't know. We don't get help. When she calls, I swear to you, the county's down there in a day. We get a letter the next day. We get a phone call immediately. While a person's fixing something, the code enforcement shows up. We called on parking on Main Street, and the sheriffs came. This is not our road. Then it was a car. Her car is abandoned on Main Street. It hasn't moved in 6 months. She's blocking a whole business. And she won't move it. And the sheriffs say, well, we don't have time. No, we get no help. We had an abandoned car from actually the woman who spoke. She abandoned a car on our property for 10 years. We called code enforcement. They finally came down. We finally kept calling them. So she moved it a day late. So they fined who? Us, $438 because it was on our property. This is the kind of relationship we've had with the county for 6-7 years. We don't get help. We're alone down there. We're a small body. And these laws, we're in court. This is litigation. We watch what we say. We're under constant attack. And the negative attitudes, fell on the back. He moved out of town. He doesn't even live. He shows up to attack us. I don't know what to do. I don't know what you can do. I don't know. But just to tell you, as I said, this has been a year inside of me to come before you and speak. And it's kind of nice that we're here, just us. But it's really nice to see a meeting well run. All the questions are intelligent. They're well thought out. You had time. No one shouted you down.
Well, you have to come back because that happens pretty frequently.
Well, the meeting today was great. So anyway, thank you for allowing me the time to get that off my chest and let you know what's happening in Locke. We volunteer. I've got probably $25,000, and I'm not exaggerating, in tools. I bought 2 tractors. I have a bulldozer. I have a zero clearance mower. I mow the lawns. I rototill all the gardens in the spring for everybody. I bought 5 weed eaters, 3 weed eaters because I couldn't find one that would keep running. Husqvarna 4-cycle, the best. Everybody borrows it.
You got your shameless plug in for the Husqvarna.
Anyway,
thanks, Russ.
That's it. And I believe in the town. I've lived there off and on since ¡73. I knew everybody that James knows. Everybody in that book I knew. I talked to them. So it's just hard to watch people just attack us and on lies. It's all made up, and it's an attitude that... Anyway, thank you for listening.
Thanks, Russ. We're going to have a community meeting. We'll be down shortly, so thanks.
Okay, great. And hopefully show up with a sheriff and a moderator who's very good at quieting down. So
Mr. Gale will be the moderator.
So make sure you have somebody there who really is really expert in dealing with that kind of issue.
Thank you. Okay, gentlemen in back. I think it's our last off agenda. And then good evening.
My name is Ernie Wester.
Ernie.
For the last 14 years, I've been a resident of Locke. I just moved out last January. I was a member of the LMA board from 2011 to 2013. And I could sit here and spiel at you that there are no 2 sides. There's not the right side, the lie and the truth. There is the truth, and there can be multiple lies going on at the same time. So I can stand up here and lie to your face. Someone else can stand before you and lie to your face. How do you distinguish the truth? What I come before you to ask is that you, as a board, send out yourselves to talk to the people of Locke, but also if you could send out a questionnaire to every single property owner in the town of Locke and ask them to rate the performance of the LMA through all the years that it has been in existence. And also send out a questionnaire to those people who have sat the board asking about their experience being part of the LMA board. Do you know that there are 5 people that stood up and walked out of the building frustrated at their experience on the board and refused to finish their term? There have been vacancies since 2011. Have you been informed? It's falling apart, and the town has no respect. That could be a lie on my part. I'm asking you to be diligent and do some homework and really look into the situation in the town of Locke and what can happen to improve the governing of that town. Thank you.
Okay. Thanks, sir. Okay, that's the last speaker for today. Then we turn to Mr. Gill. Do you have any announcements?
Nope.
Okay. All right, colleagues, starting with Ms. Frost. You have
appointments?
Chair, we have appointments.
we do have appointments. Yeah, I mean, item 40. Okay, we can do that.
Okay.
I know you're also eager for that.
So item number 40, you are continuing to December 5th, the Adult and Aging Commission, Children's Coalition, Rio Linda Alberta Community Planning Advisory Council. Continuing to December 12th, Cemetery Advisory Commission, County Service Area 4B, Slough House, Wilton, Consumnes, County Service Area 4C, Delta, Consumnes Area Community Planning Advisory, Fair Oaks Cemetery District, Local Child Care Planning and Development Council, Sacramento County Redevelopment Successor Agency Oversight Board, Sacramento Environmental Commission, and the Vineyard Area Community Planning Advisory Council. And for today, you have 5 boards to consider nominations. Cordova Community Planning Advisory Council.
Okay, District 4. Did you have any?
I'm Orangeville.
Okay. But you have a District 4 seat that's...
all my others are pushed to 1212.
Okay, all right. And then for District 5, I would nominate Gloria Mattis and recommend waive process and appoint. Okay, moved and seconded. Please vote.
Ms. Frost, can you cast your vote?
Just for Gloria Mattis. Okay.
Unanimous vote with those members present.
Okay. Next is the Disability Advisory Commission.
Disability Advisory Commission.
Okay, I have the chiefs have asked for some additional info on recruitment process, and they recommend to continue all these to January 9th, 2018.
Okay. Next is the Orangeville Community Planning Advisory Council. Supervisor Frost.
Judy Berger.
Okay.
Nominate Judy Berger.
And I have a note that you want to continue the remaining to December 12th.
Correct.
Okay. And then Public Health Advisory Board, Supervisor Natoli.
Yes, I have a note that the interview is pending with one of the applicants. We continue that to December 12th.
Okay. And then we have the Sacramento County Mental Health Board, Supervisor Cerna.
I'd like to nominate Marina Padillo Castro and waive the process, please.
Okay. Second.
And then please continue the remainder to January 9th.
All right.
Okay.
Please vote.
Unanimous vote with those members present. And then Supervisor Frost.
For
Mental health.
Mental health.
I do not have communications, so I'm assuming continue to 1212.
I do have some notes which show to nominate Mark Rogers.
Okay, great. You're one step ahead of me.
Okay.
Thank you.
No problem. And that concludes your nominations.
Okay. Any other matters that come before us before I go to board members? That's it? Okay. Supervisor Frost, any?
I do not. Thank you.
Okay. Mr. Kennedy? Nope. Mr. Cerna? Commissioner Tully? None. Okay, we will then adjourn until December, I guess, 5th, and we're going to load up the agendas for the December holiday. Okay, with that, then we are adjourned.